Call this special meeting to order. If you would please stand, we're going to say the Pledge of Allegiance. And I'd like to respectfully ask, if you're wearing a mask, that you put it over your nose and mouth. Wear it properly, please. Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. There's a preamble to the state of Missouri, and it goes this way. We, the people of Missouri, with profound reverence for the supreme ruler of the universe and grateful for his goodness, do establish this Constitution for the better government of the state. And if you join me in prayer, please. Lord, today we seek you. We seek to understand the will you have for us. Lord, you've given us so much. You've given us your Bible, and much of our law comes out of the Bible. We ask you to help understand that. In Christ's holy name we pray. Amen. Madam Clerk, please call the order. A roll.
McConnell. Vitus.
Here.
Simmons.
Here.
Akers.
Here.
Gaines.
Here.
Milton.
Here.
C.
Here.
Your Honor, you have a quorum.
Thank you. The regular agenda. Madam Clerk, would you please provide the introduction for this item?
Your Honor, this is the first reading bill number 5837, an ordinance amending chapters 58 of the Branson Municipal Code pertaining to face coverings, public spaces, and the spread of communicable diseases.
Thank you. We have a staff report from Chris Lebeck.
Good afternoon, Mayor, members of the board that are present. I'm going to remove my face mask since it's pretty close to being properly socially distanced.
And just let me make a comment. When people come to speak later, you can take your mask off to speak into the microphone. But we ask you, there are wipes there, after you finish, to wipe the microphone off and the hands, just so the next person coming. Thank you.
Thank you, Mayor. A little bit of background. A lot has changed this week. I lead with this quote from Dr. Robert Redfield of the CDC. He came out on July 13th, Mecklenburg County, North Carolina. He was very blunt. He said, if all of us would put on a face covering now for the next 4 weeks to 6 weeks, I think that we could drive this epidemic to the ground in the country. He went on further during that press conference to say the most powerful weapon we have that I know of is wearing face coverings. The most important thing that I could ask the American public to do is to fully embrace face coverings, to fully embrace careful hand hygiene, and to fully embrace social distancing. And then yesterday, the single largest retailer in the United States, Walmart and Sam's Club, mandated face masks in all their stores, or face coverings as we like to call them. And then in their press release, they stated, as the number of confirmed cases has spiked in communities across the country recently, so too have the number and types of face covering mandates being implemented. Currently, about 65% of our more than 5,000 stores and clubs are located in areas where there is some form of government mandate on face coverings. While we're certainly not the first business to require face coverings, we know this is a simple step everyone can take for their safety and the safety of others in our facilities. And they go on to say further in their press release that according to the CDC, face coverings help decrease the spread of COVID-19, and because the virus can be spread by people who don't have symptoms and don't know they are infected, it is critically important for everyone to wear a face covering in public and social distancing. As I said initially, this is a fast-moving item facing this country. This morning, CVS, Walgreens, and Target came out with similar statements. So we're starting to see a shift universally across the United States. So today, members of the board, Mr. Mayor, you're faced with a hard decision, a decision that you cannot be callous or insensitive towards. In order to provide you today with the best possible information, I'm going to present to you today in 3 parts. First, you're going to hear the science and the medical history behind this from our medical community. We have Dr. Ussery, Mr. Mahoney here, ready to provide you with some good, competent evidence. Then I'm going to provide you, through a short presentation, the legal authority on how you have the authority to do this and how it is 100% constitutional. Third, I'm going to go through the nuts and bolts of the ordinance so that we all fully understand here in this room today how this is going to work if this board makes that tough decision to mandate this for the city of Branson. So at this time, I'm going to turn it over to Dr. Ussery so that he can provide us some background and some information with regards to this pandemic.
Please wipe the microphone down, Chris, if you would, please.
Everybody hold your ears.
Thank you, Mayor. Thank you, Aldermen, for inviting me to come speak. I'd like to kind of walk through 3 different steps today. 1, review the history of the disease in this community, in Taney County. Then walk through what healthcare resources we have available, look at what our health department has available left, and then discuss masking as a science. March 23rd, Taney County had its first case. 30 days from that first case, Taney County had 10 cases. 30 days later, Taney County only had 14 cases. 30 days after that, on day 90, we had 35 cases. Today, on day 115, we have 142. We've had 3 deaths in our county as a result of COVID-19, and there's been over 1,000 statewide. We routinely set records for daily new cases as well as weekly new cases in this part of the state, in the southwest region of the state. And according to the Missouri Hospital Association, the rate of positives in Taney County is 235 per 100,000 people. Compare that with Greene County at 165. That similar story is seen in our hospitals, specifically Cox Health. When I left my office last night, we had 25 patients in our COVID critical care unit at South. When I woke this morning at 5 a.m., we had 30. 7 days ago, we had 17. 7 days before that, we had 12. Of those 30 patients, 11 are from Taney County. Remember that Cox Health takes a wide swath from the Kansas line, Oklahoma border, and northern Arkansas. Of all of that, 1/3 of the cases came from this county. Despite that, local health resources or hospital resources are stretched, but they're not out of what we can handle. We have spent the time between March 23rd and now building our PPE resources, investing in ventilators, adding extra ICU beds, and preparing the best we can. We are well prepared. There are still things that we cannot prepare for, and those are things like getting extra drug remdesivir. That's on allocation by the state and limited. In Branson right now, we have 2 doses. In the Cox Health system, I have enough to treat 11 additional patients. I don't have guarantee of more coming. Convalescent plasma, we've also heard a lot about that. The cases are growing at a rate faster than people are recovering, so the people who need the plasma are growing at a rate faster than the people who are recovering to donate the plasma. These are things I can't stock up on. These are things that just don't exist right now. If the healthcare community is stressed but not overwhelmed, the health department, Taney County Health Department in particular, is overwhelmed. This team is the front line of identifying cases, tracing those exposures back, quarantining and isolating people to keep the rest of us safe. That team is working literally around the clock, 7 days a week, to trace cases. They're pulling resources from other places like vaccines. So immunizations before you go back to school. The people who were doing that are now tracing disease. Restaurant inspections, the people who were doing that are now tracing disease. They're pulling their resources back to focus only on this because they don't have enough. If we lose that first line of defense, that health department, that public health line of defense, we will have no hope of tracing and stopping the disease that way. We're left with just taking care of them in the hospital. This disease is highly contagious. I think we've seen that. The evidence would suggest that for every one person who gets it unabated, they would infect 2.5 people. Using things like social distancing and masking, that effective rate starts dropping down to what we'd ideally hope to be less than 1. For every person who gets it, they infect less than 1 person. And to the CDC director's comment earlier, that drives the disease into the ground. So the question is before you today is, do masks work? Do they prevent me from getting the disease from you, or do they prevent you from getting the disease from me? And the answer to all of the above is yes. And I would tell you that we have examples of that.
Decorum, please. Thank you.
I would tell you we have examples of that. So we'll start with the Great Clips experience in Springfield. Over the course of 8 days earlier this year, 2 symptomatic health or hairstylists exposed 139 people to coronavirus for longer than 15 minutes within a 6-foot window. In fact, this far away, cutting their hair. Despite that exposure of 139 people, nobody got the disease. Let's contrast that with what we see in Mount Vernon, Washington, in a church choir practice. Church choir practice, over the course of church practice, one person infected. By the end of the tracing, 52 people are infected and 2 pass away.
Decorum, please.
One more.
Let the speaker speak.
So let's look at Branson. Let's bring this story right home to here. Had a patient that came into my hospital who was not suspected of being COVID positive. Ultimately, the patient was found to be COVID positive and exposed several of our employees, our team members. 4 of those people came down with disease. 1 of those people required a prolonged hospital stay, and 1 of those people lost a loved one as it related to that exposure. That brings it here, and that's people I know. So it's not Washington State, it's not Springfield, it's Taney County. Our facial covering is dangerous, and I hear a lot of that. I hear that it prevents me from breathing, it prevents oxygen from getting in. The mesh here is not tight enough to stop the diffusion of oxygen. It does not trap oxygen.
Let the doctor speak.
Even if it did, the gaps in the side, the bottom, and the top of the mask still let oxygen move around.
Please, if you can't be quiet and listen to the speaker, you'll have your time later on, then I can ask you to be removed from this meeting, and I will do so. I'm sorry, but we have to have decorum. Thank you.
I would further show that the mask like you, Mayor Akers, are wearing, physicians and healthcare professionals have worn masks like that for generations without negative consequences to their health. People in this room today are all wearing face coverings without negative consequences to their health. The CDC would say, and the CDC director did say, that consistently and appropriately applied face coverings will drive down the numbers of cases we have. And to be quite honest, that's all we have left. I do not have a vaccine that is approved for this disease. I do not have a drug that is available in quantity sufficient to treat all the people who will need it. The only thing I have left is personal behavior and mitigation strategies like masking. I would entertain any questions if you had them.
Bob? Refer to Bob.
We will get to the public section here in just a few minutes. This was a report that staff asked to be made, so we've listened to that report.
I got a question for him, Doc. Yeah, and I think many of us have noticed this conflicting information that's come out of CDC and the like. You heard them say earlier that the masks don't work, and we asked you not to buy them. Then they said, they turned around and they said, well, we said that because we didn't want you buying those masks. And I thought, it's Washington harebrained stuff.
Absolutely.
Could you address that
Yeah.
particular thing for me?
So what I would say, two things. One, this disease was first identified in the winter of 2019, spring of 2020. We had very little information about this virus before that time, and the body of evidence from mitigation strategies through treatment and even what we do with them in the hospital has changed significantly in that time. Whether they say we should wear N95s or a cloth mask, the end all be all is that it's better than nothing. This is a decent mitigation strategy when I don't have anything else to do. The question around should the CDC have come out in favor of masking in March, the evidence wasn't there. The studies like the Great Clip studies, which was published in MMWR just this last week and was referenced in that same speech, was published this week. The evidence is still coming out, but the evidence has moved from we don't think everybody should mask to we do think everybody should mask, and it continues to move that direction. I would offer one additional anecdote.
Go ahead, bud.
In March, when we had that patient who exposed 4 of my team members, we were not masking. I was not, and I'm going to own my piece of that. I wasn't where I am today, and I would ask for some grace on that. As a result of that interaction with my staff and that patient, I did change the policy. We did change to universal masking of all of our employees. Since that time, we've treated numerous COVID patients. I have not had a single additional person, and that wasn't the patient masked, that was just my staff. Now we've moved to a world in which the patient and the staff are masked to protect everyone.
I just wanted to follow up with just a comment, because what I've heard, I think I've heard all the way around, if I can keep my glasses from fogging up, is that you mask, you do proper hygiene, you work to be socially distanced. It's like a trilogy of things to do, that the mask itself, just by itself, is a false sense if you don't do those other things, and I refer to as common sense.
Fair.
Yeah.
So I would say all of that is ideal, right? But this by itself, putting this on takes those respiratory droplets, which go 6 to 8 feet, and I minimize that to the inches outside the mask. Is it perfect barrier? No, it is not a plastic bag I'm putting over my head. This does stop, though, the forward progression of that stuff. So it makes that ring around me in which I'm infectious much smaller.
Would you agree, though, what I said in the presentation?
Hand hygiene would absolutely
all three
be,
together.
Yes, absolutely. Hand hygiene would be important as well.
Thank you for your answer.
Thank you, sir.
Any other aldermen with questions? Thank you very much,
Am I
Doctor.
doing mask again? Or am I?
Appreciate that.
No, thank you, sir.
Mr. Mayor, members of the board, when I first started talking, I told you this was a fast-moving topic. We just received word as we're meeting here that the state of Arkansas, Governor Asa Hutchinson just ordered a statewide face covering mandate. So again, just want to let you know. Okay? And with that being said, I'm going to turn the mic now over to Mr. Mahoney with Cox Health.
Who is that masked man?
Well, I really cleaned that up, didn't I?
Now you got
Thank you for
fixed,
helping
Bill.
Chris.
Yeah, there you go. Mayor, Aldermen, appreciate you being here today, and I actually appreciate everybody here being citizens. I'm not going to get into the science. I'm just going to tell you some experiences we've had so you're aware of what's going on in our community. I am here as president of Cox Center Branson, William Mahoney, to be for masking. I'd let you know that. And obviously how community members can help us is by masking, physically distancing. I try to steer away from socially distancing because I think that alludes to other issues we might have later on with mental health type issues. And it's really, we need to be physically distancing, not socially distancing. And then the other one obviously is to wash our hands. What we do know, and Dr. Usry eloquently told us, is we're seeing an uptick in this area quite a bit. Over 30% of those people who are hospitalized at Cox South with ventilators are from Taney County. And we serve 26 counties, Cox Health does. 3 things I wanted to go over were our mission and vision, what we're seeing with our team of caregivers, and then just our resources, because I know there's a lot of scuttlebutt out there on what everybody has. Well, our mission and vision are to improve the health of the communities we serve. Then our vision is to be the best for those who need us. And as a not-for-profit hospital, that's where we focus our vision and mission. We're doing our best to improve the health community through our clinics, our hospitals, the mobile testing units, and through virtual care. Early on, we were able to offer those virtual visits for free. We felt it was that important to get people to connect with us without physically coming in. I'm pleased at our valiant efforts. I'm also very pleased at the love that we have felt from the community. We have received tons of support from the community, and that has just been very uplifting to a very tired staff. Our vision to be the best for those who need us, I would say now and in the future, we need to be focused there. We have a small public health department. We have had to work along with EMS, fire, police, and the public health department and other health professionals to work with the mobile testing units to do what we can there to try to see who might be positive from the COVID-19. Based on the science that Dr. Usry went over, we know that masking does help with the COVID-19. Probably the main area that I want to focus on now is our team of caregivers. We have over 1,100 dedicated caregivers who have been working day in and day out since March to take care of whoever shows up regardless. Early on, we weren't sure we were going to have enough masks, gowns, and gloves for our people. We had people not going home because their families were scared they were going to bring this home to them. We had people staying in hotels, staying in people's basements. A lot of stress. It's been about 122 days of this because things keep evolving more and more and more. Some weren't going home, as I told you that. Some are stressed out because they read social media. They hear the rumors. They hear what's happening overseas and the news shows and everything that's out there, and they don't know what's true and what's not true. Obviously, things are evolving. Their families have been economically affected. Their spouses work in organizations in our community, and they've felt that in their homes. And we've also had a handful of our employees infected at the hospital. We've had some more infected in community areas. And to see them out and the people that are working next to them are pretty fearful too. Hey, am I going to get this next? I think there has been some comfort since we put in the masking at the hospital campus. But we've still had people who've, went to, actually just had an employee who went to Florida, and I found out this morning that they now have COVID-19 and won't be able to come back to work till they get over that. But what I'm a little bit hesitant about is we're at about 122, 123 days of this. We start getting through December, we got another 150, 160 days. And this really is wearing on our people. And what does that look like? Well, it looks like people calling in sick to work. We've had a few people resign, just saying, I can't handle the pressure of this. Some have family members who are ill at home, maybe they have cancer or heart disease or lung disease, and they say, I can't do this job anymore because there's a chance I might bring something home, and that would not be good for my family. We have allowed them to do that without losing their employment, and they can come back when they feel that it's safe for them. We had an employee who told me this, who had COVID. She's a 16-year employee. She said, I've not called in Mr. Mahoney for a day sick in 16 years. COVID has made me so weak I couldn't cross the floor. Mr. Mahoney, it's not the flu. Masking really is about protecting our vulnerable populations and, of course, our caregivers. And then resources be the last point I want to make. We have adequate protective equipment right now, gowns, gloves, masks, things of that nature. As the doctor stated, we don't have the medicines. Those are in short supply. The price of this stuff has just been outrageous. We've been able to find some that is adequate. We've had community groups make cloth masks for our workers and stuff like that. Those who are not at the bedside, but like maybe in billing or something like that, since you have to wear the mask at work. The people that, as I've stated, the stress there, that's been a hit on our resources. The public health department, as Dr. Usry stated, they only have so many resources, and we're trying to help there. But more and more people, you got to trace these, and you have to go back and try to find out where these came from, where they've crossed. That's taken a lot of people. And my kids called me, because they see the social media stuff, and they said, "Dad, I heard you guys are making a ton of money off this." That's not true. The CARES Act has given us some federal dollars. It covers probably 60 to 65% of what you're spending. The amount of supply costs alone and the overtime is really the high points of our increased expenses. And Steve Edwards, our CEO at Cox Health, is built a 51-bed COVID unit. We put the white tents up. We set up mobile testing units without understanding that there'd be any reimbursement at all for those things, because it was important that we did the right thing for our community. Are we being conservative? Yes, we are, because that's our job. We're here to improve the health of our community, to be the best for those who need us. We have to be that voice for health. And while we all have different views, that's all right to have different views. But I think we do need to look and see what is the best thing to do. And I would just close with you. I applaud the local businesses who have master employees. That's been awesome. Seeing the Walmart Corporation, Target, and others do that. Grateful for that step they've taken. And I just, message today is please act now and mask up. And I thank you for what you're doing and the time you spend trying to benefit the citizens of our community. If you have any questions, I'd take those.
Any questions for Mr. Mahoney?
Bill?
Yeah.
We talked about the issue of the CARES Act and recovery. How long will that last, and how far can you, whoa, get out of here. Can you move forward with it?
Can you hear me now?
Yes, I hear you now.
Okay.
How far can you be able to go out on this CARES Act? We're still recovered. Is it December 31st, October 31st? Anybody remember?
So there's different ways you can apply for monies. There's like FEMA. You have to be in certain groups that qualify. Like if you're a hot spot, like New York City or somewhere, it's had thousands of exposures or deaths. I think there's monies for that. I know FEMA has given some monies. Small hospitals, there's something called a SHIP grant. We qualified for some monies under the CARES Act. I'm hearing stories that there's going to be more monies allocated with a fourth stimulus, but I don't know anything more than you do from the newspaper. We did, I was trying to think of another one. Oh, there was some monies forwarded that has to be paid back. I'm not sure which act that was under. That was really for, early on while people weren't getting cash. I think it was part of the kind of the Protection Act part there that some businesses were able to get for their employees too. But that money does have to be paid back beginning in August.
One last question. My background's employment training. That's what I do. Do you think you're properly staffed and you have the staff to follow through and do what you all need to do?
I think we have enough people to handle what we're seeing right now. I don't know that curve. We're fortunate that our board 8 years ago made affiliation with Cox Health because we have resources of other hospitals. We have Cox Gwinnett, Cox Barton County, Cox South, Cox North. We have other places that we could set up more beds if needed. We also have Mercy Health System in the region, so there's more beds there. We just don't know. The bigger point is probably not the beds and the equipment, it's having the amount of staff. The stress level, I'm just telling you right now, the stress level of the staff is pretty high. They're coming in every day. Some people are taking extra shifts knowing that those people need them. And there was a shortage of healthcare workers before we began this pandemic. And right now, we're a 24/7, 365 business. This doesn't slow down.
Are you all caucusing pretty close between St. John's and Cox to coordinate your activities now?
Very coordinated.
Any concerns?
Yes, Cox Health and Mercy are very coordinated and working together. I would say there's daily conversations. I'm not in those, but I do know I'm in meetings that I hear about this, yes.
Thank you.
Any other questions from Alderman?
I have a question.
I think Mr. Milton has something.
Thank you for coming, Mr. Mahoney.
You're welcome,
Appreciate
Mr. Milton.
it. When this pandemic first started and Cox, we added some tents out here for COVID patients. And what I've heard, I just wanted to get straight from the horse. What I heard was Cox had to lay off some employees, that our hospital wasn't being utilized. It was staffed up and ready for COVID patients, but there was no elective surgeries going on, and the hospital had to, did we actually lay off employees during that time?
Zero Cox Health employees were laid off.
Okay.
And I'm going to give kudos to Steve Edwards for this, our CEO. There's other large systems in the Midwest, I'll keep it there, that said we have to lay off. Steve is very prudent about things. And he said there will be some areas like our fitness centers, we didn't have those open. We didn't have elective surgeries. So we put our people in other places like temperature checkers. We did an article in the paper, people passing out food. We had some people, we had some things in the parking lot that needed cleaned up, painted and stuff like that we were able to catch up on. We actually redid, if you saw Med 100, those floors were like 60 years old. The fact that we didn't have as many patients, we could close that wing down, and we were able to, because we didn't have the elective surgeries, we were able to renovate all of that. So we did not lay any employees off. Now, did some employees choose, because of family members who might have COPD or heart disease, stay home and they still can be employed by Cox? That did happen, but we laid off 0 people.
Thank you.
Any other questions down below? Then we'll have the public section later on when you'll be able to speak. All right?
Thank you.
Thank you, William.
Okay, I won't put him on the spot. All right, Mr. Mayor, members of the board, you've heard from our medical community. I now want to shift tracks into the legal authority behind your ability to do this. Bottom line is this, brass tacks is this: a properly enacted ordinance requiring face coverings does not violate any individual's constitutional rights. So when people are done booing, I'm going to go through why that is. We're going to start with a 1905 case, Jacobson versus Massachusetts. This is a United States Supreme Court case. In this case, the court held that a person could be obliged to submit to vaccination against smallpox even though the procedure ran contrary to his religious views. And again, in 1905 case, it was a compulsory vaccination law in the state of Massachusetts. This is our highest court of the land. The justice that wrote the opinion, Justice Harlan, wrote, "The authority of the state is to be referred to what is commonly called the police power." You've heard me say that in previous board meetings. A power which the state did not surrender when becoming a member of the Union under the Constitution. Although this court has refrained from any attempt to define the limits of that power, yet it has distinctly recognized the authority of a state to enact quarantine laws and health laws of every description. Indeed, all laws that relate to matters completely within its territory and which do not, by their necessary operation, affect the people of other states. According to settled principles, the police power of a state must be held to embrace at least such reasonable regulations, key point there, reasonable, established directly by legislative enactment, that's this board here today, as will protect the public health and the public safety. This is from 1905. In Missouri, a municipality may exercise its general police powers by enacting ordinances for the welfare and the safety of its citizens. This is a case out of the Eastern District of Missouri from 2002 that pretty much sums this up. An ordinance is presumed a valid exercise of police power, and the party challenging the ordinance carries the burden of showing that it is unreasonable. Again, understand the concept of reasonableness. An ordinance is a legitimate exercise of a police power if the expressed requirements of the ordinance bear a substantial and rational relationship to the health, safety, peace, comfort, and general welfare of the municipality's citizenry. If reasonable minds differ as to whether a particular ordinance has a substantial relationship to the protection of the general health, safety, or welfare of the public, then the issue must be decided in favor of the ordinance. So if people disagree and this board chooses to pass an ordinance under the police power, it would be presumed to be proper. We go one step further in Missouri. As a fourth-class city, such as Branson, you may enact laws for the prevention of the introduction of contagious diseases in the city and for the abatement, it's a key word, of the same. This is codified in state statute. It's a 1939 law. It says these diseases control of the Board of Aldermen may make regulations and pass ordinances for the prevention of the introduction of contagious diseases in the city and for the abatement of the same, and may make quarantine laws and enforce the same. So our very own United States Supreme Court said that this is proper as long as it's reasonable. That has filtered down to the state through case law, and it's codified as a state statute. So you can go under the police power theory. You can also go under the quarantine law theory. Both give this board authority today to pass this regulation if you so decide. I want to make that crystal clear because there's a horrific amount of misinformation out there today. Anybody have any questions on the law before we go through the ordinance?
Any aldermen have any questions?
All right, if I can ask, switch over.
Just one quick comment. There are several people here, and we're in closer proximity than we really would like everyone to be, but we're that way. If you're not wearing your mask properly, I'm going to have to ask you to leave. And we have several. Now, if you've got a health reason or a problem where you can't wear the mask, it better be valid. And I see some that are not masked, and I'm sorry that you all chose to bring in that way. So please, everybody else, I see lots of people properly wearing them, but there are a few who are not. And I hate to have to deal with that. Okay, go on.
Thank you, Mr. Mayor. What you have before you today on the screen, this is the ordinance that's before the board. I want to walk through the structure first with the board and then get to the actual meat of the regulations. We're on page 1 here. You'll notice there's a number of what we call whereas clauses. Those aren't actually the rule that's before the board. What is a whereas clause? It's a statement of fact, statement of principle, statement of law that gives history and gives the future context to what we did. They also aid in interpretation if there's ever an issue with regards to why something's written the way it is. So if you can switch to page 2 for me, you'll notice there's a number of whereas clauses laying out not only the board's authority, but also how this pandemic has evolved, not only for Taney County, but for the United States. The therefore clause, this is the intention of the board. This is if the board decides to pass this, how this is going to look, what's going to be added or subtracted from the city code here in the city of Branson. So first key point, if we can scroll up just a little bit, other way. We're suggesting that we add 2 new definitions to our city code. The first is public space. And a public space means, for purposes of this chapter, an indoor or outdoor area to which the public is invited or in which the public is permitted. And then it goes on to list a number of examples. It's not an exclusive list, these are some examples. One piece of this, any place where food is prepared or stored. So this is the first definition. I'm going through the definitions because I'm going to show you how they tie into the ordinance. The second definition is face covering. One thing we have seen nationwide is people attempting to skirt the rules by not properly wearing their face coverings. So face covering not only means a particulate mask or fabric covering of the nose and mouth secured to the face with ties, loops, or elastic, but it also has to cover the nose and mouth. Key to the mayor's point a few minutes ago. So those are the two definitions that are getting added. Now, how are we going to apply those definitions? If we can scroll down, okay, section 58-386, which is what we call a purpose section. This is for the future. This is for history. So we know, why did we do this? Okay, it lays out what the goal is. Again, just like the whereas clauses, this helps fact finders, this helps administrative bodies interpret this. So if we're in an unfortunate situation where somebody doesn't care about others, and then we have to get to the point where if this is passed, somebody is cited, this aids the judiciary in how to interpret this rule. So we've broken this up into two pieces. The first is personal conduct, and the second is what I will call business conduct. Section 58-387, it basically says, except as otherwise provided in this article, it is unlawful for any person to be in a public space being what we've defined above, without wearing a face covering, again, what we've defined above, and then we carve out a number of exceptions because there are scenarios where a face mask, if you exercise reason and common sense, doesn't make sense. The first, children under the age of 13. The second, any person with a health condition documented by a medical professional that prohibits wearing a face covering. Before I move on, I want to discuss this point because I think there's some confusion and potentially some misinformation out there that people are under the belief that if this is passed, that we're going to require citizens of this great community to walk around who have legitimate medical exceptions to carry that exception with them. That is not the case. The goal here is to make sure that people comply with this rule for the safety, not of that person, but as we learned from our medical professionals, for the safety of others. So again, if you have a documented medical condition, asthma, maybe claustrophobia, there's been a number that the CDC have listed out, then yes, you are accepted from this rule. But if you're just going to on the fly suddenly develop a case of asthma that has not been under treatment, that is not medically documented, you're trying to skirt the rule. If you can continue. Right there. Number 3, another exception, any person who is hearing impaired or someone who is communicating with a person who is hearing impaired, where the ability to see the mouth is essential for communication. Again, this is what we would call a reasonable accommodation for those that require this. There are certain members of our community that need to communicate in this manner. This carves that out for them. Food and drink. Okay, I think this is going to be a lot more palatable than the situation we had a few months ago where we had to make a decision between essential and non-essential businesses. Any person who is in a public place consuming food, drink, or smoking while seated and maintaining a physical distance of at least 6 feet from other persons who are not family members or reside together. So this is the person sitting in a restaurant with their family, seated and eating. They don't have to wear a face mask because it's awful hard to stuff food through your face through a mask. However, if you get up, you walk around, you move on the premises, you've got to put a face mask on.
Face covering.
Face covering, thank you, Mayor. Any person in the water at a swimming pool, I think that one's pretty straightforward. Any person who is obtaining a service involving the head, face, or nose, for which temporary removal of the face covering is necessary to perform that service. These are our barbers, our makeup people, beauticians, dentists. I was at the dentist's office 2 weeks ago. Real hard for the teeth cleaner to clean my teeth with a face mask on. Again, we're crafted this in context of reason and common sense. Any person playing a sport, exercising, or using exercise equipment. This goes to the mental health of people. There's been a lot of literature out there about how what's going on right now is affecting the mental health of our community, and exercise is one of the best treatments for that. Not that I should be shown as an example for that. Any person who is outdoors while maintaining physical distancing of at least 6 feet. All right, this is a key point. I've heard concerns. I think the board has heard concerns. I'm outside working construction. I have a job. I'm a roofer. Do I have to wear a face mask? No. If you can maintain social distancing, you don't have to wear a face mask. So again, another carve out, common sense carve out. Any person who is outdoors, who is closer than 6 feet to family members or people they reside with, okay? Kind of the same idea here. If you're in a public space and you're with your family, you don't have to walk single file 6 feet apart. That doesn't make any sense. Number 10, any person performing on a fixed stage. This is our theaters. These are our performers. That gives them the ability to provide the quality shows that this community is used to. You can go to the next page. Any person engaged in public speaking who maintains a minimum physical distance of 6 feet. That's this scenario, okay? Or better yet, the religious scenario, where if I'm a pastor or a preacher doing Sunday service and I can maintain distance from my congregation, I can remove my face mask. Again, under proper social distancing. And then finally, any public safety officer engaged in an emergency situation. There's a resisting arrest. That officer has to chase somebody down. It's probably not prudent for that officer to have to wear a mask or obligate that officer or that fire official to wear a mask in those situations. It's almost impossible. So again, another carve out. So that's the personal responsibility of this ordinance. I'm going to stop there, look to the board for questions before I move on.
Chris, maybe it's just an oversight. The issue of while driving, I did not see up there.
That's a good question. So when you're in a vehicle, you are not in a public space.
Okay.
Okay? Again, so if you're in your car, that's your private space unless you're driving the public around. Then that's a different situation.
Young lady, that blonde with your red in your hair, you're not wearing your mask. Does it keep you from taking it on and off? See? Okay. All right.
Let it go.
But thank you.
Excuse me, Mayor.
Yes.
We ask Chris, while we're on this subject, could we ask Chris, and we may be jumping around, but for this, Chris, what are the laws regarding HIPAA? When somebody has a medical condition, what are we and are we not allowed to ask?
Who's asking is the number one question.
Well, the mayor just asked.
Well, with regards to that,
I asked if there was a reason.
I know, but I don't think HIPAA says you can ask, can
he
you?
didn't ask the specific reason. Again, he's
He
not.
asked if there was a reason.
She wasn't wearing her mask.
Yes.
What I will tell you is this, Alderman, is this is a very complicated issue, okay? And I'm not trying to punt this. If we can die down for a second, there's a lot of qualifiers, there's a lot of exceptions. It depends, number one, on who's asking. It depends on, number two, the organization. It depends on, number three, the type of information that's being asked. So this is a landmine that I can't give you a clear answer in a short sound bite today.
Well, I think we're going to,
Can I ask a question? Do I have to, so whoever asked me, if I don't have an ask in public, do I have to?
Ma'am, sorry, we'll have the public section. You can come up and speak later on, all right? Yeah.
I think what's important, though, for at least this portion, because I know we're going to get into HIPAA later, but for this portion of the meeting, I've been cautioned a lot by not violating HIPAA laws of what I can and cannot ask with somebody having a medical condition. And I was told that if somebody tells me they have a medical condition, I cannot ask the question, what is the reason of what is your medical condition?
Alderman Milton, I asked about why she wasn't wearing a mask.
Yeah.
I didn't ask about a medical position. She shared that information. So I properly asked because in the beginning of the meeting, I asked everyone to keep their mask on, just like, we're supposed to, that we're inside the city hall. She shared with me that she has something, and that's fine, but we'll get to it later.
Let me address it in context of the ordinance, because that's why we are here. If you can scoot up the other way, please. And let's look at the carve-out. Okay, because this is the important thing. This is, again, what's being proposed to the board. This is the context in which this is going to be enforced by Chief Matthews. Scroll down a little bit, please. Oh, right there, thank you. Any person with a health condition documented by a medical professional that prohibits wearing a face covering. There's nothing in this ordinance that directs police to ask that question, do you have a health condition? Okay?
But Chris, I thought somewhere in here it says, but you must have a valid reason or something.
Any person with a health condition documented by a medical professional. Again, this ordinance is not written, it's again, we are, as we talked about in the last board meeting about semantics. The semantics here is nobody's asking, okay? If that fine young lady out there has an asthmatic condition that causes a medical issue so she cannot wear a mask, okay, I'm not a police officer, but let's walk through this hypothetical. I walk up to her, I see she's not wearing a mask. Ma'am, put your mask on. What's her response going to be? We already saw that, which is, I have asthma. Done. Okay? It's that simple.
Okay, but I think if they say they have a medical condition, HIPAA says we're not allowed to ask additional questions. What kind of medical condition? Do you have documentation? Can you prove it?
As I have stated, and I'm going to state this again, Alderman, there's nothing in this ordinance that is directing the police to ask further questions of that regard.
But there's something in this document that says you must provide evidence.
Again, I'm pointing you to the carve-out, which is where this is referenced. It says any person with a health condition documented by a medical professional that prohibits wearing a face covering.
So what this says is it must be documented by a medical professional.
It's got to be a valid reason. I mean, if you have respect and dignity for your fellow man, you're not going to walk around without a valid health condition and say that.
Okay, that's not the way I read HIPAA, so.
Can I continue, Mayor?
Yes, please.
So let's scroll down. All right, so we talked about personal responsibility of this ordinance. Let's talk about the public space operation responsibility. Okay, this is section 58-388. It's unlawful for any person operating a public space to allow any person in the public space who is not wearing a face covering unless that person in the public space is accepted from wearing a face covering as provided in this article. So again, we saw Target, we saw CVS, we've seen Walgreens, and we've seen our largest retailer, Walmart, mandate this. If this board decides to pass this ordinance today, that obligation carries to anybody that is operating a public space. And I'm going to talk about some carve-outs there because there's some scenarios that's not fair to that clerk or that person operating that public space. The bottom line is there's now an onus, if this is passed, that a person operating the public space should make sure that people are entering their business or their public space wearing a face covering. First requirement. Second requirement, 58-389, we are a tourist community. We want to do everything we can to educate the public and the people that are still going to make the choice to continue to visit Branson that you have to wear a face covering. We learned from the statement in Walmart that 65% of municipalities roughly that Walmart service have a face covering provision. Again, this is the education component. Our media team, Ms. Pettit, there'll be a big push to educate the public, and Chief Matthews will speak a little bit later about that with regards to enforcement. But where we're going to require signage, okay, that's the request for this board, is to have businesses and public spaces post signage so people know that this obligation exists. And we tried to make it simple, 8.5 by 11. Everybody that has a printer should be able to print 8.5 by 11 paper. Additionally, the city plans, if this is approved, of providing signage on the website that can be printed off and satisfy this compliance. All right, so there's a signage requirement. So again, personal responsibility, public space operation responsibility. And if we can keep going. Now the penalties, okay? The baseline, a municipality has the ability, we learned this in training, we can have a penalty provision of up to, as a fourth-class municipality, of up to 90 days in jail and up to a $500 fine.
Decorum, please. He just stated facts, folks. He's giving you the facts.
That's the starting point, okay? This ordinance is drafted in regards to just a simple penalty by a fine, okay? First thing, subsection A, a person who fails to wear a face covering when wearing a face covering is required by the provisions of this article upon conviction shall be punished by a fine of $100 and court costs. Court costs in the city of Branson are $31.50, period, okay? So again, we're not taught, we have the authority, this board has the authority under the police power to go up to 90 days in jail, up to a $500 fine. This is $100. Part B, a person who owns, manages, operates, or otherwise controls a public place at which wearing a face covering is required by this article and who fails to comply or to require compliance with the provision of this article, again, $100 fine. So if you're a person operating and you neglected that duty that this ordinance imposes, it's the same penalty. For reference, Springfield, and I'm not saying that we do everything, we should do everything that the city of Springfield does, they have two different tiers. Personal responsibility tier is a fine, business tier is a completely different fine, okay? Third portion of the penalty, if I'm operating a business, all right, and I violate this ordinance, there's the potential for the suspension, revocation of any permit or license issued to that person. The classic example, I run a business, I choose not to put signage up, I choose not to require face masks in my business, then the city of Branson has the ability to pull a business license because again, this would be a violation of the health and safety codes of this city. So this is the penalties. This is fully constitutional under the police powers that have been granted to the city of Branson. That's the ordinance in its entirety. Again, we tried to use reason and common sense in drafting this. We tried to keep it simple and easy for our visitors to understand. And I'm happy, and staff recommends approval, and I'm happy to answer any questions the board has at this point.
Mayor, may I ask a question?
Any additional questions from Chris, okay?
So the way this is written is, as a business owner, somebody walks onto the property, let's say they're wearing a mask, and they take the mask off. My business would be subject to losing my business license if I had signage up. This says I'm required to have, read between the lines, I'm required to have staff or an employee walk around and monitor my space. And if somebody doesn't have a mask on, I could lose my business license.
There is a carve out here, Alderman. It's this paragraph right here that I glazed over.
No person shall be in violation
So
of
let me read
this.
this. No person shall be in violation of this subsection if such person or the place the person owns, manages, operates, or otherwise controls requires compliance. So a person takes their face mask off, you ask them to put their face mask on with the provisions of this article to wearing a face covering, and a person that is allowed in the public space refuses to wear a face covering. So again, you can't be held liable under this ordinance for the actions of another. So that's the key carve out there. I think we've all seen a number of videos out there of people, the throwing fits as my 5-year-old would in a store because they are asked to put a face covering on. That scenario goes up, manager, whoever you as a business owner designate to ensure compliance, asks them to and they refuse to. As a business owner, you would not be responsible under that scenario. Proper action, and this is where I'm going to turn to Chief Matthews, wherever he is hiding or sitting, this would go to the enforcement wing of how this is to be enforced. Okay, and the key theme there is education, and I'm going to stop there because I think we probably want to hear from our chief as to how this would be enforced.
Bob does
Yep,
too.
Bob. Jeff, you've got
Chris,
one? Okay.
the posted notice, it has on it that it frankly states, and I can't find it in my little thing here, but it frankly states that if you feel ill, go home. Could that be worded differently?
Absolutely.
That seems rather unkind. It's a minor thing, but could that be worded a little differently?
Absolutely.
Now,
Alderman.
we don't know if they feel ill or not, so we can't enforce that. But
So if you do not feel well, go home. Again, this is what's being presented to the board today, as you know. You can always motion in different language, and I try to discourage edits on the fly, as you know, just like a double read. That's how mistakes happen. But if we want to motion in some different language to make that more visitor friendly, great.
all I wanted to do was put a please in there.
So if you do not feel well, go home, comma, please.
Please go home.
Please go home.
Okay.
All right, so are we going to make a motion to do that?
We don't,
Is this the right time?
we don't have it on the floor yet.
Okay.
Yeah, it's all right.
We'll pause and just mental note that that's there.
Chris?
Yes, sir.
The issue of inadvertent versus on-purpose violation, I think that's something to look at, and obviously the court would, because it has to be adjudicated, and they also would have to go through due process.
Correct.
It's just not cause, it's just not charges pressed, it has to be a hearing held, and that person can offer evidence and refuting that, correct?
Absolutely. This is no different than any other ordinance on the books, from possession of marijuana to failure to wear a seatbelt. All right? This will still have to, if a person is cited, if the officer decides that the conduct warrants a citation, and that's a key theme there, officer discretion, police discretion. If they decide it warrants a citation, they can cite the person. That will go through our municipal court. That person will have the opportunity to have their day in court, have a trial. And what's unique about municipal is they can actually have 2 trials. If they don't like the decision of the municipal court judge, they can have a trial de novo and take this citation over to Forsyth, over to one of our circuit or associate circuit judges. So again, they have a large process to provide defense, to have their day in court.
This might be a question for both you and the chief, but how this stuff normally done is you give a verbal warning and then a written warning, and then there would be a ticket. Are we saying that process would be followed?
I'm not going to speak to what the chief's plans are, so I'm
Okay.
going to
Thank you.
Jeff, I'll get to you in just a moment.
take a second here. Our chief of police sick.
Mr. Mayor, members of the board, Jeff Matthews, your police chief. As far as the enforcement of this, and I want to go back and address something that Mr. Milton's, one of his concerns. Our philosophy in the police department has always been and remains that we will have an education process, because the whole concept behind any ordinance is compliance. We're trying to carry out the will of the board in making the ordinance. Our job is to gain that compliance through education, through officer discretion, or through enforcement. Enforcement is part of that compliance. And Mr. Milton, to your concern about the citation and the medical proof and all of that, when I reviewed this with the attorney, my concern was, Chris, can we write this as a defense to prosecution? Because the last thing I want as your police chief is one of my officers having a roadside medical review or a physical, if you will, to try to determine who's right and who's wrong on that. We work on probable cause to believe that an offense has been committed. The courts, the prosecution, and the courts have a much higher standard than we do. So the defense, the prosecution would be, I'm not going to get involved in that, education, the officer discretion, or enforcement, and then take it to the court, as the attorney said earlier, and let the judge have the final say. But with any new ordinance, we always have and we always will believe that education is our first step.
Chief, thank you for addressing that. There's a lot of people in this community, including myself, have the utmost respect for you and your officers.
Thank you.
Very nice. What I struggle with is when we put things in writing, that's the law that says this is the way it's going to be. Someday you're going to go to Happy Valley Farms and fish. Somebody's going to fill in, and the law is the law.
You're correct. And I think that the city probably had some of these same conversations when we were talking seatbelt ordinances and other ordinances that have come along. And I'm not going to get into the specific question, but one of the things I have a very hard time in talking about taking away is the officer discretion. Because the officer making the decision in the field is the best person to make that decision.
Would,
Can I speak to the timing?
Do the microphone just a moment, I'm sorry. Trying to,
We're going to be playing ping pong here first.
yeah. Thank you, Jim.
To the timing component, this is a temporary ordinance, I guess is the best way to describe it. If we can scroll all the way to the bottom, okay? You can remember, I started out with a quote from the CDC, the director of the CDC, said 4 to 6 weeks. This ordinance will be in effect for 30 days. Now, if in 30 days the situation doesn't improve, unfortunately, somebody's going to have to make a hard decision as to whether to extend it or not. As you all know, with the fact that we require face masks here in the city buildings, that the mayor issued a proclamation back in March that transferred some powers to our emergency management director, that's Chief Ted Martin, and also our city administrator. So the way this ordinance is drafted is that at the 30-day mark, if those two, based on science, based on data, and based on the advice of the people in the community, think that this needs to continue, they have the authority to do so. If it's a situation where it doesn't need to continue, this ordinance dies at 11:59 p.m. Oops, hold on. Right there, on August 20th, 2020.
okay, but we've just went from one topic to another topic because we haven't finished the first one yet. What you're saying is, hey, hold on, this isn't that big of a deal. This is only good for 30 days. Well, it's not good for 30 days. It's good for 30 days, and without any further public opinion, without any input from the Board of Aldermen, this says Stan and Ted, independently based on their own opinions, can choose to extend this month after month after month with no input.
Go ahead, Paul.
I read that too, and I had messages that had a problem with that. However, in my opinion, and I'd like to ask you to confirm it, any two aldermen at any time can call a special meeting, or the mayor can call a special meeting. So if the alderman or mayor decided that at 30 days we did not want to do what necessarily they wanted to do, we could call a special meeting and address the matter again ourselves at this level.
That's an excellent.
Nothing to keep us from that.
That's an excellent observation, Alderman. If you recall from our training a week or so ago, we went over that very topic, that two aldermen can decide to bring everybody back in the room and have a further conversation. A better example.
Wait a minute, let me interrupt that because that's not a true statement. Not long ago, there were two aldermen that tried to have a meeting, and other aldermen preferred not to attend So 2 aldermen did try to have a meeting and was denied a meeting.
Clarification. Mr. Milton, you're playing a little bit of a game here because you know that it takes 4 aldermen to be a quorum. And unless you have 4 that are willing to have a meeting, you can't have a meeting. You by yourself cannot call a meeting.
Can I offer a different alternative here?
Yeah.
On Alderman Simmons, again, I always appreciate him. We had a conversation about, probably 15 minutes ago about the fact that our signage is not so nice, okay? I think Alderman Simmons suggested the idea that maybe we should put a please in there, okay? You have the opportunity, Alderman Milton, just like Alderman Simmons does, once we put this on the floor, if you want to remove that, you can move to remove that. We can make an edit. I'll walk up to that computer, we'll make an edit, and then this board can vote on it. So again, that's an alternative. If we don't believe that the process works, where 2 aldermen or the mayor can call a special meeting. I like to think positive, and I like to think that maybe we only have to do this for 2 weeks, and then there's a reason to call a special meeting because we can end this thing quicker.
Okay, can we go back to the point we were on before we got sidetracked on this is only good for 30 days?
Is there a question, Alderman?
Yes, I just asked, could we go back to the topic we were on before you went to the bottom and implied, look, this is only good for 30 days?
What was your topic, sir?
What was the topic?
Alderman, you made the comment that something could happen, and I'm paraphrasing to Chief Matthews, time passes and then this thing's on the books and a future chief is going to have to make a decision on how this works. I'm pointing out to you, Alderman, that there's a timing provision built into this. This is not permanent in nature.
Could this go for 12 months?
If Stan and Chief Martin decide so, it could.
That's my point.
Well, hold on. Unless 2 board members or the mayor calls a special meeting, or you choose when this is on the floor to remove that provision.
Okay, would it be more clear if instead of having a law that says this is going to be the way it's going to be, but we know there's going to be a process of enforcing, what about adding that language in, for example, the first time the public would be educated, or the first violation, the public would be educated. Maybe the second violation, something would happen. Let's not just assume that's what's going to happen when the written law says you're going to jail.
The written law doesn't say anybody's going to jail.
Okay, lose my business license, I might as well go to jail.
What I will tell you again is this: when this goes on the floor, if you think that is an appropriate change, make that motion, okay? I will tell you, as a prosecutor, I've been a prosecutor since 2007 in this area. I worked over in Forsyth under Honorable Jeff Merrill. We like discretion as prosecutors. I think the police likes discretion. If we start writing in a rigid set of rules in an attempt to try to build discretion, what we're going to end up doing is we end up taking away discretion from our officers, because then they have to go step A, step B, step C. You just said earlier that you trust our police officers. You have great respect for Chief Matthews. Let's let that carry through and hope that he educates, he exercises his discretion before it gets to the point where it goes to court.
Thank you. Thank you.
Chris?
Yes, sir.
Just a second. Jeff says he's been trying to say something
okay.
for a long
All
time.
right.
No, I
Jeff?
haven't yet.
Pardon?
I'm going to ask some questions of Chief Matthews.
Okay, great.
Hold on.
Chris, it's just a simple thing I wanted to,
Bill, he's asking.
oh, okay.
Hold on, we're at Jeff right now. Alderman, say Chief Matthews.
And Chief Matthews, this may already come up again to be addressed, but a scenario for a business owner, regardless of the business is, the individual walks in, refuses not to wear a mask. Your suggestion would be capitulate and let him in, eat or whatever it is he's going to do, and then just leave and live with that, as opposed to creating a scene, vocalizing, confrontational type of stuff. So, not to put you on the spot, but what would you recommend?
So as I see the ordinance is written, the first responsibility is on the business owner to say, hey, mask are required when you come in. That right there alleviates any further responsibility for that property owner. If it continues, I suggest that property owner contact the police department and let one of our officers come out and handle that situation.
Right, but not necessarily say, hey, I'm going to call the cops while the guy's eating before he,
I don't care when they call the cops.
Right. Okay.
Yeah. Same thing at somebody's house. If there's a situation going on that makes that person uncomfortable to handle it themselves, that's what we get paid to do, is to take that burden away from that property owner, just like that business owner.
And then the progression of education, is that going, you come out sort of like a firm warning, or just, basically ask for some compliance? Or your officers to ask for the compliance?
So it is asking for compliance in an either-or kind of a situation.
So is there a tweener between, writing somebody a citation? Is there like a second, more firm warning?
There could be.
Gotcha.
And once again, it's difficult to write ordinance so that you put an officer in a box.
Right.
Because if you put an officer in a box, it doesn't matter what the excuse, we have to abide by that box.
Right.
So if you leave it the officer discretion, we can handle issues in the community a lot better through officer discretion.
Right, and I'm sure a lot more of this is going to come up during the public comments. So.
Sure.
Okay, thank you.
And Chief, before you leave, may I?
Yeah.
Do you know what the office, maybe we need to provide information from our HR department of what HIPAA laws are? Because is there anybody here, do we have our HR director here?
I don't see it.
Do you have a specific question on HIPAA laws, or?
Yeah, because I'm not an attorney.
Yeah.
But I read it for my own business, and HIPAA tells me, at least the way I read it, that if somebody says, I say, please put on your mask. They say, I'm sorry, I have a medical condition. The way I read the HIPAA law, and that's why I'm looking for some legal advice, the way I read the HIPAA law says, zip, I can't ask any more questions, and they're going to sit there without a mask on.
I can answer you, Alderman. Here's the situation.
Microphone may not survive today.
I'm going to give you a short answer because it'll be succinct. This HIPAA applies to healthcare providers. Really that simple.
What? I don't have to abide by HIPAA?
Okay? Now, if we want to have a long, drawn-out conversation about HIPAA, we can. But again, generally, there's a lot of exceptions, there's a lot of provisions. It's a very complicated area of the law. Generally, it applies to healthcare providers. And I'm looking at some of our healthcare providers that may have escaped. Mr. Mahoney, you can probably speak better to this than I can. Maybe, I hate to put you on the spot. Yeah, exactly. Okay? But again,
I read it as a restaurant owner, and HIPAA was talking to me.
Again, I go back to the way this is worded, Alderman. Nobody's asking anybody for information. That's the key point. This is semantics. We're not directing, the ordinance does not direct Chief Matthews when they see somebody without a face mask on to say, do you have a health condition? What is it? It doesn't say that.
No, but it's asking the owners and managers and operators of businesses, if you have a customer walk in, we're being asked to ask the question of the customer, would you put on your face mask? And if their response is, I have a medical condition,
Then you're done.
then I'm done.
Yeah.
So I was asking the
You
chief,
can ask the chief too. I think he'll confirm the same thing.
So to that point, my concern when the attorney and I sat down to review this from an enforcement standpoint, if it gets passed, my concern is, once again, I'll state, I don't want my officers out in the field having a roadside, assessment of somebody's medical condition. The way the ordinance is written and the way the majority of the ordinance is written, it's up to that person to tell it to the judge, right? If they have a condition and out there on the field, officer discretion goes to the enforcement, it's still up to the judge to decide that medical condition, because we don't do that. That's not our responsibility. But if we take somebody at their face value of, I have a medical condition, we're done right there.
Just like we did tonight.
I really think we need a real legal defined opinion on what we can and can't do with HIPAA, because I don't think it has to do with just healthcare workers. But go ahead.
Okay.
Mr. Mayor, they finished down there?
Bill?
This is for me or Chief?
I'm sorry, y'all. We have a time for you all to speak, and this first part of the meeting, we have to hear the stuff, and then we open it up for public comment. And I apologize to you. I know you're anxious to speak, but you will have your chance.
Chris, could you go down to the bottom on the
Sure.
closure?
Penalty section?
No, the closure, when this thing runs its,
I got it, Brandon.
Okay.
This works.
Larry will fall out of his chair. It's not often he and I agree with each other.
Okay.
But I would agree that it would be a decision of the mayor and the Board of Aldermen to terminate this
Okay.
and extend. Item number 2, where I disagree with him, and this is all funny, the reason I didn't come to that meeting he asked for, because it was my anniversary, and my wife said no. So that works that way. Just to be clear, that's
Fair
all.
enough. So I look forward to an amendment coming.
Yeah, there you go.
Alderman Simmons.
Again, I've been questioned in individuals' offices under the business part of this, for instance, banks have an office where generally just one person and another person goes in business with them. Insurance offices are the same way. People are on the phone a lot but are in a separate office. I wasn't able to interpret from reading this whether that would apply to those individual offices.
It doesn't. I'll give you a good scenario. If we look behind us at the planning department, there is well, it looks like an aquarium now, but there's a glass or a acrylic partition there. There's 2 doors. All the offices are behind there.
Yeah.
The front of that, that's where the public's permitted. That office, that situation, public wouldn't be permitted. So to answer your question, is that would be an appropriate situation where this isn't required.
So anywhere, if they're in a waiting room waiting to go in, then it is required. However,
Exactly.
once they went in to visit with the individual, it would not be required of either one of them.
Exactly.
Thank you.
Because again, if let me finish that thought.
Yeah.
If I'm meeting with you over, let's say, insurance, that's not a public meeting, okay? I would hope that some random public person wouldn't barge in as we're talking about my private affairs.
Yeah.
So again, reason and common sense.
Right.
This goes to the education component.
Thank you.
Alderman, are you ready to get this on the floor
Oh, no.
for discussion for the public?
Time for public discussion?
Yes, but before we get into the part where we start making amendments to this, I'd like to go through this so we can have a discussion again also.
Okay, I'm not
Before we
ready.
go to vote and put this on the floor and start making amendments, I would like to be able to go through this again and have more discussion.
More questions of Chris, is that
Yes.
what you're saying?
Well, do you have specific questions now?
Well, I know they want to talk.
We will have additional discussion after the public.
Okay, then let's move on.
All right. You've heard the first reading of Bill 5837. Do I have a motion approving this bill?
So move.
Is there a second?
Second?
All right. This is the point where we have audience be able to speak. I'd appreciate a couple things. One, we've received, as you can imagine, a lot of communication from people. We've received a lot of emails and texts and calls, and we've shared that as much as we can between all the aldermen. I forwarded on many of the stuff I have. So there's lots of information that's been given to us. During the course, because we got several people that want to speak, I'd encourage you, if you can, to be as succinct as possible. And if you can, keep your comments as short as possible. And if you hear someone state what you've said, then you can come to the microphone, identify yourself, and say, I'm the same as what that person said, and we don't need to have to listen to it again. It's just a courtesy type thing to keep things from being said over and over and over again. So I'd appreciate that. There was a rumor sent out on Facebook that we were going to limit speaking to 3 minutes. How that came about or why that came about, I have no idea. I do have, from the decorum of the meeting and the procedures that we have available to us, to limit the amount of time. I would hope that I wouldn't have to get to that point. I'd hope people would say their case and their piece, and then we would go on to the next person. Do we have a list of people that want to speak, or?
No, you're.
Okay. Okay. All right. I know there were some people who were here very early waiting to want to speak. I would hope that those folks who came early, you would let them speak, and then we would go from there. But at this point in time, I would invite folks to come to the podium, identify yourself and your location. And
Mr. Mayor, real
speak.
quick before people start standing up.
Yeah.
I'm going to sit back there. Okay, I'm going to wipe the mic down. If you need me, could you summon me? I can hear back there. I just have 2 family members, one that was exposed to COVID yesterday and one that tested positive yesterday, so I want to stay as far away from what's happening right now.
Okay, thank you. Now, just a moment. We need to have separation.
Mr.
Yes.
Mayor, if I could offer a suggestion that we have no more than 10 people in the queue at a time,
Okay.
so that we can maintain distancing over here.
All right, that's a good suggestion. So, may it so be.
Yeah. So the first 10, and everybody else will get to. Sorry?
So I'm going to ask you all to do the same thing we ask other speakers. You can take your mask down to speak, but please, after you finish, there are wipes there, and I ask you to please wipe it down on yourself if you would. Sir, you're the first one.
Thank you, Mr. Mayor. My
Your name and address.
Yeah, my name is Warren Hunter. I pastor a church, and
What's your address, sir?
I mean, the church is in Hollister, but I live in Branson.
Okay.
Now, I'm originally from South Africa. I came here to America in 1982. I went to Oral Roberts University for 6 years. I did my degree in biochemistry and my master's in biochemistry. Now, I worked with virology. I went to Oklahoma City, and we used to take foreskins of babies and we would inject them. And then this is where we stimulate the T cells. I'm not going to explain everything, but basically you stimulate immunotherapy. I wrote like 200-page paper back in 1988 on interferon and immunotherapy. And I worked with, the professor I worked with was the head of the American Chemical Society. And I'm just trying to give you some of my qualifications. Then I also worked for OSHA, because I had my license in what's called Occupational Association of Safety and Health. So they would move me to places after that to contaminated facilities. Well, we wore a spacesuit with a huge mask and cartridges we changed every day. It was impossible for something like this, we know for a fact, to stop a virus or to stop you breathing it in. So there's a lot of the factor. My sister, I brought up a couple of things because I was discussing this. My board of directors, one of my board of directors is Dr. Stephen Katzis. He's the chairman for the board of directors for St. Francis Hospital. So I know the doctors are here, and I hope educated people are here. He is the chairman of the board of directors in St. Francis. Now, he cut out the biggest cancer tumor in the world about 10 years ago, 380 pounds. So he's in the Guinness Book of World Records because Harvard, nobody wanted to take it on. Me and him have been friends for years. He's on my board of directors. My sister now is the head of a virology lab in New York. So I'm in communication with her. She's been working with coronavirus, she said, for over 20 years. Now she has a big problem. I just want to address some of the things because we seem to be swimming in a cesspool of ignorance to me. I understand. No, let me just say this. And I've been I've traveled around the world for 35 years as a minister as well. So I've been over 50 countries around the world and things. And also the other thing is, from South Africa where I come, most people, if you understand medical technology, South Africa invented probably about 80% of the medical equipment we have today. CAT scan was invented in South Africa. When I was a child, when I was born in South Africa in 1966, Chris Barnard did the first heart transplant in Cape Town. He did the first kidney, liver. South Africa has been a leading nation when it comes to medical technology. Now, I went to South Africa in Cape Town like a couple of years ago. They're already working on nanotechnology with the heart, robots going through the heart, all this kind of stuff. South Africa's way ahead. When I got to America, and I did my last year of high school in America, they had to put me in Bio 3 and calculus because America was so far behind on education. Now, I came from South Africa, and you would think, how in the world is that possible? Now, the other thing that I wanted to bring up is in South Africa, when this came out, the first thing, I'm just going to bring out a couple of thoughts. The first thing that they did with coronavirus, they realized, the doctors there, is they stopped selling cigarettes and alcohol. That was the first thing they did. Now that's interesting, a nation so high in technology, the first thing they do is stop smoking. No more cigarette sales. I don't know in America, why in the world that is never discussed, the factors. Now my friend Steve Katzis, Dr. Steve Katzis, St. Francis, when I talked to him about 3 weeks ago, in St. Francis on one of the wings, they had 20 coronavirus patients. All of them were on breathing machines, respiratory machines. And I said to him, what was the common factor? Now we hear what the doctors are saying, oh, diabetes, this problem. But he found it fascinating because he mentioned to me, he says the 20 patients they had on the one wing in St. Francis, every one of those 20 patients on respirators were long-term smokers. So, you know, it's like saying, okay, if we're going to wear masks, then my advice, medically speaking, is stay away from the smoker. Because if you're asthmatic, they'll get it. Now, the other thing is my sister, who's the head of a virology lab in New York. We've discussed this. She wouldn't go live with me. She said, if I go live, I'll get fired. She said, when the CDC came out with regulations, when you look at it under a microscope, they took the scales of looking at microbiology when you look at a virus. And they went from 001 to 0000. They increased the zeros. So she said, by the time you find the virus, sometimes she said it's unrecognizable. It might be HCRS or it might be one of the viruses. She says coronavirus has been around 20 years. Now she's convinced that this is biologically being adapted. Okay, but one thing that she's told me that was very interesting is she says when they're doing the testing, they take the swabs, they bring it to a lab, they do the virology testing. When they do the testing, she said to me that when they bring in the testing, sometimes 85% of what she tested shows that they had maybe possibly, and so CDC gave them a guideline, if it's 0.001, you can't identify it, put it down as presumptively positive. So I said to her, what is presumptively positive? She said, well, it's 0.00, it might be, you had it 5 years ago, you had it a year ago, and she said 85% of her testing that she did now in New York shows, according to her judgment, she's giving me as a head of a lab in New York testing coronavirus now for 3 months, is that most of the people, 85% of the people she tested must have had, if they did, 0.001, maybe a variance there, 6 months ago, 6 months before the March. 6 months, from March on, which she said, these people were having in America almost 6 months ago. So it's kind of like, my question a lot of times on the medical field is, why is the medical field saying something now, and it's taken them like 6 months to say, did you consider the past? Did you consider the journey of this coronavirus? Have you talked to virologists? Where is the virologist in the town? Where is the educated people making correct decisions? So I thought that just to me, my sister, she wouldn't go live. She said, no, if I tell you, because the CDC guidelines made it harder. That means when I'm looking at a microscope and I'm looking at 0.001 and I increase the zeros, of course, more people. Now, she was saying if you took everybody to America to get tested today, probably half of America would have had the coronavirus already. So the rate, if we suddenly had someone go out there, like a Gestapo, she said tomorrow, and test the half of America, the scale would go up like millions in a day. We would all suddenly be contaminated. It's the end of the world in a week. So I thought to myself, and the other thing is, we were bringing about the immunity. I just want to bring up one more thing, because I think sometimes we're not looking at all the, like he's mentioned the HIPAA law, but family immunity. I have 6 kids, 2 grandchildren. All my kids were delivered at home birth. They've never had a vaccination. They've never had a shot. My 2 grandbabies are also home delivery. Never had a vaccine, never had a shot. Only one of my kids had a shot one time. And after they had their shot, because they were born at home, never been to a doctor, never went to hospital. None of my kids ever went to a doctor. When they got their shot, they were sick for 2 weeks straight, so bad. And I said, how in the world can I have 6 kids who are born at home, no doctor, never get sick, and 2 grandkids never sick, and one of them get one shot, and it's like the end of the world? I personally, under conviction, would not even allow that. The other thing is, one of the big issues is, even scripturally speaking, when we say we're going to enforce something, go within the church, I don't think a person can go there, because we have something called the laying on of hands, the ordinance of laying on of hands, baptism. A minister is supposed to pray for the sick. Something's supposed to happen. Well, that's if he is a minister. Otherwise, maybe nothing happens. But the point I'm trying to say is that I think that we need to think very carefully when we're trying to weigh. I understand the distancing. I respect that. I go into places, I put my mask on, because I don't want somebody elderly, to get asymptomatic. Of course, I'm going to respect that. I don't want that. But I think sometimes forcing it in certain places, I don't think, like he's saying, you got to consider the scales. The education, like the police said, you got to consider the scales very carefully, because everybody's in a different place. And, my real challenge is with the medical people getting up and going, they're like convincing you it's an emergency in the now. And my sister's saying that half of America has had this last year. Some of them were tested. She said it's been in their bloodstream, corona, for 20 years. I said, how can corona be in your bloodstream for 20 years? 20 years in your bloodstream, and now we're getting a positive now? Unless my sister's a doctor of virology crazy, and she doesn't know what the heck she's doing, I don't know why she would even tell me that. So to me, I think our knowledge on this subject, we're like learning. We're still on a learning curve with all the statistics. Even CDC's on a learning curve. Even Dr. Fossey. I know some of this stuff from doing virology myself, that I think these people are still on a learning curve. So we're making judgments really not knowing all the information. And so I'm just trying to bring it up to you. Please think about all the factors to the best of your ability before we make decisions, that we consider all the thinking behind what we're doing. Dr. Munshi, let me just bring up one thing. Dr. Munshi, he's the respirator therapist who has the sleep clinic up the hill. 2 years ago, I was flying in and out of Africa 6 times. I went to South Africa, Ghana, Kenya, Nigeria. I was there 2 weeks back here, 2 weeks, all through Christmas. After 6 weeks of going back and forth to Africa almost every other week, about 6 trips, I was going 110 degrees freezing. So I came to him, I said, I'm struggling breathing. So he said, what is it? So he started looking at my lungs. He says, your lungs are not able to adjust to going from the cold to the hot, the cold to hot. So he wanted to give me an inhaler. So I came to the other day and I said, hey, I went in somewhere. I was putting my cover on and I said, I was really struggling to breathe. So he says, well, there's nothing really I can do about it. You'll have to go home and maybe sit in water and practice trying to breathe through it. But after a while, your lungs, it's kind of like working out in a gym, he says, will adapt. But that's not the case with every person. And I thought to myself, we were like, same thing with glasses. When I did my master's in biochemistry, one of the things I did was synthesis. Now I'm going to wrap up here in a sense, but I just want to give one more example. When we studied synthesis, we were studying contact lenses because we were dealing with the eyes. And when I was dealing with making contact lenses, I realized something with kids. Kids get into fear, and we were studying a group of kids, and they would, when they got into fear or traumatic experience, they would go to the doctor and say, I couldn't see clearly. The doctor would lock glasses on them. When he put glasses on them, before you know it, the kids wearing their glasses all the life. So I said, why don't we take 100 kids, a bunch of these kids, when they get out of school at the end of the summer, take their glasses off and have the parents have them practice with no glasses for a summer. By the end of that summer, we almost had every one of those kids, about 90-some of those kids, none of them wore glasses ever again. Now, I'm just trying to explain this. If we start walking around with a respirator all the time, how is our lungs going to adjust? After several months of it, what I'm trying to say, after several months, I guess what some people will want to just keep wearing it, like if they're born that way, and their lungs' ability to recover, well, you can see it with glasses. If you put glasses on a kid, He's going to have glasses the rest of his life. Unless the glasses are taken off, and we allowed the kids to have a summer without glasses, their eyes were able to grow and recover. These are some of the things that I don't know if the medical community thinks about some of these things, and why South Africa would say no smoking, which South Africa right now is having one of the best recoveries. The Nation just said yesterday in the news, one of the people in South Africa was saying, it looks like we're in rehab and it's working because people are going to farms trying to find cigarettes, but actually they're getting free from smoking, and their lungs are improving and they're recovering quicker.
Thank you, sir.
Anyhow, thank you very much.
My name is Brian Seitz. I live at 1805 Miller Drive in Branson, and I'm a candidate for state representative. I'm here today because I and thousands of area citizens think that you, as a Board of Aldermen, are about to make a grievous mistake if you pass a mask ordinance that will effectively cripple the economy, restrict individual liberties and freedoms, and issue an unjust government mandate that will make criminals out of individuals and businesses that refuse to comply. This cannot happen. Let me state for the record that I am not anti-mask. Though the science behind the effectiveness of wearing a mask is widely debated and the act could be detrimental to the wearer, I support the freedom to choose to wear one. I do not, however, support a government mandate requiring masks to be worn. This is an overreach of city power and an infringement upon the personal freedoms of individual citizens. Branson businesses and individuals have done a great job in protecting both locals and visitors through various health and safety precautions that they have instituted in their own places of business. I applaud their ability to confront this threat head on. That being said, what I and a multitude of others cannot accept is a government-mandated overreach that threatens fines for individuals and businesses and restricts our liberty. If a person wants to wear a mask, they have that freedom. If a business wants to require masks while on their property, they have that freedom. If an individual or business does not want to wear or require masks, it's not yours or anyone else's business. Our government exists to secure and safeguard our freedom, not repress it through fear-mongering or coercion. I am here wearing the stupid mask to speak on behalf of the maskless. I'm here to speak on behalf of those who feel marginalized and threatened by what is being proposed. I'm here to speak for the waiters, the waitresses, the cooks, the ticket takers, the gas station attendants, the performers, the businesses, the show owners, young and old, who want to know one thing, want you to know one thing: enough is enough. Currently, many are being made to wear masks at work, as is my wife. It's their employer's right to set that policy. However, when they get off of work to go shop, relax, visit friends, or just enjoy some downtime, they do not want government bosses telling them to wear a mask. They want the freedom to make their own decisions. Our visitors have also been speaking out against mask mandates. A Marine veteran reached out to me and expressed that he was denied entry into multiple local stores due to not wearing a mask. This individual has severe PTSD and cannot wear a mask, but that was not taken into account. As a veteran myself, I find this appalling. One business owner told me that they stand to lose another $100,000 after having previously lost income due to the shutdown, because customers have stated that they will not come back to Branson if they are not free to decide for themselves to wear a mask or not. By mandating mask wearing in the city today, you are sacrificing the success of tomorrow. Once some of these businesses shut down, it will be for good. Don't make that decision for these individuals by passing this mandate. They should continue setting their own policies, and they should be in control of their own success or failure. The lifeblood of Branson comes from the fact that we attract people to the city, not repel them away from it. The city of Springfield, which passed a mandate comparable to this one earlier this week, has already seen a sizable backlash from individuals refusing to visit the city and locals vowing to do even their grocery shopping in the surrounding communities without masks. Branson will see the same, only once the tourists decide to go elsewhere and once the shows are forced to close due to lack of vital income, that's it. Things will never be the same. This mask mandate, in addition to being practically unenforceable, is being driven by fear, plain and simple. I'm going to go off script for about 10 seconds. I heard Chris LeBeck speaking. He spoke of forced vaccinations. He spoke of a police state. He spoke of people showing their papers and putting up signage. Are we going to have to wear a yellow star? I mean, this is America. It's absolutely ridiculous. This mask mandate, yeah, I said that, okay. Nationwide, the liberal news media hammers home the narrative of the unmasked being the enemy of us all, unless, of course, one is protesting. Prior to the last election, many members of this board used buzzwords of Constitution, liberty, self-determination while voting a mask down. I would ask, mask wearing down, I would ask that you remember those very words that you used again today. Please. Rather than point out the fact that only 0.21% of the citizens of Taney County have contracted this virus, the staff report given by Emergency Management Director mentions a 946% increase in positive cases. Big numbers are scary, and fear is the ultimate sales tactic. I speak for the people when I say no to mandated mask wearing and government overreach. I speak for the people when I remind you that you are not our masters, but our public servants. Elected to secure our freedom, not deny it. Do not make the mistake of so many local governments that they have made by taking away the right of self-determination from free people. Rather, remember that Branson stands for God, family, country, and freedom.
My name is Charles Kirkman, 126 Sienna Boulevard here in Branson. And what's just been said, I can't add much to that, but I will say a few things. It's been mentioned what Arkansas has done, and I'll just mention what I heard this morning that St. Louis has done. St. Louis has said there'll be no mask police. It'll be left up to the individuals whether or not they wear a mask. And I think if St. Louis, they have quite a few attorneys and quite a few doctors, and they've come to that decision, and I think that'd be good enough for us here in Branson. St. Louis is not the most constitutionally friendly government, and they came to that decision. Now I want to take another direction. I really appreciate what the pastor said and what's just been said. But I want to mention that I really believe this. I'm a pastor myself, have been for 45 years full-time, just recently resigned my church and preaching around the country, but I've taught at the university and college level for over 30 years. And I I've specifically studied communism and its takeover of countries. More importantly, I've got 5 children and 17 grandchildren and 2 great-grandchildren, and I don't like the template that I see historically now being laid over our country. And right now, we're going toward the latter stages of what's happened in many countries before us, now under communism. There's no denying that. By the way, it'll be interesting to see when BLM shows up, how much of this masking will be enforced then. And they've already showed up at some of our stores and venues. And I appreciate the demeanor and the tone of the aldermen and really everything that's been said here today. And I really appreciate the last two speakers, as I've said again and again. I think we have had, historically speaking, 2 epical periods in our nation's history. One was when our revolutionary ancestors fought and won our independence and framed a government for us that gave us the most prosperity, the most freedom, and the most safety so that we could become the greatest nation on the planet. That's the first epical period in our history, when our founders got this freedom for us. And I'm not forgetting about the Civil War, but I don't think the Civil War was the second most epical period. I think we're living in the second most epical period. And that's going to determine whether or not we keep our freedom. And that's what this meeting is all about today. A lot of the things that are going on in our streets right now are not about racism. They're not about inequality or any of that. I think most of us are smart enough to have figured it out by now that it's about liberty. It's about a complete transforming of America. And we're seeing that played out nationally. Now we're seeing it played out in play locally. And we need to be very, very careful and realize what's happening. You can say a lot with numbers, as the doctor brought out, the pastor brought out. We heard the numbers 12 and 17 and 100, but we didn't hear the numbers of the populations that were involved there. We heard about 1,000 lives being saved. I think that translates into 1,000 people that got well. And the figures have been played with and played with and played with. And as far as CDC, that's already been discredited again and again and again. So I'm not impressed with that. And I'm not impressed with what these big corporations are doing, because those same corporations are funding BLM and everything they stand for. So they're not going to impress me or influence me one bit. What the issue is today is not gun rights, it's not abortion, it's not a number of other things, it's liberty. And we'll either keep our liberty or we'll give it away. And I'll just close up real quick right here. For decades in this country, we have had our freedoms eroded a little bit, day by day, week by week, month by month, year by year. They've been slipped away from us. But now, of late, they're being wrested away from us. And that's got to come to a stop. And it's not going to be government, national, state, or local, that helps us secure our freedoms. It's going to be the people that do it, or it's not going to be done.
Take a break. Ma'am, before you get started, we do have some folks that are a little older up here, and we've been up here a while. We're going to stop for 5 minutes and go take a break.
We'll stay right here.
I apologize to you.
I'll show off my mask.
Amen.
This is the real mask.
Moment.
Yeah. I think there was just that one. And
Yeah, okay. Okay, we probably won't talk much now, but later on, thank you. Thank you. Before we get started, I'd like to remind you the topic is face mask and our ordinance. That's the topic. And if you look, there's a long line going out there, a lot of people that want to talk. So I'd appreciate you all being respectful for time for other people and make your comments to the point in regard to the ordinance that we have and to the face mask ordinance. I'd appreciate it. Alrighty. Where's the next speaker? She was here? Okay.
It's me now.
Okay.
Hi. Sorry, I'm not a public speaker, so bear with me. My name is Sarah Ryan, and my address is 673 Rosewood Drive, Branson, Missouri.
You need to pull the microphone towards you.
Sorry.
There you go.
As I said, my name is Sarah Ryan. I am the owner of Branson Party Rentals in Rosewood Floral. Many do not realize how large the wedding destination Branson, Missouri is. We do hundreds and hundreds of weddings a year. Since the mandatory mask ordinance was put into effect on Monday in Springfield, I alone with my company have had 15 cancellations in a couple days. As cancellation numbers are rising as well for couples who are proceeding with their weddings. Our industry is a very unique industry on how it functions, and it differs from all others that we have found so far. Statistically, on average, a couple spends $33,900 on a wedding and reception. But what people aren't factoring in is how much their guests are spending when they come to the Branson area. If a wedding guest stays at a hotel, eats out one meal, that would factor approximately $100 for a person who attends. On average, we have 150 guests who attend a wedding in this area. If you multiply 150 guests by $100 a person a day, at the 500 weddings that I personally do a year, that calculates out to $7,500,000 of lost, or $7,500,000 lost income a year from these cancellations. My point with giving these numbers is that when a government mandates these laws, it creates fear in the couples that are planning their weddings, which results in cancellations of events, which then translates into lost income, not just for me, but for the entire Branson area. Even if this mandate is lifted in 30 days, the damage will already have been done. This industry, which you see is a multi-million-dollar income for this area, cannot recuperate. Thank you for your time. I know you guys will do the right thing.
Oh yeah, I'll clean it for you, Sarah, because we're in the service industry, so we're gonna serve. We're gonna love. We're gonna serve. Yeah, I think we're good. Hi, everybody. I'm Sherry Holloway, owner of Sherry Holloway Photography. How are you guys doing today? Good. Awesome. You all have an important and extremely hard call to make as your own. Knowing that there are people who support this mandate and those who are against it, stating they have the right to choose whether or not to wear one. They even, the mask, they even can find evidence and opinions to prove both points. What I personally would like to see is that you let individual businesses like mine decide whether or not that masks are mandatory for our businesses. Because of the vastness of businesses, the vagueness of this is very hard. The fact remains is that you can decide to have the mask mandated, but what I implore of you, for those people who have once-in-a-lifetime circumstances, like getting married, graduating, going to a funeral of those people who have passed away, these are the clauses I want you to reflect on today. There are exceptions to every rule, and I did see exceptions up there as the lawyer was speaking today, but I did not see a wedding party and the bride and groom and the photographer being on that list, and I would like to ask that to be included. I think it's very important. All of you all probably have been married, maybe you all as well, and we all got to decide the attire that we were wearing when we were married, and mask was not on my list, right? Unless it had, sequins or sparkles, I guess, and maybe we should figure that out. Let's see. Yeah, so yeah, what if you guys were told to wear a mask during your wedding? That's pretty not good. I naturally am social distancing when I photograph weddings. I have long lenses that I use. And also, with the doctor's point about the smoking, what I have been doing, and not just social distancing and not going out a lot, what I've been doing is really working on my health and walking every day and getting my lungs, and my body in pristine, what is that called? Thank you, a shape, yes, exactly. So I don't think that anybody's ever said anything like that. And it kind of is, it's hard for me to understand because to me, that's common sense to not get colds and flus and all that. So anyway, that's besides the point. Also, let's see. So yes, thank you so much for thinking about my proposal. And then also Tate Womack, he sent this text because he had to leave. He has a quote from Jerry Henry. He said, "People who don't support masks are willing to travel, and those who are in support of masks won't travel. Branson is home of the veterans. Can you imagine welcoming them home with a mask on?" All right, thank you so much for your time, and I hope you guys will make the right decision. Thank you.
Sherry.
Yes.
Sherry.
Yes.
Thank you. These are the types of things that we need to hear.
Thank you, Jeff.
In order to shape this, if this is the direction we're heading, we have to hear these things from you.
I appreciate that.
We
Thank you
need
so
more
much.
of that.
Thank you.
Great, thank you.
Thank you.
There is a young lady back here that is in her third trimester, and so if there's someone who's willing to let her speak a little earlier so she doesn't have to stand a long time, would you just wave your hand so that people know who you are? Yeah, and somebody give a place in line. All right, thank you.
Excuse me, Mayor.
Yeah. Thank you, sir.
Excuse me, Mayor. Excuse me, Mayor.
Yeah.
Are we allowed to comment after the speakers?
I think we probably ought to listen, and then we'll have our discussion after.
Okay.
Yeah. Take notes. Yeah. Yes, sir.
My name is Joshua Heston. I am editor-in-chief of State of the Ozarks and co-manager of the Hollister Farmers Market. My address is 275 Brianna Drive, Hollister, Missouri, 65672. And I'm a little clumsy. Since March 15th, we have lived through a time of mass social reengineering. For weeks, our community has responded with respect and with concern, especially in the early days when we were told we simply did not have enough information to expect anything less than millions of deaths nationwide. However, over the last 4 months, we have seen a constant list of contradictions and errors on the part of healthcare, government, and media, and are now seeing a death rate a tiny fraction of what was first proposed. On a national level, it has been proven that the information presented by government, by media, and by healthcare is not trustworthy. Yeah. My company has experienced this firsthand. On Friday, June 12th, we were notified by the Taney County Health Department that a positive COVID-19 case had been at our Hollister Farmers Market from noon until 7 p.m. on Tuesday, June 9th. As part of quote-unquote public safety and quote-unquote contact tracing, Color 10, Branson Tri-Lakes News, KY3, and Springfield National Public Radio, as well as possible others, were notified. My team and I spent the weekend fielding calls, texts, and instant messages from the public, many of those people demanding to know the identity of our vendor and consequently the identity of the person. On Monday, the following Monday, June 15th, we learned from our vendor that the person in question had not been at the Hollister Farmers Market since May 26th, a full 2 weeks prior to the date told to the public by the Taney County Health Department. This was an error of location that also missed the mark by 14 days, and we also know the incubation period of this is said to be 14 days. Furthermore, the person in question who had been at the market showing no signs of illness 14 days prior to the time they were said they were at the market was hospitalized, was placed on a ventilator, and died later that week, not from COVID-19, but from the malpractice of having their lung punctured by the ventilator itself.
All the time.
We as a society, our businesses, and even our most basic human-to-human interactions, we have been told this based on information that we are also told not to question. But it is information that is filled with errors. In place of community, we have seen hotlines to report violations. We have seen the erosion of public medical privacy laws, and we have seen the systemic destruction of lives and businesses in the name of quote unquote public safety. Until government, healthcare, and mainstream media can make themselves transparent to trusted third-party audits, it is dangerous and it is inappropriate to enact these kinds of social changes, including, but not limited to, mask mandates. Yeah. Thank you for your time.
Appreciate you wiping it down. Thank you.
Okay. Thank you to everyone. Thank you for letting me come up and speak.
You need to pull the mic probably towards you a little bit. There.
Okay, so my name is Christina Smith. I work at I'm part of the Hughes family that owns the Hughes Brothers Theater, and I live at 368 Santa Fe Avenue in Branson. So Yuri Bezmenov, who was a KGB agent that defected from Russia, in the 1960s gave an interview where he referred to something called ideological subversion. Ideological subversion, part of what is referred to as ideological subversion is when people are given certain cues and then the responses that they're supposed to have, kind of like Pavlov's dog with the bell and the salivating and the food, right? One thing that we see a lot with COVID-19 is a lot of that response that as soon as we hear about, and this is on both sides, we hear certain terms and we get afraid or we get angry. And I believe that it's caused a huge disruption to our ability to have civil discourse about what is going on right now. And I have tried, through doing my research, to really listen to responses and research from both sides, and to not just have emotional responses to what's being given. And so starting out like that, I believe that there are economic reasons and reasons for individual health and safety that a mask mandate would not be in the best interest of Branson. And so I would like to say those right now. So economically, as we all know, there's a spectrum of people who are worried about COVID. And this has been mentioned before, but the people who are coming to Branson are in the lower half of that, which includes a group of people that are coming because they are not required to wear masks. Even if we completely disagree with those people, even if we're angry at them, whatever our feelings are about them, it would be ignorant of us to assume that the businesses around here can afford to turn away those paying customers, especially at this time of after the shutdowns. As Branson is open, cases will go up. I don't believe that a spike in cases is a reason to be putting a mask mandate in, because we already knew as soon as we opened up that would be the case. In fact, what we were told was that we were going to shut down to be able to flatten the curve, right? That would give us time to prepare for people catching the disease. But unfortunately, if our medical professionals are saying that they're not prepared, we gave them time to get prepared. And it is, from a business standpoint, it is extremely disheartening to not have an end date of any timeline that we can have. We know that you're not controlling this disease. That nobody is in control of it, but the fact that it isn't something that we can control is the exact reason why we cannot be making choices that negatively impact the businesses in our area, because we do not know how long it will last. The eyes of all upstanding business owners and employees in this city are on you now to see if, after we have complied to statewide shutdowns, if we will be disregarded and our livelihoods and welfare will be put at risk by turning away a good percentage of our paying customers. And why? Over an increase in cases we already knew that was inevitable and that we cannot stop. And in fact, if mask wearing slows the spread of the virus, if it did, which I have reasons to believe it doesn't, how can we take that as a comfort when we know that will surely mean that mandates like this will be extended? And just my perspective, if the numbers were rising in an extreme and abnormal way in this area, then a discussion about something like this would be more reasonable and more understandable from the business owner's perspective. But as I stand here and look at the evidence, I cannot say that if you go forward with this, that I have confidence in your representation of our welfare. But let's be honest, that beyond the negative economic consequences of this bill, this mandate is hurtful to the health of individuals. I do not want to disregard the importance of our economic health. We already have people and businesses that are really struggling and suffering at this time, several layoffs that are happening, and the livelihoods of those people and their health and their mental health and physical health are dependent on their ability to work and have income. But even with that aside, many people are under the assumption that wearing a mask is easy for everyone, and this is a lie. Several people with different conditions cannot wear masks for hours of their jobs without major health problems. And actually, the Occupational Safety and Health Administration, OSHA, has a respirator standard for people in professions wearing masks. If an employer requires their employee to wear a mask, they have to have a medical evaluation first to make sure that it's safe. Why? Because OSHA has before they had this respirator standard and the medical evaluations, there were businesses that killed people because they were getting heart attacks because of having lower oxygen. Lower oxygen levels is termed as hypoxia in the medical industry and leads to several of the things that we're already seeing: people passing out, people getting headaches and nausea are two of the first indicators that your body is turning toxic in the blood. when people are having these kinds of symptoms, there's not only physical effects, but also mental health effects, which I'm sure that you know. It causes stress, which I feel very much for the medical professionals in our industry who are required to wear masks all the time. And we're hearing that they cannot keep doing this. And it's not just, I believe that part of it is because of mask mandates in their workplace, that they have a lower oxygen, and they also have an increase of CO2 in the blood, which is called hypercapnia. And hypercapnia is a really big issue, because when you have hypercapnia, this causes suppression of the immune system. If we are, and further could lead to other things. One of the things is there are cardiopulmonary considerations as far as this is concerned. That's why it leads to, I guess I should say this. Hypercapnia leads the blood to turn toxic and acidic, which then can lead to, if you have any kind of heart problems or respiratory problems, can lead to brain damage. It can lead to heart attacks and to strokes. It can also lead to calcification of the arteries. There are a lot of things, but even just the suppression of the immune system alone, if we're talking about COVID and people being able to recover from it, a mask mandate in my mind is the worst thing that we can possibly do to people to be able to support their own immune systems. Not to mention that if it is a respiratory illness, that having, oxygen in their lungs might be a good thing. OSHA does not only do a medical evaluation, but they're also required to do a fit test with their masks. They're required to have documentation and an annual evaluation. And businesses, there are several businesses that have a really hard time keeping up with these regulations, but they do, because they want their employees to wear masks, and they want to make sure that their employees don't die or have serious health issues. Why are we so casually considering making it a requirement for all the working citizens of Branson to wear something that in their workplaces that could have gotten their workplaces in serious trouble? Yes, without a medical evaluation, and could lead to serious health problems and even death. Hospital workers, and this is something that I've heard before, is that medical workers, they go throughout a day with masks on and they're just fine, which, as we've been hearing, there are a lot of medical workers who are actually struggling a lot right now because they're having to wear masks in situations where they wouldn't normally. In a normal hospital situation, surgeons who perform surgeries, and this was verified by a lady who works for OSHA and works for basically has the certification for hospitals and other workplaces. They have to work, the hospitals have to work very closely with OSHA and with their HVAC systems, because what is not being told to the public is that in surgery rooms, there is more oxygen being supplied to the room in order that the surgeons and the nurses can get enough oxygen and have normal O2 levels. So when we're being told that medical professionals just do this all the time, we're not being given all the facts that they also have other things in their workplaces to make sure that they're maintaining their health. And would this, with all of this, we see that there are risks not only to our economy, but also to people's health. And then on top of that, with the effectiveness of the masks, I know there's a lot of information out there, but I will say that even an N95 mask that is one of the best, is able to block the smallest particulate matter, can only block 0.3 microns. That's the measurement of the particulate matter that can get through it. And a coronavirus particulate is 0.125 microns, which means that it cannot, even if you sneeze in your mask and it catches your snot, it will not necessarily, it will not block the particulates from coronavirus getting through your mask. And that's an N95 mask. That's not even a surgical mask or a cloth face covering. So we're taking people and saying that we're going to try to take down COVID and putting people in masks with something that isn't completely effective, and then doing that at the risk of, and this is the thing that actually sorry, I really didn't want to get emotional, but I know I really don't want to be, because I really believe in logical reasoning, and I really believe that I believe that all of you, in order to get to the place that you're at, have had to make very important decisions and difficult decisions, and sometimes emotions it makes it hard to listen to what is logical. But I will say that just like Pavlov's dog, and that food may not come for Pavlov's dog after the bell, but he starts salivating. We have a fearful response to COVID that is way out of, it makes no sense, because, and this is the reason why, 647,000 Americans alone die from heart disease each year. That's 1 in 4 deaths. And if cardiopulmonary considerations are a huge part of mask wearing, we are putting way more people at risk by making them wear masks than by having them not wear masks, in my mind, from the numbers that I'm seeing. And right now, the reported numbers, which there are multiple opinions as to whether they're even accurate, of deaths from coronavirus worldwide is 585,000, which is less than the amount of Americans that die from heart disease in 1 year. We don't know for sure what will come of coronavirus. In that regard, it is difficult to make decisions, but we must base our choices in coronavirus in evidence and data, and unfortunately, I believe that there are people with vested financial and monetary interests that are putting out information that is not actually in the interest of Americans. And I am grateful for people that have put out that kind of information to be able to study and tell whether they're telling the truth. But I do believe that until the data shows that Branson is in a true state of pandemic, that is not just because we've called this a pandemic, but because we can actually see it with our own eyes, and that they prove that masks are effective at stopping the spread of not just any disease, but the one in question, then it is an ignorant choice and a disservice to our community to mandate the wearing of masks. This is the last thing that I'll say. You are all here to decide whether this mandate is in the best interest of Branson. I have presented clear information as to why this mandate would be harmful both to our city's economy and its citizens' health. And if you still choose to go forward with this mask mandate, knowing that it will be harmful, it calls into question whether there are motives other than the health of our citizens and our economy in you passing this bill. And I wrote that before I came here, and I want to say that hearing you talk about what's going on with this bill, I have confidence in you that you will make the decision that is best for the economy of Branson and for the individuals who live here. Thank you.
Thank you.
Oh, yeah. And thank you for treating ladies like ladies. And I would like to make a good point.
I want to remind you, when we speak, we're talking about this ordinance, just as the young lady here before us talked about specifically masks and data and so on. That's what we're going to talk about today. This is not an open public meeting. This is specific to talking about the COVID-19 and masks. Thank you.
Okay, my name's Amber Thompson, and I've known Mayor Akers since I was a little girl, and Bob Simmons is my neighbor. So if you can't listen to me for a few seconds, there's a problem if they say I don't wear my mask right, okay? Because that's a lack of compassion, all right? I had a conversation with Mayor Akers not very long ago about some issues, and he cut me short. So this is my chance to speak, okay? Because I was trying to get defense for myself, which I didn't get. Because if these people here that we elect in are going to vote for masks all the time, everywhere we go, or we get arrested by police, they're not working for you. They're working for themselves, and we will remove them from office. I'm serious. I work for the Civil Defense Coalition as a volunteer, and out of all due respect to everyone in the room, if someone is disabled and they can't breathe, you can't tell them they're wearing their mask improperly. And that I give an apology to everyone in the room who was put in fear that they'd be arrested. that they would be possibly put in a mental institute or something, because these are paranoid schizophrenics we're dealing with. You understand? This is the CDC, the Civil Defense Coalition, not the Center for Disease Control. This is my voluntary organization. You can meet with me to discuss this issue further if we need to vote out their vote for masks. Because, again, they work for us. We're supposed to be in charge here. Now, we had their lawyer tell us they had 79.380 as a revised Missouri statute. That's why we're pushing heavily for people like Brian Seitz and Camille Harris and Steve Chetnick, Camille Lombardi-Olive and Steve Chetnick to get in office. Because I tell people, vote Steve or leave, vote Brian or get out of our country, because we're not voting for socialism here. We're not. If they mandate an order, you're voting the Chinese to take it, because it's one step at a time. They're trying to condition us, and it's humiliating to say you have to show up with a mask on. Does anybody in the room, are you also clairvoyant and can tell me I have a headache? Can anybody tell I have a really bad headache right now? No, you can't. You probably can't tell that I have a breathing problem too. Okay? Now, if I'm not pregnant, but I look at because I've got a kidney problem that the doctors won't discuss and help me with. And the reason I mentioned my conversation with Mayor Akers is because if these men here in these positions, or anybody we elect in these positions, is not speaking about constitutional defense of your personal rights and liberties to breathe in this country, there's a problem. And it starts with trying to get attorneys involved, okay? Because if you talk to a policeman, what's he going to say? Get an attorney. And guess what the problem is? You can't find an attorney. Not a single attorney will help you. How many of the people in the room, raise your hand if you're tired of having to wear a mask all day because it's giving you calcified arteries, breathing problems, okay? How many people are tired of the government not standing up for our rights? Again, they are not in control, we are. I sat outside for 4 hours protesting for you, and these are our angels in the room. Everybody that's here, and they say they come back here week after week. And I made a sign, it may be offensive, but I offend to defend. It says Mayor Akers can kill senior citizens with mask asphyxiation orders. Okay? Because I worked in physical therapy as an assistant. And if I was asked and forced, I would lose my job if I didn't put a mask on a senior citizen while they're doing their exercise and it killed them, I would be a murderer. I would be encouraged to murder people, okay? That's something that I do not approve of, and I think, again, as all the preachers in the room have spoken, and all of us are out of it devout constitutional liberty defenders, we're not going to defend anybody that pushes to kill or to steal. Thou shalt not kill, thou shalt not steal. I have tried to get the preachers in our communities to speak up above, not just with pro-life, but pro-life plus. I came with my own concept, pro-keep. Keep children in the biological family. When the government gets to the point that they allow people to steal children from one family to another, their morals are so low, you can't trust them. You can't trust them. And so, it goes one step at a time. When you go through Culver's drive-thru and it says, and they lie to you and say, well, the U.S. currency is low in shortage, so we can't take currency. You have to pay with a credit card. They're conditioning you. Again, it's one step at a time. Make us all fools that we're not, okay? And they use, again, the police, and that's why they're pushing to defund the police. And this area, too, we'll defund the police if we have to, and defund social workers.
Help me understand what you're talking about mask. Okay.
But again,
you got off.
Yeah, right here. End mask order oppression. Quit suffocating our rights. I'll read it to you. You are paranoid schizophrenics. No Darth Vader mask. And the reason, I offend to defend because, and that's enough, but I want to say something. One more thing, okay?
There are other folks in line.
I know it, but they got to speak for 25 minutes. Again, PPE, is the hospital director here still that was speaking earlier? Is he here? Because I wanted to ask a real important question. There are too many rumors going around right now. Okay? There are too many rumors. And they say that if you have COVID, okay, and you're at the hospital and you die, and they put you on a ventilator and possibly suffocate you with a ventilator, they get $30,000. Is that true? Does anybody know? Is that true? Who works for the hospital and can verify that? That's the stuff we should be discussing up here with these mayor and aldermen, okay? And again, I offend to defend because people have also accused me of being crazy in order to steal and kill away my children to strangers. But PPE is personal protective equipment versus product profit abuse. And they're trying to get you to buy all these products for their abuse reasons. I'm telling everyone to vote out the incumbents because it's got congressional stagnancy and people are not sticking up for our rights. The ADA, American Disabilities Act, again, is being violated. If you're going to allow businesses, private businesses, to tell people they have to wear a mask, which is, again, we have the right to sue them, okay? The only thing they could possibly do is have people wear a sticker on their shirt that says exempt. Because you know as well as I know, predatorial, intentionally entrapping calls we made to the police to have those people arrested.
Ma'am, I need to cut you off.
Yeah, and I have one more question. I know you don't respect me as much as the other people because you knew me as a daughter and a child, but I'm not a child. And until this community treats adult women like myself and respects civil rights, we're not going to respect you, period, okay?
Thank you.
And I have one more thing to say. When I went to apply for a job and I interviewed with Spinnaker Resorts, I was told, with the hostility of Mr. Mayor over here and his police, he tried to tell me that I could not even interview for a job. So I was not even allowed employment because I had dropped my mask to breathe as an asthmatic. And I was almost not allowed to even speak to this meeting, which is a constitutional violation, if I couldn't wear a mask, which I could not because I can't breathe well. But thank God the police had no compassion to let me have my mask. So that's one thing I demand of you, Mayor Akers. Have compassion, no mask order.
She didn't wipe off the, there we go.
I'm not worried,
Yeah. Well,
or I wouldn't be here. I've only got a few more years left. COVID doesn't scare me too much. Anyway, I wanted to, now, we're talking about the mask here, and one thing I want to reiterate, and I've talked to a couple people here about it, the whole fallacy behind this is the methodology that they're coming up with, the numbers that they're using for the excuse to regress into face masks. The two tests that they're using primarily for this are the RPCR test. It does not take a lot of investigation to see that that test, as conversed from the guy that invented it by the name of Kerry Mullis, reiterated that you do not use that test for diagnosing a disease. And there's a lot of reasons why that he felt that way, because he had an ongoing debate with Mr. Fauci back in the late 80s, early 90s about this, and it had to do with the HIV virus that they were trying to say that it causes AIDS. There were a whole series of doctors that didn't believe that tract, and so he didn't believe it, and then he ended up getting a Nobel Prize for that invention for a research tool. So what happened is this is what's going on here with this. Mr. Fauci, the CDC, the NIH, the World Health Organization are all in cahoots together to market a vaccine or a protocol for treating a virus. Okay? It has nothing to do with anything else. Okay? And Mr. Mullis basically called those people a bunch of morons for trying to utilize that test for deciding whether somebody had a viral disease. So as this went along, basically he invented the disease. The company he was working for they sold it to Roche, and they started just using it to test to see if they could figure out what the disease was going to be. It does not test for a virus. It tests for a particle of DNA. Has nothing to do with COVID, has nothing to do with any other virus. It has to be, it's a very tedious thing. It has a lot of complications to it. If you're trying to manipulate a disease in there to prove that somebody has an active case of something, it's wrong 80% of the time. That's documented if you do just a marginal bunch of research. Then it gives you false negatives 80% of the time, false positives 30% of the time. Now the next test they do after you have that, they do a serology test, and it's almost as bad as that one is. So we don't know really any logical testing that we're getting here that actually prove that there's anything really going on other than the symptoms that people are having. And half the people they test that they say are positive don't have any symptoms at all, and they can't prove if they're asymptomatic or not. you know, and like I said before, just a marginal amount of research on this stuff will tell you that. Now, problem I have with what's going on now is we have these tests, and they've revised the way they count cases. First in March, they did it again on 5/11 of this year, and I happened to stumble on a city council in Collin County, Texas, and they had the council sitting around a table, and they had a lady from the health department in there explaining the new changes and how they were going to record these diseases. And what they came up with is this, and I brought this up here last week. This is what she had on a PowerPoint, okay? The Department of State Health Services distributed a new case definition for COVID issued May 11th. They had their meeting on the 18th. They're going through confirmed case definition, no change in case definition, need a positive PR lab test. There's the test. It doesn't really test anything. That's what everybody is using. New probable case for definition, and it goes through that. So you go to the next page, and they have this color-coded thing here. You can actually go, if you want to pull up this meeting, you can go in and put in 5/18 County Commission meeting in Collin, Texas, and you don't want to watch the whole 2 hours. Believe me, you want to fast forward 25 minutes and let them discuss this, and it will blow your mind on the ignorant discussion that you will hear over them implementing and counting. So the current definition is you have a person that's tested positive here, and then they do the contract tracers and counters, and they go out and they make a list just like we know they do, and they come out and they go through, if you have a 3 family here, another person that he hangs around with, and so on. So out of these additional cases here, they do not perform any other test, and they don't count them. They only count the person that tests positive. Okay, now fast forward, and this is where the lady got these people googly-eyed over this, but here's the same thing, the same guy, the same amount of people, and they have a positive test here, which doesn't test anything. Then they are not requiring a test on any of these other people again, but they are counting them as cases. Are you getting the picture here on why this stuff is exploding? Now, what I would recommend that you do before you vote on this, watch this video of this county commission discussing this in their heads on how they're wrapping their heads around this. And one of the questions was, they asked the lady, what do you think this is going to do? Well, she says, well, it's going to cause more cases. Duh. You know, so that's how the explosion of the cases. There are not any more people testing positive because they cannot test accurately any of these things that they're doing. Now, if you back clear up to when this all started, they didn't have any testing equipment. They were just guessing, and that's basically what we're doing now. We're guessing on these numbers. But the problem is you've got an enormous amount of money wrapped up in this stuff from a variety of places, and you know, that's the problem. You create all kinds of corruption when you have a money-driven, marketed tool for the purpose of selling a vaccine to people. So the next thing is when I watch the gentleman here talking about the legal liabilities here. Now, if you have a person like Mr. Fauci or Francis Collins, the CDC director, Azar, and some of the other people up there, that not only are they in the government, they have the ability to decide who gets the contracts. They have patents on all of these diseases in the CDC. Why does our government have a patent on a disease? Because they artificially created it. And this is one that has one. And so does SARS, so does Ebola, so does MERS. Everything clear back to HIV was a genetically altered virus. And they've had the HIV. How long has that been out there? Since the mid-'80s? They have never been able to make a vaccine for that, because if you know anything about viruses mutate. By the time they go through 4 people, you've lost any advantage on creating a vaccine, and you'll never have a good vaccine that does anything to a virus. So the other thing that's really bad about this, you have other doctors around the country that are using other protocols that are actually having more success. Like our one here at Cox says, oh, we don't have anything else to offer. Well, there is stuff to offer. Okay, you have the guy in Boston that he was using the Hydra. There you go. Okay, well, listen to the cases on what happens to somebody like that opposes the medical hierarchy directed by Mr. Fauci. Well, he had 100 cases at the time he brought this up and put it out publicly, and he had not lost one patient. It was that protocol and zinc and vitamin C intravenously. Well, they didn't want that because they're trying to push the protocol they're wanting, which is Recidimir, which had already had a lot of problems. They had about 400,000 people got maimed and died over what Mr. Fauci wanted to sell because he has a piece of the action. Okay, so don't take Recidimir if you want to maintain your existence. You know, that's what I would say if you end up having supposed this vaccine. Now, there's another doctor. This guy's named Dr. Richard Bartlett. He's in Midland, Texas, and he was doing a show about a week or so ago, and he's using a nebulizer with a certain steroid. Okay, he has not lost one COVID patient yet since he's been using this protocol. Guess what happens to him? Guess what happens to the other guy or anybody else? They get their research grants yanked. They never get reestablished in the research committee because they're going against the grain of the protocols of the people that want to rip us off for getting charged for what the other stuff is. Recidimir is, it's about $1,500 on the low end and $5,000 on the other. Tell me, help me. It's $9 a pill, okay? This one here is about $20, and that's the game they're playing with us here. It's to make money. It has nothing to do with health. It has to do with power. So now, the legal part of this is there's several aspects here. You had the Nuremberg trials for experimenting medically on human beings without their consent.
Doug, are we getting a little off track here?
No, this is exactly pertinent. He put up his chart up here that said that we can do this without any repercussions at all legally. Well, I'm telling you there are repercussions legally from here clear on up to Mr. Fauci. And the reason that it gives you that is because if there is fraud in what they're doing on the top tier, using manipulations, marketing something that doesn't work or to gain financial benefits from it, it violates, there's 6 things it violates. 2 things of the Constitution, the Sherman Antitrust Act, the Clayton Antitrust Act, one other further thing on the Constitution where you can't intermingle directorships of different companies to collude to put a product out that you know is not going to work. Okay, that's fraud. So the exclusion to that is if there is fraudulent intent, that's the only thing that you get exempted. Up until that time, you do get exempted from things. If you make a vaccine right now, kills a bunch of people, they got an indemnity against it since 1986 that you can't sue them. You know, they don't test it. They don't test it on. They're not even testing this one on animals. They went straight to the human test, and half of the first batch of them have had all kinds of problems, very serious problems, on the one they want to give us for COVID-19. So I would say I'm suspicious of government in general because what I figured out since I was a kid and went into Vietnam and read what happened there, I don't trust anybody that's telling me that, oh, we need to do it against communists. Oh, we need to do it against the Arabs that are trying to blow us up, you know. Well, guess what? Our own people are doing it to us.
Well, Doug, would you?
That's it.
Okay, thank you. You did such a good job of wiping off that. You forgot to give your name and address.
What? Oh, 121A, St. Andrews Street, Branson, Missouri. Phone number is 337-4545. If anybody wants to see this is one of 50 books that has to do with this. And if you look at this stuff, it's from the sources, it's from the abstracts that these people created. By the way, they created the COVID-19 in a lab in North Carolina, and it's a genetically altered virus. And guess what? We paid for it, and then they transfer the certification to the lab in Wuhan, and that's how it got over there. But you don't hear them talking about that.
Just to point out, I'm one of the ones that should not have to wear a mask, but I'm not going to tell you why. It's none of your business. It's a violation of my ADA and my right to privacy. So, I'm one of the ones that shouldn't have to wear a mask, but it's nobody's business because that violates my ADA rights and my rights to privacy. I'm going to start off, and I'm going to be quick. I'm not going to go through my list. If you want to look at my questions there, I thought they were pertinent. But I think this is important. This is a copy of the Constitution. And this is part of the Declaration that I think...
Ma'am, did you give your name and your address?
Camille Lombardi Olive. I'm running for Congress, 789 Everest Road, Galena, Missouri. Just a small paragraph, I think, speaks to everything about what's going on here and what we're being denied and what we're being oppressed by. We hold these truths to be self-evident that all men are created equal, that they are endowed by their Creator with certain inalienable rights, that among these are life, liberty, and the pursuit of happiness, that to secure these rights, governments are instituted among men, deriving their just powers from the consent of the governed. And therein is the problem. They don't have our consent. They just keep adding rules and regulations. Now, what I have here is, I don't do something unless I do my homework, and I specifically geared it to Missouri. So, Missouri. Missouri. Now, the president said the curve was going down. That was in May, if anybody recalls. Do you all remember that? Yeah. The cases were declining. What happened the third week of May? Right there. Right there. Do you see what happened? We had protests. We had looting. We had people, thousands, running wild in the street. Zoop! Up went the numbers. Now, either they're lying that it's not as contagious and we don't have more cases, or else the protests that CNN, MSNBC, NBC, CBS, New York Times, Wall Street Journal, Washington Post all said had no effect on the COVID and the spread and the transmission. Either they're lying or something else is going on. This, by the way, is from Worldometers. Worldometers is a site that lists corona by country. It compiles all the information from hospitals and direct-to-person information. So that's where all these graphs came from. Now, they're talking about how bad it is here. We have to shut it down. We have to mask. We have to do this. Okay, this is us here as you see the curves going down. Now, we have about 1,031 deaths. Well, let's look at the last 4 years just with flu. Just with flu. Let me see, 2018, 2017, 2,081. 2016, 2017, 2,093. 2015, 2016, basically every year except, oh wait, let's go to 2014, 2015. There were 2,937 deaths just from pneumonia-based flu. We only have 1,000 from COVID, but yet it's a disaster. Yet we have to shut down, yet we have to mask ourselves. Now, if you look here, this is South Dakota, and I'm just using that as a comparative analysis. They never shut down. They never shut down, but if you look at the curve, they're going down, they're going down. And I'll point out two other examples. Here's Italy. Does everybody remember Italy, ground zero? Everybody was dying? Well, geez, what happened to their curve? Where did it go? They're already back to life. They locked down for 2.5 months, and now they're back to living, and geez, look at here. Look at here, and look at, we have Afghanistan and Pakistan. The reason I show you those two countries is they border China, and I was actually in those two countries. I was in Pakistan when this started. I was in Afghanistan last year. Now, why on earth in Afghanistan that only locked down for 4 weeks after Ramadan, and they don't even wear masks anymore, why is their curve going down? Same in Pakistan. Okay, they don't have medical like we have. They don't have 24-hour electricity. Okay, they don't even have access to clean water. But yet, in this third world country that doesn't have access to all the privileges and advances we have, their curve is going down. Their cases are going down. Okay? Sweden, same thing. But what happened in Sweden, by the way, did not lock down. But you want to lock us down. Because a mask is a lockdown. I don't care what anybody says. To continue and mandate a mask is to continue the lockdown in this country. And let me tell you, this failure, this is not my failure. This is not the president's failure. This is the failure of somebody that wanted to cause trouble and decided it's okay for thousands to run rampant in our streets and destroy things without worrying about being masked, because there's no other way you're going to explain this. So my point here is we're turning into Nazi Germany. They have a number in Springfield that you could even call 911. Go Google it. You could call 911 to report a severe violation of the mask ordinance in a business. Okay, so we're going to utilize the police that you want to defund. You know, these guys put their lives on the line every single day. They are the front line of this disease, but yet one side of the country wants to defund them and put social workers in there, but yet now you're telling them you're going to have to ticket this person and arrest them and do this and do that and body slam them and God knows what. Get your priorities straight. Either we support our police, we protect the law, and we make the law righteous, because if it's not righteous, it doesn't exist. We cannot stand. And that's what's happening in this country. You've taken our rights, you've taken our freedoms, and you're telling us this is what you will do because this is how I dictate it. And if you don't think that's bad, go to Afghanistan. I lived there for 10 weeks last year. Do you know who has rights there? The people holding the guns. And the people holding the guns tell you what your rights are. And believe me, you really don't have rights. If the police want to disappear you over there, you disappear. If the military wants to disappear you over there, you disappear. Because as a human, you don't have rights if they think you broke some rule that they came up with. And I think that's what this mask mandate is. You're making the same kind of fascist rule to deny us our right to freedom. And I'm telling you what, you're preventing me from breathing free. Thank you. There if you want to look at them later, because I'm not going to take up more time. There's other people. But I have a list of 20 questions I thought were pertinent.
Thank you. Wipe it down.
You're pretty tough competition.
Ribs for dinner.
Good afternoon, Aldermen and Mayor. My name is Joshua Pope. I live on Nyhart Street in Branson. You heard me speak last month in support of Black Lives Matter, and I still do. I never thought that I would have to come up here and protest both racism and common sense in my lifetime. I thought this was going to be done with back in my parents' age and grandparents' age. I didn't think that I would have to do that. But here I am, and here we are. I live with my grandparents. My grandpa turned 73 this year. My grandmother turned 77. She has a cancerous nodule on her lungs. She's often on oxygen all the time and feels like the air is being choked out of her. I often imagine that as probably what the 3 million people who have had COVID will tell you the same thing. But instead, we have this anti-mask rhetoric going around, and people relying on false science and not listening to the experts. And you're never going to be able to change their mind on it. It's just the way of life. I know the economic harm of this pandemic. I worked at Rib Crib. I was a manager over there. I was finishing my management training the day that we closed down Branson. And in return, Rib Crib closed, the one in Branson anyway. I lost my friends there, my family, they were family to me. I had made a lot of friends there, and I enjoyed what I did at Rib Crib. And I supported the lockdown then, and I still support it now. I think that it was the right call. I never once regretted the decision to do so, because I felt like what I was giving up temporarily was worth saving the lives of many others. I can't believe I'm the first one that has to come up here and say this besides the doctors that worked at Cox, but I am. The history of pandemics in this country doesn't start here. It's been throughout history, all throughout this world. I'm a history student. The measles, smallpox, they had no resistance to it, just as we have no resistance to COVID-19, killed millions and they were conquered afterwards. The bubonic plague, they didn't have the science and the technology to understand what was causing it at the time. A third of Europe died, and it was centuries before it returned back to what it used to be. The Spanish flu, which would be in my great-grandparents' memory, maybe some of y'all's grandparents or parents' memory, and my grandparents' parents' memory, killed 675,000 Americans, 50 million people across the world, and it has a lot of similarities to this disease. In St. Louis and Philadelphia are two exact contrasting differences of how they handled the Spanish flu. It spreads a lot, the similarities the way that COVID-19 does. St. Louis enacted strict measures for social distancing and masks and so forth, and they had 358 deaths per 100,000 people. Philadelphia, on the other hand, disregarded science, and they held events, rallies, protests, parades, whatever you can imagine, lived on their lives like normal, and they had nearly double that at 748 deaths per 100,000 people. It just goes to show how many people can be saved off of just following some simple measures that doesn't infringe on your freedoms, because by you not following those measures, you're infringing on the freedoms of every other citizen that has the right to live. You're infringing on people like my grandmother, who COVID-19 would be a death sentence for. My sister has severe asthma and has been hospitalized over it constantly. Both of them are not against this mandate. I'm legally disabled, and I'm not against this mandate. I do not feel like it is discriminating against me, and my family does not either. In order to say that wearing a simple face covering is infringing on your freedoms as an American citizen completely neglects and disregards the fact that by you not wearing a mask, you are potentially infringing on the right to live by other people. See, there's some math here. 20% of all the cases, according to the World Health Organization, leads to hospitalization. Taney County has a population of 56,000 people. In March, the New York governor estimated 40 to 80% of their citizens would get COVID-19. California estimated 56% of its people. And the Imperial London College of London said that 81% of the United States would get COVID-19 without proper measures put in place. If you followed that math and you gave it a conservative estimate, say 40% of Taney County gets COVID-19. That's 22,400 people that have the virus. Let's say only the 20% of that gets hospitalized. That's 4,480 people. If we follow the standard death rate that most models follow at 5%, that's 1,120 people in the morgues at Taney County. So go ahead and ask any medical professional, any doctor, the hospital at Cox Health, the funeral homes in this area, the Taney County Health Department, if they could handle such an influx of patients at one time or dead bodies. You thought that that tourism was hurting because of the virus, that the Ride the Ducks incident hurt our image, that the Black Lives Matter protests and the KKK in our city hurt our town's image. Just imagine that when the Newsline is next saying this, that Branson infects thousands of tourists before returning home to where they live, which would in turn infect thousands more. If you, assuming that all of that was true, then we would have a catastrophic public image on our hands. Our tourism would be hurt far more than you could ever imagine by having masks mandatory due to those headlines. It's important also to mention that a significant number of victims hospitalized have organ damage. The virus is a vascular one. It causes heart failure, strokes, kidney failures in young patients, and more. The tissues of the lungs, heart, and kidneys and other organs have been collected and studied, and those studies have found that many victims will have irreversible organ damage for the rest of their life, likely shortening their lifespan by decades. The mortality rate, permanent damage, and hospital rates of victims drastically increase with age, and Branson has a large senior population, as well as we host many elderly visitors every year. We are a unique situation that Springfield, St. Louis, California, any of those other places likely don't have to deal with as much as we do with our industry, and as small as we are. It's important to touch on the misinformation that anti-masking rhetoric spreads, such as people comparing it to the flu, claiming masks don't help. That's their body, their choice, and if other wears a mask, why should they? The way masks works, which is why boxes of surgical masks claim on them they don't protect against COVID, is because they don't protect you against COVID. It protects other people from you. If you enter a contaminated environment and you breathe in COVID-19 with a mask on, it'll protect you some, but not much. But if you breathe out, your moisture and what you project is blocked, it's shielded by these masks. It helps save people who aren't wearing masks. If you both had masks on, according to some studies, it would only be a 1.5% transmission rate. It's 70% if one person is wearing a mask and the person who is a COVID-19 carrier is not. Here's an example to kind of simplify it for some people. Pretend it's a cold weather day. You can see your breath, it travels quite far. That moisture droplets are visible due to the cold. And if you were a COVID-19 carrier, those would all be infectious. Another analogy I like to use, because it's a pretty simple one that most people seem to get, is the pee method. Pretend that everyone's running around naked. Awful thought, I know.
That's awful.
Someone decides to pee on you, and you get wet. You are wearing pants, but everyone else is still naked, and they pee on you. You don't get as wet, but you still get wet nonetheless. Now let's pretend you're both wearing pants, and some guy tries to pee on you. He's just gonna wet himself instead. And that is how masks work. The argument that it's their choice and their body is invalid, because the decision not to wear a mask is not because it's their choice, it's putting others in danger. We don't ban Coke, we don't ban cigarettes, we don't ban alcohol because they end up killing people in the end. We don't ban them because it's the sole person who's doing it to themselves is fault that they are going to have those consequences. The reason why this mandate is different is because by not wearing a mask, you're not putting yourself at risk necessarily, you're putting other people at risk and jeopardizing their lives. You're infringing on their freedoms to be forced to stay home, not to go grocery shopping, not to be able to enjoy their life. My grandmother would love to be able to go shopping to Kohl's because that's what she likes to do, but it's too dangerous for her at the current moment.
Mr. Mayor, could I ask for call of order? It's hard for us to hear the galleries talking. They're not paying respect to the man like he paid for the others. Please give him his time, please.
I'm not far off here. I was supposed to work at 5 o'clock in Ozark. I'm a server. I'm gonna be late, probably written up, but I felt like it was important enough that I took my stand and voiced this here for you guys. I am not disregarding the economic impact of it. I lived through it. I lost my job. I lost my friends. I lost where I worked at. It's at the inconvenience of others to save the lives of many people should not even be up for debate. If you use the argument that you're pro-choice and it's your body, your right, I now condemn you for the fact that you can no longer say you're pro-life. Because that same argument that every woman makes whenever she says she's pro-choice is the same argument you're using to go against the mask mandate. You say that she's murdering a fetus. Well, you're potentially murdering countless other people by not wearing your mask. In the flu from October 2019 to April 2020 killed up to 62,000 people. We have not had this pandemic for nearly as long, and we have doubled that. The COVID-19 does have a lot of similarities to the flu. We don't take the measures that we take for the flu to COVID-19 because we have vaccines for the flu. We have resistance to the flu. We've dealt with it for many generations. We know what to expect. We know how to handle it. We have the medication to do so. People still die, but we're in a much better position with the flu than we are COVID-19. We have nothing to help us from that. All we can do is take the measures that we need to take to try and protect people, to save lives, even if it is at the inconvenience of other people. There's been a wide sweeping measure across this country to enact mask mandates. 20 states have mandates. California, Oregon, Washington, Nevada, New Mexico, Texas, Hawaii, Kansas, Louisiana, Illinois, Michigan, Kentucky, West Virginia, North Carolina, Maryland, Delaware, Pennsylvania, New York, Connecticut, Rhode Island, Massachusetts, Maine, and now Arkansas. So make that 21. And Colorado. Okay, make it 22. These states have chosen to lead and protect their people following the studies of science and the effectiveness of masks. The University of California stated that if everybody wore a mask, that if 80% of the people wore a mask, that it would have a much stronger effect on COVID-19 than a lockdown ever would, which in turn would save us a lot more money for Branson and tourism than locking down our city, and it would keep us safer. If we deny this mandate, which that's the states alone, that's not counting the countless cities who have done it themselves, like St. Louis or Springfield or Kansas City, we are claiming that we know better or not care enough to follow what they believe is a credible threat. It's easy to look at each death, each case, each statistic is just that, a statistic. But they aren't a statistic. Every case someone is dealing with is potentially life-threatening battle and suffering. Each case is somebody dealing with possibly a lifetime of complications. Each death is a person with a mom, dad, sister, brother, son, daughter, wife, husband, grandma, or grandpa. They may be just a number to everybody here, but they are the world of somebody else. They are people. And I ask you not to trust my word, my countless studies of research and watching of information. I want you to research yourself with an attempted unbiased. I want you to read the countless sources of experts agreeing with me. I want you to ask doctors, health experts, hospital staff, and those who have contracted COVID-19 and lived to tell the tale. I support this mask mandate. We have an incredible advantage that our ancestors did not. We have the lessons of history and access of knowledge that none of them ever dreamed possible. We have the opportunity to be an example to other communities and protect our people and our tourists visiting us. The numbers I gave you earlier was just for Taney County alone. What do we do when the tourists come here and get sick and they're not well enough to go back home? They're going to be in our hospitals. They're going to be in our healthcare facilities. If we think that we're going to be stressed enough dealing with our own people, how are we going to take in all the people from around the country and the world? To be selfless and show that we will suffer this together, and to accept the inconvenience and discomfort of wearing a mask so that we may do everything possible to help everybody live. I know I would want you to do this for my grandmother, and that's why I wear my mask, to protect yours. Thank you.
Thank you.
All right. Can y'all hear me okay? All right, awesome. Pro tip for any of my ladies and anybody else who may wear high heels, bring some extra shoes if you're planning to stand in line, because I made that mistake and not comfy. Alrighty.
I left mine at home.
Right?
Hey, we're
Smart
glad
move,
you
smart
did.
All right, Mayor and Board of Aldermen, good afternoon. My name is Audrey Richards, and I am a congressional candidate as an independent candidate to represent Missouri's 7th District in Congress. Love that the news media left before I got to say that. Nice. Hair flip. All right, so my name is Audrey, and I actually grew up here in the Branson area. When I went to college in Washington, D.C., I told everybody that I was from Branson because I love the values that our community stands for. I'm proud to be from here. And I want to go ahead and actually voice my support for the amendment that y'all are talking about, because I have the utmost respect for Administrator Dobbins, but I think that having elected officials make that decision is probably the more prudent way to go.
I voted for it that way to start with.
So now, with all of that in mind, and my pride at being a Bransonian, I want to talk to you about the two things that Branson is known for: faith and freedom. Now, my church was a big part of my personal development, and that belief system informs my actions. And I'm willing to bet that a lot of the people over here who were concerned about me showed compassion whenever I had to sit down because I'm a little bit of a moron who didn't bring extra shoes. I believe I would be willing to guess that that belief system is the one that they would share. And that same compassion is what informs my decision to wear a mask. Now, people claim that not deciding to wear a mask is an individual risk and that the fatality rate is quote unquote low. We have already had 3 deaths in our county because of this. And so I suppose, candidate Seitz got up here and said, enough is enough. Well, my question to all of you is, how many lives are you willing to risk? When is enough enough? All right, because we've had so much, that has been going on throughout this community. We are up to 130 something cases when I came into this meeting, and now the medical professionals are telling us it's 142. It just keeps going up and up every day. And all throughout the Bible, it is said that we have to value individuals as children of God, and that every life has value, so the preventable loss of even one life is not reflective of Christian values. Now, we are in the middle of a pandemic that is getting worse, not better, and this ordinance is a safeguard against it getting worse. And I don't know, what exactly constitutes a quote-unquote true pandemic, as someone said earlier, because pandemic or quote-unquote true pandemic, I don't know what the difference really is, because all I know is that if somebody coughs on me, I'm not going to be very happy about it. So I suppose that my whole thing is that masking is a minor inconvenience with 8 different exceptions that our city attorney listed out. So it is a minor inconvenience that can save dozens or even hundreds of lives in our city and county. It is inexpensive and yet incredibly effective. Now, not to be all, Jesus-y, but in John's first letter, they ask, how does God's love abide in anyone who has the world's goods, sees a brother or sister in need, and yet refuses to help? Well, we don't need the world's goods. We just need masks. That's it. If this measure can save even one life, then we have the responsibility to abide by it. Everyone likes to believe that they would be the Good Samaritan that puts their well-being above that of someone else. Well, this is your chance to prove it. Now, every argument against this masking requirement begins and ends with quote-unquote freedom. It is true that America is a free society in which people are able to make choices for themselves. However, in this country, no one gets to make choices that put the well-being of others in danger. The CDC released a statement on Tuesday. I know that's not y'all's favorite organization, but they said that the main protection individuals gain from masking occurs when others in their communities also wear face coverings. With this in mind, I argue that masking is not in contradiction to our freedom as Americans, but is actually a core part of who we are as Branson citizens. Because we are people who care about others and are willing to go to any lengths to make sure our town can remain open without risking the health of residents and tourists. And that is what makes us look good on a national stage: compassion and a willingness to listen and take risks that may not exactly be comfortable. But we care about the people that come to our town. Now, in order to keep Branson open, to prevent us from bouncing all the way back to phase 1 once this becomes a quote-unquote true pandemic, we must actively limit the spread of this virus. And if everyone wears a mask, businesses are free to operate because everyone is at a lower risk. If everyone wears a mask, tourists are free to go see Clay Coopering or other shows because the audience and staff are at a lower risk. And if everyone wears a mask, it frees up hospital beds, lifting the burden on our local hospitals and healthcare workers. And that is the sort of freedom that we should be celebrating. Everyone who comes up here and shouts freedom is really just saying that their personal choices are more important than the well-being of everyone around them. So I urge the board to pass this measure because our lives are not yours to risk. If one life does not matter, then none do. Thank you.
Be sure and wipe off the, please.
I'm going to hit the restroom, Mr. Mayor.
Pardon? Okay. I think we're just going to take breaks when we need them now. Try to stop. Thank you.
Good afternoon, evening. My name is Pearl Haining. I live in Branson, Missouri. I apologize for cutting in line, but I'm becoming extremely fatigued and I would like to speak before I cannot. I'd like to begin this evening with a question. Quote, she's immunocompromised and not wearing a mask. Shame on her, unquote. That question is not obviously directed at any of you. That question was directed at me after I spoke at the May 4th council meeting here, addressing whether or not to mandate masks. The answer is a resounding yes. I did not and will not wear a mask as a responsibility for my health and the health of those around me, because I know that with an easily compromised immune system, if I wear a mask, it will compromise my health, quickly causing me to become ill and putting those around me at risk. Since the May 4th council meeting, I have not experienced any illness, nor caused any illness among my friends. Instead of asking, why won't you wear a mask? A better question is, why would I wear a mask? To prevent spreading COVID-19? The COVID-19 virus is significantly smaller than anything a cloth mask will filter. Yes, but the virus spreads through droplets, and a cloth mask can prevent you from spreading droplets, right? Wrong. Droplet precaution is a legitimate medical protocol requiring doctors and staff tending symptomatic patients to wear a sterile mask, gloves, and gown while with one patient, and those items should be immediately discarded upon exiting that patient's room. Immediately discarded to prevent the healthy individuals from physically carrying any droplets expelled by the sick patient on their clothes or skin. It's all or nothing. You don't just put on a mask and call it good. Now, the doctor's statements earlier were correct. The space around the ear loops, etc., does allow air to circulate. It also allows virus and bacteria to escape, and although that mask provides little protection by itself to begin with, if you touch the mask at all, for instance, if your glasses are fogging up, then you touch another surface, you completely nullify the point of wearing that mask. Now, proper PPE has become extremely rare and overpriced due to the extremely high current demand, making it very hard for healthcare providers to acquire. Maybe Cox Health is sufficiently provided for at this time, but there are thousands of other independent healthcare providers that are having an extremely difficult time trying to procure that. Now, I know maybe not thousands in Branson, but definitely several in Branson are struggling with that. Mandating masks be worn by the general public, I guarantee you, no matter how you describe the term face covering, mandating that the public wear masks or face coverings of any kind will result in further depleting those resources for all of our healthcare providers, further stressing our already burdened, understaffed, and now underfinanced healthcare systems. Universal universal masking of seemingly healthy individuals is not a droplet precaution protocol and ill-proven to stop any transmission from quote-unquote asymptomatics. But what about great clips, you ask? A better question is, what about China? Universal mask wearing has been extremely common in China since 2002. Yet that is where this outbreak sprang from. What else do we know about China? Stroke, heart disease, COPD, and lung cancer are consistently their top 4 causes of death. Don't tell me that if somebody contracts COVID-19, it's going to result in long-term damage to them. And so we should wear masks. Everyone should wear masks to prevent those individuals from contracting it. Because by mandating that everyone wear masks, we are coincidentally causing long-term damage to everyone. In an attempt to filter the air coming in or out, the only result is that all bacteria, virus, pollution, etc., gets held against the face to fester and grow and be repeatedly inhaled. Mandatory masking does little to protect others and puts the wearer at a greater increased risk of infection, stroke, cancer, yes, even death. Sirs, this bill is not a reasonable proposal, as our attorney has presented it. You are considering requiring all employers to mandate their staff and customers wear masks without any knowledge of their medical needs. Any employee whose health is damaged after being forced to wear a mask without medical conditions being considered and reasonably accommodated has extreme grounds to sue their employer. And those employers would have extreme grounds to sue this city. The bill you are considering poses multiple affronts to legal business procedures. Branson businesses cannot legally be forced to put their employees' safety at risk or refuse service to a customer who is physically unable to comply with this proposal. No business can force an individual to present legal documentation of medical history on the spot. That is a gross violation of HIPAA. And terminating an employee because they cannot wear a face covering is clear violation of the ADA. By the way, that is punishable by a $75,000 fine for the first offense. Make no mistake, this proposal is unlawful and unenforceable. It will create division and turmoil like our city has never seen, hurting our citizens, repelling our visitors, and severely hindering our police at a time when they need our support more than ever. It's not about freedom. I would posit that although our freedoms as Americans are very important to us, those freedoms are important because that's what gives us the right to make the decisions we need for our own health. And I know firsthand that if I take care of my health, I'm way more likely to be taking care of the health of those around me. And if you force the Branson population and visitors to be consistently wearing face masks, our immune systems will quickly go down. We will quickly be putting our community at a much greater risk than anything we've been in previously this year. Now, your proposed signage tells our visitors that they must wear a face covering, but there is no mention on that proposed signage of the exceptions we're making. How is that welcoming to any visitor? It's not. It's an immediate turnoff, and you can ask any of the shows in town who are consistently getting calls at their box office. Are you guys requiring masks? No. Good, because we wouldn't come if you were. Is it not ironically impractical for a city whose mayor just last month issued a proclamation of how we are, quote, committed to providing a welcoming and inclusive environment for all citizens and visitors, unquote, to institute such a divisive, discriminatory, and oftentimes hostile policy? I'm here today in spite of our city administrator's attempt to refuse entrance to people without a mask. That is a direct violation of state law, which mandates this meeting be open to the public with no mention of wearing a face covering in the state law. I recommend that that be addressed immediately following this meeting. And I strongly urge you, Alderman, Mr. Mayor, to never enact a policy like the one being proposed today. This proposal does not reflect the Branson that I know and love. This proposal does not reflect a desire to protect the health and well-being of our citizens or visitors. And this proposal does not reflect the Branson that I and thousands of residents and visitors will choose not to patronize if this ordinance passes. Thank you.
I'm sorry, would you mind go ahead and wiping off just a precaution? We don't know whether we carry it or not.
Pearl, you're my hero. I want to be like you when I grow up. What a great talk you gave. Thank you so much. My name is Mike Cooper. I live at 350 Mark Twain Drive in Branson West. I own Perfect Signs here in Hollister, making my living off of the businesses here in Branson. I teach economics and business at OTC. Before that, I taught economics and business at Crowder College. I'm going to talk a little bit about unintended consequences, a little bit about economic consequences. There's a lot of medical professionals who will line up all day long and tell you about how masks save lives and how it's going to really benefit the public safety if we all have to wear masks. There's not a lot of economists out here telling you about how these measures destroy businesses, they steal livelihoods, they kill people. They kill people, these measures. By taking livelihoods and shutting businesses down, people die. It's real. For the last 50 years, economists have been doing studies about how economic recessions and downturns cost health and cost lives. One of the most important studies said that 54,000 people die in our country every year with a 1% increase in unemployment. 1% increase in unemployment causes heart attacks, It causes suicides. It causes homicides. It causes depression. Death by despair is a real thing. In May, I know you men are good men. You have good hearts and you mean to do the right thing for your constituents, for your city. I know that's true. But sometimes there's unintended consequences. In May, when you shut the city down, that was a real body blow to the businesses of this town. And it hurt bad. I was working on a bucket truck the day after that, installing a billboard for Encore Theater. And a police car drove up and said I couldn't do that because my business is non-essential. My business was shut down during that time. It would have been shut down anyway because all my customers were shut down. But there's huge unintended consequences for measures like this. There's health impacts, but there's economic impacts that really cause tremendous damage and hardship. The number of personal and business bankruptcies have already begun to skyrocket. The number of businesses that are shut down and that are moving out of town and will never reopen, you've all heard these numbers. They've already happened. And when you layer on additional draconian measures like this, you just cause more businesses to go bankrupt. Visitors don't come here if they have to wear a mask. They come here to be free, to have a good time, to enjoy the shows. I have a friend who runs a hotel here in town, and he says every time someone comes in, they ask if they have to wear a mask. If he says yes, they turn around and walk out. They won't come here. They won't come here, and you're going to have so many theaters, so many shows, so many more restaurants and hotels that have already been hemorrhaging and dying. You're going to have them shut down, leave town, go bankrupt, go out of business. As sure as I'm standing here, this measure is going to cause people to die. Yes. It's going to cause people to die from financial ruin, from loss of livelihood. You can't trade a theory, a belief, a hope that this is going to save lives for a guarantee of a loss of a lot of livelihoods, which will also cost lives. I'm imploring you not to make that decision, to add salt to the wound, to give another crushing blow to the businesses that are already suffering so badly here in Branson. Thank you for your time.
Go ahead. You need to take a break, Larry?
That'd be great. Oh, is the mayor gone?
Yeah, he took a break.
Bob did.
Bob, real quick question. They're talking about taking a little bit of a break where everybody could use the restroom.
Oops.
That's possible.
Everybody in agreement with that?
Yes.
Okay. And then we'll take a 5-minute break if you don't mind. I appreciate it.
Deal.
Thank you.
Order in
Break
court.
time's over. Thank you all for putting up with the fact that we have to stop once in a while.
Yeah, okay.
Yes, ma'am.
I already cleaned it.
Great.
Jody Woobser, I live here in Branson as of a year and a half ago when we were in Florida and a Category 5 hurricane blew our house away. And so we chose, of all the places that we could possibly live, we chose Branson. And I'm going to tell you right now, I have listened to a lot of the speakers and the facts, and Pearl, this precious one here, I believe every word they say. And in fact, a lot of the things I was going to say, they've already said, so I'm not going to waste your time. But I just want to say this. The fact that well, can I start with Jamie, when Mr. Whitus, you started the meeting with a prayer, and you mentioned that our laws are based a lot on the Bible, right? Well, the Bible gives us...
That was it.
Oh, thank you, Mayor.
Y'all look alike.
Thank you. And the fact that our laws are based on the Bible, a lot of wonderful other information is based on the Bible, and some of that information is how to deal with a pandemic. And one of those things that the Lord shows us in the Word is that we quarantine the sick. Okay, we don't quarantine the healthy people. We don't lock them behind doors, and we don't walk around with masks on our faces. Okay. With a lot of respect, it goes to the doctors and nurses that are dealing with it. But those are the sick people in the hospital. That's why they're there. And that's, thank God we have the system that we do. Just coming in the door here tonight, people left. They said, I have to wear a mask, I'm not coming in. They were coming in to, say the same thing I'm saying, that masks are, well, unnecessary. The facts, the statistics, everything is showing that to be the case. But I want to go back to my first point. We chose Branson, okay, because what I heard about this place was this is a town that honors God, it honors family, it honors the veterans, it honors our government, our country, everything that this wonderful country stands for. And I saw that. My husband and I, we see it every day in the people who live and work here. And we see it even in the people that come as with the tourism. It doesn't even bother me to get in a long line on 76. I'm actually given a prayer of thanks for them because they're here and they're boosting our economy. And they feel the same way about this city that I feel, and everybody in here feels. And I just want to say this, because I wasn't going to talk long. I really feel that I don't think that any of you gentlemen up there are political. I think you're doing what you're doing is because you love this city too. And I just admonish you to please. Okay, be leaders. Don't follow the status quo. And just because Springfield is doing something and just because another city is doing something, people will come here because if you take a stand to be different, to be men, and to say, I am not going to follow those ridiculous laws and mandates, if you are, who I believe you are, men of conviction, I believe you're going to do the right thing. I believe it. It would grieve my heart to see this city follow the way of every other city. But if you refuse to bow to this thing, I believe that people are going to flood this place because they want to come to a place that's not in bondage with all the laws and the regulations and things, messing with people's freedoms. People are nice here. We do our social distancing. Nobody wants to get sick. And any decent person doesn't want to make somebody else sick. We're decent people. We're God-fearing people. you know? So please keep that in mind. The social distancing, we sanitize our hands, we try to, you know, think of the other person before ourselves. I think that's sufficient. I think all the facts that everybody has mentioned tonight has proven that. Anyway, thank you.
Okay. Thank you.
Oh my gosh, does that feel good? You know, I'm old, so I can say things. And as an older woman, when you get home later in the evening, it's like it feels so good to take your bra off. And you guys don't know about that. But it feels a lot better to get this mask off than it does to take my bra off late in the evening. Like I said, I'm old, so I can say some of those things.
Thank you for the levity in that.
I just want to say for Jody, you know, I agree with her. I appreciate that you're listening to all of this. It's been a long day for all of us, and there's been so many excellent speakers here, some that have got off course, but excellent speakers, and I agree with them. They do a much better job than me speaking. But my name is Joy Davis. I've lived here in Branson for 44 years. I've had a business for 44 years with my husband. And I do care about people. I do care about loss. I lost my husband a year ago, and I still grieve for my husband. And so I don't want to see lives lost. I know what it means to have a hole in your life of someone that you've lived with so long. And I care about our nation. I care about living here. And I felt like I should at least come up and share with you that those people that do come in, that talk to us at the restaurant, they so feel like everything's been blown out of, way out of where it shouldn't even. I've always called it a crock. And the CDC, people tell me all the time, they don't believe those numbers. There's been too many times they say this and they say this, and you know, I don't have all those facts. I didn't have time. I have a business. I didn't have time to put all that together. But wish I had been, as I've been listening and learning as I'm going along. But they don't trust those numbers anymore. And as individuals, I believe we need to be responsible for ourselves. I'm 71 years old, so I'm getting pretty close to that mark, you know, higher risk. But I've done a lot to build up my immune system and to take vitamins and minerals, and I'm taking the zinc. And the first thing I would ask from is not that whatever they suggested starts with the R to take. I would want the hydroxychloroquine if I got sick. I would ask for that because I've heard those individuals stand up and speak and say, in 5 hours, they felt, you know, they journaled it. 5 hours, they felt so much better. And then another 12 hours and 24 hours and 48 hours, they felt like they had their life. I mean, they were feeling normal again. So I don't even know why the medical profession didn't mention hydroxychloroquine, because there are many, many doctors across the nation. They're having great success with that. And so it's good to know if you did get sick, there is something that has worked for many, many people, and patients that, as the pastor said, that have not been lost because of that. But, you know, and just thinking about this, I thought about the numbers, and, you know, what do the numbers say in Missouri? And so I looked up the Missouri Department of Health and Senior Services, and I've got this. If I give it to each one of you, if you'd like to look at it, I made enough copies. And it said that the total deaths first, the cases for total cases are 29,714. And the total deaths are 1,102. So if those are our cases, and we know those cases are up higher because we're doing so much more testing than we did when we first got into this. We weren't doing any testing when we first got into it. So the testing's up. We expect the numbers to be up. And But with those numbers, 29,714 for total cases that have it, not necessarily are sick or anything, or hospitalized, but they have just tested positive. And again, you know, we always wonder about the numbers. But the deaths, 1,102, that means I have a 0.037% chance of deaths from COVID. That's a 0.037 chance of deaths from COVID. I have a lot greater chance of dying from pneumonia. The deaths for this season and this was Missouri's numbers, for pneumonia influenza was 1,967 deaths from that, and that was Missouri's numbers for our state. And this was for the 15th, up to the 15th, so it's recent. So I can give you a copy of that. And then if we look at the deaths here, if you look at the chart, this is Missouri's charts. They're showing that here we are in deaths. And again, every death is important. I mean, I understand that. But look where we're at. They've spiked along here, but we are going down. It's not showing that we have this big crisis here going. Even though, you know, so what? Walmart and those big corporations are making this decision, and other places are making this decision. You know, the one thing I told my kids when they were growing up, it's like, well, just because, you know, they'd always say, well, everybody else is doing it. Well, I always said, well, if you go off the cliff and everybody else is jumping off a cliff, you're going to jump off a cliff just because everybody else is doing it. So, I mean, and others have made that point much better and clearer than I have. But again, I just appreciate the many fine speakers, and I agree with them. And my granddaughter, one of my granddaughters, because I have 12 grandchildren and 5 great-grandchildren. But my grandmother sent me this at the my granddaughter sent me this at the beginning of this COVID deal, which has been much tougher for me without my husband trying to make these decisions. And I've tried not to stress and trust the Lord, but it's still been tough. It says, if we give up liberty for security, we have neither. And that's a quote by Benjamin Franklin. And I so agree with that we may be doing that innocently, but even doing it innocently, we're still giving up liberty for security. No government can promise, you know, all these securities or even life. They can't even find a cure for cancer, which my husband died of, and a couple other friends just this year. And how many years has the war been going on in that? We can't find a cure for that. So I thank you and for your time, and I'll make time for others.
Excuse me. Excuse me, Joy. Excuse me, Joy.
Yes?
Those copies you have, would you give those to our city clerk so she can hand them out?
Yes, how many do you need? I have 8 or 9. I got more. I got lots, but.
We just need 6.
Okay.
Or 7.
I know who he is without this mask.
Sometimes you don't recognize people until they take their mask off, right?
Would you mind putting it back on?
My name is Chris Meyer, 269 State Highway 248. You know, the last time I talked to you guys, you did the right thing. And I hope you do that again. And we were in an interesting time then, and I love to see the passion of people. And obviously, this is a passionate topic. And I'm guessing when some of you signed up to be on the Aldermen board, you didn't realize you're going to sit through hours of testimony about medical stuff. And I am happy to tell you I'm not a medical person. I'm not going to talk much about medical things. But I think what we have to do is we have to change the narrative. And let me give you some just examples of that. In the document that came out on the 9th whereas, it says Taney County has seen an 846% increase. That is fear-mongering. okay? If you look at what is happening, and I went and looked at other tourist destinations, and I did it quickly so someone can check my facts, and if I'm wrong, I'm wrong. But in Orlando County, there was over almost 20,000 cases. In Vegas County, there's over 30,000 cases. In Myrtle Beach, there's over 6,000 cases. The county that's actually the closest to us is Sevier County, which is where Pigeon Forge and Gatlinburg and Sevierville are, and they're at 978 cases. Okay, so we're at 146 cases that have been identified. That is one of the best in the country for major tourism destinations, and we're out here spinning it like we're a fear-mongering place. And so I think we've got to look at it in a different light. And so when you're going to put this whereas in here and talk about increases, I think you also have to then also put in here and say, well, 99.82% of the Taney County residents don't have it based on a population of 55,000 people when you look at the official Taney County numbers. And so when you talk about cases, you also have to talk about recovery. And so if you look at this, there's only like 94 cases in the county that are in active status unless they haven't updated their records yet. So I think it's disheartening when I see stuff like this coming out of the city that is scaring people, and we have felt that at our businesses when people call. In some cases now they're not calling. And so we've got to change the narrative that this is a very safe place. Now, when I was here last time, I think I estimated, and I might be wrong on this, but I estimated, I thought it was over the next 3 months, it was going to cost us about $80 million in revenue. When you look at the tourism tax on hotels, attractions, restaurants, and theaters, for March, April, and May, it cost us $74 million compared to last year. That's a lot. Okay, so it's going to cost us even more because June's not going to go back to 100%. I mean, the rest of the, and you guys know this because you're going to have to deal with the tax consequences of that. But when someone says we're not going to be down, we're already down 72 to 80% in these businesses. The TCED tax down over 50-some% as well. So the tax revenues are down. Now, as a business, I mean, my business is, those folks are wearing masks. And so I think the difference here is we need to be welcoming as possible. Okay, now part of that welcoming is me as a business saying, what am I going to do to be responsible to my customer and how am I going to take care of them? Okay, most businesses, if I go into a business and they're not doing anything, I might just leave. Okay, so it's up to that individual business, and so we don't need more government control. We need more encouragement. And so I think you guys be the cheerleader, but let's not mandate it and control it. And it comes back to personal responsibility. Now, I've had some people that have said, well, there's a bunch of stupid people out there, and that's why we need this ordinance. Do we think if someone passes this ordinance, those people are all of a sudden going to get smart? I mean, do they live in a cave that they don't know coronavirus is going on and that masks are cool or whatever? Like, those people are still going to be stupid when you pass this ordinance. And that's like one of the main reasons I've heard people say we need to pass this. Well, they're still going to be dumb. If they're not going to all of a sudden just start wearing a mask because you told them to. I don't think. I mean, I don't know. If you guys think that, you have more power than I think you have. Now, I'm going to talk to now, if you guys are going to decide to pass this, I'm going to give you some suggestions. Now, that's not saying I'm in favor of it, but this bill can be better, okay? The thing, and you know, the other thing, if you're going to talk about face coverings, no one's talked about eye coverings tonight, okay? So if you're going to truly do this, you can get coronavirus through your eyes. No one talks about that anymore. So you need to have eye coverings. Am I in favor of that? Probably not. But I'm just saying, if you're going to be consistent, okay, well, so if I don't know I have coronavirus and I kiss my wife, is she going to get it? Maybe. Should we outlaw kissing? I don't know. The other thing on here, face coverings, it talks about ties, loops, or elastic. I saw someone out here with a neck gaiter. And I don't think those have ties, loops, or elastic. Is it? Right there, yeah. So that should be allowed. So if you're going to pass that, make neck gaiters part of the deal. I personally don't want our police to have to go and give a tourist a $100 ticket. I really don't. I want my policemen to work on people that are selling drugs, beating their wives, child pornography. We have got much more bigger issues to deal with in our community with drugs and other stuff than for them to have, because they only have a limited amount of time. And so are we going to pull people off those types of criminal cases to go fight the mask people? So we're just going to make more people more criminals. I mean, that's what's going to happen. So once again, I'm going to come back and let's just take this from a positive standpoint of PR and encourage the guests to wear masks and encourage our citizens to wear masks. Now, if you look at section 58387 and number 2, where it talks about any person with a health condition documented by a medical professional that prohibits wearing a face covering. The way I read that person has to go get documented, which means there's a medical expense to that person. Now, I might be reading this wrong, but the only way I can get a document from a medical professional is I have to go there and I have to pay them. So once again, you guys are going to require undue burden on certain people. So take that into account. There's additional labor costs that come into if all of a sudden people have to police this in their business. And right now, most businesses are short-staffed. People either don't want to work because they're getting great unemployment benefits, or we don't have the J1s here or whatever. People don't have time to police this. Here's the other thing I did today, is the signage required for the business operation. So first of all, I personally find this extremely tacky. When every door they go into in our town, they're going to see this white big sign with red letters. Now, when I called the city, I talked to an administrative official. He's like, well, you can make it all this different styles or whatever. Well, it's pretty clear in here. So I took, and it says it has to be 1/2 inch high on white background. I took the 1/2 inch high and I put his exact wordings on here. I couldn't get it on an 8.5 by 11. So I guess no one really tested this to see if that was actually accurate. And so I'm gonna pass this to you. Jamie, I'll give it to you.
No, we need to give it to the clerk.
Oh.
You need to get the
Okay, well, I'll take it over there later. So if you're going to pass this, you have to change this signage portion. First of all, for every business, do we want our town to look tacky? Like design matters, and we need to think about design and what we do. Okay, and so first of all, I don't think everybody would be able to do this by the 20th, because tomorrow's Friday. The sign guys probably go home on the weekend, although they would love this, I'm sure, because they'll make a lot of money. But that's not the point. We've got to think smart, because every time someone sees this, it says they're really not welcome. Bob, I think your point was good, but I'm like, we need to put welcome to Branson. We encourage you to wear a mask, period, be done. And make it small. If you're going to do this type of thing, this is just crazy. Can you tell I'm passionate about that? I just don't get it. The last item on section 4, and some of you alluded to this, I think you give two people a lot of power to make the decision on going. And I just think you guys are elected by the people of Branson, and I don't hear anybody saying you guys shouldn't have that power as elected board, because we're talking to you as our elected people, not these two people. And I love Ted, and I love the staff, so that's not the issue. It's just the philosophy of that. But I think you got to ask, what is the magic number? When I get to 80, is it okay not to wear a mask? Or is it 75, or is it 50? Or what is that magic number? I don't know that I've heard anybody say, here's the magic number on what the masks are. If these other tourism destinations have 20,000 cases and Disney's opening more theme parks, there's a lot of cases there. You know, at the end of the day, this is all about risk. And you and I determine every day we walk out our door what our risk level is going to be. That is your choice. Okay? I've talked to people that they're like, you know what, I'm highly risk. I got high risk, I'm staying home. Great. But I, as an individual, am determining what risk I want to take. If I get in my car, I'm taking a risk. Someone might be drunk. They might hit me. I might die, but I'm still taking that risk as I go out and take that car ride. And I would much rather have freedom than safety and security. And it's real easy to give up freedom, you know, for a little more safety, a little more security. But when we give up a little here, a little there, a little more, a little more, a little more, then it's a whole bunch. But it's always just a little at a time. But it does come back to personal responsibility. I think if you guys have faith in your community, you got to trust them. You know, if you don't trust us, then vote for it. But if you trust us, then let us determine it. There's no sense of operating out of fear, because this is a community of faith. And so I would much rather operate out of faith than fear. So thank you very much.
For doing it.
I'm so glad you did that, so I didn't touch that nasty stuff. Hi. Oh, it feels good to get that mask off. My name is Lyndall Gore. I live in Hollister, Missouri. I live in Hollister, Missouri, 301 Sunset Drive. Is that better? Okay, so let's do it this way. All right. First of all, I want to say something that's really, really important. I see a nation that I love being ripped to pieces. You can pick any topic you want, tying your shoelaces in a square knot or a half knot, and people are going to kill people over that in this country. And it really tears my heart to pieces. And we all ought to be ashamed of ourselves for letting that happen. And so that imposes a lot of fear on me. Now, I've been so happy. I've been in this Branson area for about 10 years. My wife and I came in here on vacation 10 years ago, and we never left. I love it. I feel safe here. I was in the military for a while, and you go to the shows, and people honor the military. And we honor our police officers, and we honor, we honor family. We honor everything that this country stands for. These divisive situations coming through our country, ripping us to pieces, people. And I see a young man over here that's pro-mask, and I hate that. But you know what? He's an American, and I love that boy right there. And I'm glad he stood up here and said what he had to say. I disagree with him, but I'm glad he did it. We in this country have on our dollar bills, "In God We Trust." And I'm going to tell you what. People, I wonder what would have happened in Nazi Germany if, when Hitler told the Jews that they had to wear that Star of David on their arm to identify that they were the reprobates of society, if the German people would have said no. I wonder if there would have been a Holocaust. Now, I'm going to tell you this. I'm glad you guys up there, the aldermen and mayor, I'm glad you do your job, and you got one heck of a job, and I do not envy you. Because you guys have got to make a decision today, and you're going to piss off a whole lot of people no matter what you vote. But if I have to wear a mask, I'm going to put a Star of David on it. And then I'm going to put a shower head on it.
and there's going to be a caption under that says, "Shut your mouth and get in the shower." I'm afraid. But my God says, don't be afraid, because I will always be with you. Car insurance, back when I was a kid and got my first car, was really cheap, and it was really easy to get my car fixed if I got in an accident. I could go down and pay for it myself. Whenever they made it mandatory to have car insurance, I couldn't afford it. And I couldn't afford to get it fixed. You make it mandatory to wear a mask, all of a sudden you're going to have to take out a loan to buy one, because people are going to make a lot of money on it. People, please learn 3 things. God loves you, love everybody else. God forgives you, forgive everybody else. Speak kind words no matter what happens. People in Branson, we need to reach out to everybody and be kind. Even those people that are rioting, we need to love them and we need to forgive them. Thank you.
Thank you.
My name is Ruth Haining. I'm from Branson. I kind of want to start out and point out that I don't know how many of these we've used today. This is Lysol. It's supposed to kill 99.9% of germs, so I don't know why we can't use the same one until it's dry, because it's supposed to kill germs. I'm speaking today on behalf of myself and others who have struggled with or currently experiencing domestic violence, domestic abuse, sex trafficking, panic disorders, anxiety disorders, CPTSD, PTSD of any kind, both combat-related and non-combat related, respectively. Anxiety and non-combat PTSD are both issues I personally struggle with on a daily basis. And because I have these issues, I am connected with several others who, like myself, deal with a daily project of trying to keep calm in a crowd, run regular or essential errands, etc., without having a panic attack, an anxiety meltdown, or other things of that nature when somebody rubs against us, cuts in front of us, or even just being in a crowd, or a number of other panic-driven triggers. And I want to interject here in my writing that in spite of 6-foot social distancing mandated, people still rub against me and everybody that's in the store. There is no such thing as 6 feet. It can't be made to happen. Non-visible triggers are different for each person, depending on where their trauma comes from. But I can tell you firsthand, anxiety or escalated anxiety already presents an elevated heart rate or labored breathing. Masks complicate that tremendously. And to make matters worse, stress levels directly impact weight, which also makes it difficult to breathe. But because of stress, losing weight is nearly impossible sometimes. To struggle with any level of these issues already is challenging, and putting a mask on our face makes it 10 times worse. I have chosen to endure it today to be a voice for those who cannot. I have a tendency, and many others do as well, to become extremely lightheaded very quickly, putting me at risk of fainting, cardiac arrest, heart attack, etc., and that even was verified by medical doctors today. These are normal, everyday circumstances and struggles for people with PTSD of any kind, CPTSD, and anxiety disorders. Branson is and always has been a town that upholds and highly respects veterans and active duty military personnel. Many of these persons struggle with PTSD and anxiety disorders. Some days life is a horror story for our veterans, and they cannot handle one more thing. For many veterans, wearing a mask is a service-related trigger representing a nightmare that many of us cannot even imagine. Forcing them to wear a mask is nothing short of inhumane. And as Mr. Seitz pointed out earlier, people are being denied access when they claim a medical disorder such as this. Speaking on behalf of domestic violence victims, many of them have at one point experienced someone forcing their hand over their mouth as a way of suppression and control to get out of them what their abuser wants. For them, wearing a mask over their face is a mental revisiting of past abuse and becomes a constant trigger that they cannot get away from. And this bill is proposing that their trauma doesn't matter because there might be a small chance that they could possibly be carrying a virus. This is a huge violation of their mental peace, their emotional well-being, and it prohibits their ability to heal. The privacy of people fighting these issues, and yes, I can attest it is a fight, is legally protected, and they cannot and should not be forced to publicly explain the demons that they face. It is important for each of us to be able to be responsible for our own health and well-being. Nobody, whether or not they are wearing a mask, knows how to properly care for my health besides me. And nobody, whether or not they're wearing a mask, knows how to properly care for your own health better than you. These are things I have studied, taken data from individuals who have these kinds of medical conditions, but these kinds of issues and conditions are widely not respected as a medical condition, and it is very difficult to get any doctor, medical doctor, to write you a note stating that you have this kind of condition. It has been proven by many sources, and the doctor attested to this earlier today, that wearing a mask does not protect me, the wearer. It protects you from me. So it only affects how far the spray projects, but does not protect the wearer from being affected. So even though I'm wearing a mask for your sake, I can still catch whatever virus is coming my way. And if we are supposed to wear a mask on behalf of someone else, but we are not allowed to properly and accurately care for our own mental health and physical health first, we are in fact putting more people at risk. The ordinance you are considering puts Branson at a greater risk, the exact opposite of its intent, and I urge you to vote against it.
Gentlemen, we're back, and it's like a month, right? I have good news for you.
You need to identify yourself on your...
Great, that's not the good news. My name is Kelly Slaybaugh. I live in Hollister. I am here representing Branson residents who, because of work and because of health issues and not being able to walk here, I'm here representing them. So here's my good news. In the past 4 months,
in Taney County, 4,665 COVID tests have been run. And guess what? Of those tests, in the past 4 months, 96.87% came back negative. Isn't that great? There's the perspective change that Mr. Meyer spoke of earlier, which is ironic. My last name used to be Meyer, and I'm not related. But it's the perspective change. It's the scaremongering. Are we going to say, we're up to 146? Well, that's over 4 months. Or can we look at the actual data and look at, okay, these came back positive. They deserve care. They deserve attention. But so many of these came back negative, they deserve to live their lives as if they are not sick. We quarantine the sick. We protect those who are at risk, yes. But the majority of us here, we are not sick and we are not at risk. Or if we are, we choose to take that risk. Because like another gentleman said, I had to make a risk assessment getting in my car to drive here. I have to do that every time I get in the car. But this mask mandate is like saying, even a really good driver might kill somebody in a car accident. So no more cars. That's what this is like. It's not looking at how do we better care for people that are at risk or do get it. It's just looking at, we're going to just take away this one little area of risk. Does that stop death? No. Table Rock Lake has a ton of boating deaths. So are we going to outlaw boats? How many people have died in a bicycle accident? I've known of one in my lifetime, but they do happen. Death is an everyday occurrence, so we do what we do responsibly. I really resent, and even the city sent out this language of, I wear masks because I love others. I wear masks because I care. I love Jesus, and Jesus tells me to love others, and I do. So do you know what I do when I love others? I've been respecting their social distance. I've been standing back from them. I've been washing my hands frequently and using hand sanitizer all over the place. When I am ill, because I worked in children's ministry for most of my life, I know what it's like to be around germy people. I know how annoying it is when somebody comes in, you're going, you're sick. But I love others by not going outside when I am sick. I stay at home, I get better. I'm an adult and I have that choice. But to look at us all and say, regardless of the fact that nearly 97% are negative, you still all have to act like you're sick. You have to live like you're sick. That's a problem. I also want to talk about the fact that the doctor presented it in such a way of, we had this where we were locked down and it was only this many, and then we had this, and now since we opened, it's been this many. How many tests did Taney County Health Department start with? 2. They started with 2. They started with 0, thank you. When did we see this jump? 2 weeks ago, Taney County did a free testing event where anybody who wanted to could go get tested. Of course, you're gonna see jumps. Do you want to know why? The CDC has even mentioned in their antibody testing, in all of their different testing, anybody who has had a cold that is caused by a coronavirus, we're not saying COVID-19, a coronavirus, anybody who has had a flu shot can trigger a positive, a false positive on those things. It's in the CDC literature. So, we're going to have a jump in positives and they're false for the most part. And that's not saying that these issues aren't real. But let's look at the positive cases that are active right now. 11 are hospitalized. That means the majority are not sick enough to require ventilators. It means only 21% are hospitalized. Obviously, any hospitalization and death is tragic. Obviously. And I hate to break it to you, it's 100% guaranteed for every single one of us in this room. We will die. To say this prevents a death is foolhardy. To say that this prevents illness is very foolhardy. For the CDC director to say what he did without he backed it up with studies. Not actual data, with an anecdotal study. And he said, we can grind it into the ground in 4 to 6 weeks. That is foolhardy. So what happens then when the masks don't work? What happens then in a month? Well, according to this bill as it's written, which everyone has already expressed a lot of issue with, 2 people, 2 unelected officials, just get to decide to make it indefinite over a foolhardy claim that is not backed by scientific data and evidence. And, you know, I know that there is a lot of divided opinion on masks, and there's a lot of divided evidence, quite honestly. But for every doctor out there that says these work, you must mandate them, I can point you to another doctor that says they absolutely do not work and they are very dangerous. This isn't a 9 out of 10 dentists recommend masks. There is a wide divide, and sadly, I wish that there had been medical professionals here that had been courageous enough or willing enough to come speak, but I understand because I have friends who are, and their livelihood, their businesses are threatened if they speak out against the narrative. Their higher ups, their CEOs over their hospitals have made it clear that if they tell me anything, I have to tell you it anonymously. That should not be the case. There should not be a censorship on truth. But there is. And these people are afraid to lose their lives by speaking up for truth. So let's then look at how this will, because I'm not a medical professional. I have many friends who have sent me all this data, and that's why I'm bringing it to you, because they can't speak for it. But because I'm not a medical professional, let's talk about Branson. I grew up here, I love Branson. I moved away for 10 years, and when I had my own family, I moved back because there is no place on earth like Branson. So then to say, well, we need to become like every other place on earth. Well, I don't want that, that's why I moved here. Let's look at the economic issues. Silver Dollar City decided that they were going to mandate masks upon entry. When that happened, the overwhelming majority of people commenting on their Facebook and Instagram posts was, well, then we're not coming. Because a rational, reasonable person knows that being out in 100-degree, very humid temperatures wearing a mask is very foolhardy. So let's look at it realistically. We drove by Indian Point. We drove right past Silver Dollar City's parking lots on a Saturday in the middle of the day. Last Saturday, in the middle of July, which should be one of Silver Dollar City's busiest days. Their lots were almost completely empty. In passing, just in talking with people in the community, several different employees have told me that they are bringing in far less than 50% of their normal attendance. What's that going to do to Branson? How many people walk up and down our strip who are not going to wearing masks because it is hot? How many are not going to sit in a show and wear masks? I look at entertainers like Clay Cooper, who has done a really admirable job of exhibiting what social distancing in a show would look like. And I can guarantee you, if you count up the price of each seat that sits empty, Clay's losing money. But he's doing it because he loves Branson and he wants people to come. And he's going to do everything he can to make them feel comfortable. If this mask thing is forced, Clay will have to close his theater. If you say you care about the people of Branson, if you say that you have felt that pain of the economic thing that happened with the lockdown, did you lose your business that you worked your entire life for? Did you have to look your employees in the eyes, your employee who is a single mother who works 3 jobs, and tell her that you had to send her home because you couldn't pay her? And that you didn't know if you could open back up? I know that you gentlemen are business owners and businessmen in this town. I know that you guys care about Branson. And I know that there's been, out of passion, a lot of triggering words. Please understand, gentlemen, none of us here are calling you Hitler. None of us here are calling you Nazis. We know that you have Branson's best interest at heart. We also know that you have received a lot of pressure from the other side, very loud pressure to mandate this. And I personally know what it feels like when somebody says, then you don't love people. I know what it feels like. But I can tell you, gentlemen, that the reason we're making all these Nazi Germany comparisons, it's because it's happened before. And it started with something innocuous, because did you know that Hitler didn't propose the Golden Star? It was a Jew. He said, you should be proud to wear it. It marks your heritage. It shows that you are good for the community. It also showed who wasn't compliant, because they were the ones that wouldn't wear it, and they were the ones that were punished the quickest. And then those that were compliant, they were the ones that were then targeted. We're not saying that you guys are doing that. We're not saying you guys have boxcars waiting outside for us. We're cautioning you that this sets a precedent that cannot be easily backtracked. So we're asking you, gentlemen, please, trust your citizens. Our livelihoods are the tourism. Are we going to sit there and go, yes, we're going to infect everyone? Of course not. Every store I've been in has been extra careful. Every restaurant I've been in has been extra careful. If anything, it showed me how wonderful Branson is because of how much they have gone over and above to make people feel comfortable. And this will kill everything that's good about Branson. And you know, we're worried about this unending thing of being rolled over again and again. I hate to break it to you, gentlemen, but in 3 months, if this is enacted, you may not have a town to govern. It may tank that fast. So please, trust us. We love people. We love the people that come to visit us. Please trust that we are doing everything we can to make them feel comfortable. But please also trust that we also know what's best for our health and the health of our families, and we are not going to put them at risk to make somebody feel comfortable for something that is scientifically not proven to actually work. Thank you, gentlemen.
Thank you for letting me speak. My name is Stephanie Holloway. I live at 144 Bull Run Road, Branson, Missouri. I am a teacher and I am a pastor. And so I hope that you will take the time to listen to what I have to say. And I appreciate you guys so much, because I know from the corrections you've already made in your proposed mandate that you are listening. But right now, I just want to pray again for you that your eyes will be fully opened and your ears will be fully open to what the people of your community are saying, but most importantly to what God is trying to tell you. what these people have said is true. We are headed into a socialist society if we keep making mandates on people like this. And it's heartbreaking. It's heartbreaking for my 6 kids that didn't want to grow up in a land like this. I wore this, and a lot of you probably just first glanced at me and thought, oh, it's a mockery. Well, I have a lot of reasons for wearing this. One, this person right here has pointed out that it might catch snot, but the air's still gonna get through it, right? Because you can breathe through your masks. Can you all breathe? Furthermore, I have skin allergies, asthma, and ocular migraines. 3 great reasons not to be forced to wear a mask. The people out here wearing the surgical masks, you're probably more at risk than I am today, and I hate to tell you that. But they're supposed to be thrown away every 20, 30 minutes, and they're supposed to be used in sterile environments. And furthermore, I have eye covering a little bit, so I kind of have the good mask on, but I'm going to take it off. I'm not anti-mask, and I'm not pro-mask. I'm anti-mandatory mask. I said I teach and I preach. I preach in the Branson area, and I teach in a district outside of here. I took the job today, standing in line, knowing that I'm going to have to wear a mask and I'm going to be mandated to wear a mask to teach, because our kids are going to need some teachers if they even go back to school this fall. And I care about them that much that I'm going to put my life and health at risk to teach those kids, to teach the next generation. But at the same time, I would really like for this to be a community that I can come home to and have freedom and have liberty. Because we have such a great community that is founded on such godly principles, they're gonna make the right choices. They're gonna make the good decisions. They're gonna be cautious and careful. They're not gonna try to harm people. They're gonna stay home when they're sick. And I don't trust the CDC or the WHO, and I don't trust the numbers that the experts sent out there. And I took a few notes because I do have a math degree. You know that 900 and some % jump? Like one of these young ladies that just spoke were saying, there's very little tests at first. And then boom, all this testing. So yeah, the COVID cases are gonna rise. It's gonna rise. That's not how you figure up percentages like that. Statistics don't work that way. Okay, and the whole, let me get to where another reason besides health reasons why I could wear something like this. Because the church is at stake. We know what they're doing in California. We don't want that in Branson, Missouri, not in the Bible Belt. And furthermore, you based your arguments off of science, you said, the expert that came up here. Yet where was the control group for the great clips? Everyone's touting that. Great clips, oh, 2 mask wearers. Same building, same customers. No one got sick. Okay, where's the control group? Do you guys know science? Like I learned it in grade school, because it doesn't work that way. You've got to have a control group. You can't compare that to another town where they are not masked in a choir group and different people. It doesn't work that way. That's not science. That's a scare tactic. And what I pray that tonight that you guys learn or do, or maybe you already are there, I hope you are, is that you don't base your decision off of emotions. We're supposed to walk by the Spirit. You want to do this biblically? Walk by the Spirit, not by fear. Okay, and I know that there are 4 things that everyone's, they're saying all across the globe, all across the nation anyway, all these mandates are coming down. There's 4 reasons: fear, greed, shame, and guilt. All right there. And I know some of you have loved ones that are immune compromised, like I am, like some of us in this room are. But let me put your hearts to rest just a little bit. My daughter was posed with this. And she's 26 years old, and I raised her right. Wear a mask. What would Jesus do? She said, well, you know what? I guess he'd curse it and rebuke it and say, shrivel up and die, and walk on. And he would, just like the fig tree. He didn't have fear. We shouldn't have fear, not if we have Jesus in us, which I hope most of you do. But let's talk some numbers again. Can I have a show of hands, no voices please? How many of you are for the mandate passing? There's some statistics. How many of you, please, are against this mandate passing? And so you want to quote things from, the experts want to quote things from the CDC and the WHO, but they're ran by fear and greed, and they have agendas. Whereas my personal doctor that delivered 4 of my babies through C-section, and probably 90% of the babies in this county, retired now, unfortunately, he told me, if you get it, because during the lockdown I thought I might have had it. He said, treat it like the flu. My 2 girls not vaccinated survived the swine flu. He was their doctor. We can compare it to the swine flu somewhat, can't we? And he said, treat it like the flu. Gargle warm salt water 6 times, 3 times a day straight. I did. It helped. My throat started to get better. He said, if your throat gets better, your cough gets better, go down to 3 or 4 times a day until you're all better. Just drink plenty of fluids, stay away from others. That's what I did. I don't know if I had it or not. I had some of the symptoms. You guys weren't testing for fevers then when I first got some symptoms. I'm just saying, you don't have to base it off of fear. When Jesus said, turn the other cheek, he wasn't saying, okay, you slapped us on the cheek, you made us go into quarantine, lockdown, now you can mandate masks. That's not what turn the other cheek means historical context-wise. It means, okay, you already slapped me on the cheek with the lockdown and the quarantines, and you shouldn't have. So go ahead and take my life if you want. That's basically what he meant by it. And I mentioned that to you guys and the audience because there's too much shaming against Christians right now who are against mandated mask wearing. And I know some of you are Christians, if not all of you. And I don't want you to base it out of guilt or shame. Jesus wouldn't do that to you. And I don't do it to you. And if you're a true Christian, you can be pro-mask, you can be anti-mask. No one should shame anyone. Thanks for listening.
Little mask drunk, sorry. You all look about as mask drunk as I am.
Your name and your residence, sir.
My name is Wayne Alexander McCauley. My primary residence is in 200 Box Elder Lane in Forsyth. However, I live most of my time in Branson at 116 Gretna. So a lot of what I was going to talk about today has already been discussed. However, there are a few details that are personal experiences that I do want to discuss about working with a mask. I used to work as a digital cartographer, and we would say, don't go by the guidelines, go by the physical evidence. So physical evidence is what I'm about to give you. Anyway, so I was working for premium retail services for 5 years. Amazing job for a supplemental income. But then COVID-19 came around. Corporate America started to mandate masks for their employees. We've got Target, Best Buy, etc. We used to cover all of those. loved it because it gave me the opportunity to use my technical expertise to make things that amaze people. However, a few weeks ago, I was working a return at Target. The return took 3 hours. It would have taken me probably an hour and a half if I hadn't been wearing the mask. If I had been required to climb a ladder toward the end of that 3 hours, I would have fallen on my head and split my skull open. I was that close to passing out. And I don't believe in going against, I will comply when someone asks me to do something. The people that work for these places, they have told me as a third party that they have the same issues. They're about to pass out by the end of their workday. Work takes longer. Anyway, it's literally costing corporate America a lot more to have people working with masks that hold back or that cut down the production in there, but you can't do anything about corporate America. What we need to do is we need to make sure that people have the option to wear or not wear, because it becomes dangerous when I'm forced. I understand choices. I understand accountability, etc. I understand that the virus is very serious because I went through it. I quarantined myself for about 6 days, piled blankets on top of me, raising my temperature to make sure that the virus was completely destroyed. And on top of it, I was drinking a solution of Himalayan pink salt, which has iodine in it, and citric acid, and I recovered. There are ways to get over the virus, and if we are smart, instead of making decisions according to emotion, we will pull through this. We will defeat the virus. Thank you very much.
You go right down here, thank you. We'll see how good you are at that.
I figure I might be able to handle it. How's it going, guys? Mayor, Aldermen, thank you. I'm not here to talk about statistics. You've heard a lot of them. Oh, I'm sorry. My name's Dirk Myers. I live at 118 West Hensley. I own Dirk D. Myers Photography. I also own service with the Style Consulting. The lockdown, the quarantine, whatever we want to call it, hit us pretty hard. It hit businesses really hard, but I don't have to tell you that because you guys, most of you own them in one form or fashion or something. I'm here to speak for some people that are really glad that we're open and have tried really hard to make sure that we stay that way. I think of Stacy specifically, who manages the gym that I go to. She's done a really good job making sure everything stays clean. She works really hard to make sure that that happens. I think of Gabe and I think of Jolene too. I work also at wait tables part-time, manage restaurants on the landing, we still wear masks. We take care of our people. We work really hard to make sure that customer service happens, but at the same time, we make sure that everything's clean. They're really concerned about the fact that if you guys put this mandate in place, their 15-year-old hostess or 16-year-old hostess, however old, 16, 17, well, you're going to have to replace that person with someone that's going to be able to watch the door, because you're not going to put that person in a situation where they have to mandate people coming through the door. They're just not generally geared to handle that. Getting them away from the PlayStation's hard enough besides doing that. So we're going to have to, the managers are going to have to walk away from what they're doing, part of their day-to-day stuff, and they're going to have to do more stuff when corporate only gives them so many hours to manage what they've got already. They're working really hard to keep things clean. Places I go, I think of Matthew, and I think of Destiny, and I think of all of the other people that own other restaurants and bars in this area. Yes, I eat food too, it's not just beer. But the fact of the matter is, they're working really hard to put that in place. They're all customer service oriented. They're professionals at what they do. I've been a service professional for well over 25 years. In addition to being in ministry, I'm also, again, a photographer and do other stuff. Taking care of people when I'm doing a photo shoot. A whole lot of seniors are finally getting excited again about getting their picture taken and some of that other stuff. But this whole mask mandate thing, I'm pretty sure we're going to have cancellations in that process. And it's just, all I'm trying to say is the really good news is you have a bunch of professionals, a whole lot of people that are really freaking good at what they do. Trust us. Let us do our job honestly. We don't need your help. We're really good at what we do. Let us do our job. Let us manage our restaurants. Let us keep people safe. And you guys just keep us free. That's all we need. We trusted you when we voted, when we voted for you. It's up to you to trust us now. It's really easy for you because Walmart and Walgreens and all of these other companies have got mask mandates. You guys don't have to worry about it anymore because everybody else is doing the job for you. Just vote no. That's all you've got to do because we're already doing it. You don't, the only reason to put putting a mandate in place for a bunch of people that are going to be walking on the Branson landing at 105 with a cloth petri dish on their face. They know when they need to take it down for a few minutes and when they need to put it back up. Shoot, I walk a lot. When I'm walking home from work, if I see somebody that's sick or elderly or somebody that looks like there might be an issue, I'm courteous. I give them their distance. Let us do our job. We're hospitality professionals. Branson is known for its hospitality because we're good at what we do. Let us do our job. We've got this. Thank you.
Good evening, gentlemen. I don't want to beat a dead horse too much. My name is Kevin Van Story. I do not live in Branson, but my oldest daughter does. And she is here because she, tomorrow, graduates a drug program in this town. She has 14 months clean. After 14 years of being lost in heroin, methamphetamine, and Oxycontin addiction. I'm completely off a script because I had a big old dissertation and I was going to hammer you guys pretty hard. But, okay, my name's Kevin Van Story and I am actually a candidate for Congress also for the 7th District. I am running against Billy Long for the Republican primary. So I'm way outside my wheelhouse. I've had 2 jobs in 36 years. I've lived in Neosho since September of 1984. I've sold motorcycles and I've sold real estate. I'm a real estate agent and real estate broker. 7 years as a real estate broker, and I'm really good at my job. You guys are built on commercial activity. Branson is about the same size as Neosho. We play you guys in football. You've beat us, we've beat you. Hey, it's an awesome deal. But you guys make a lot more money over here than we do over in Neosho. Okay? You got a lot nicer facility here. So, let's get down to tax, or brass tacks, what we're really here to talk about. We're here to talk about this face diaper, because that's what it is. It's a diaper. It catches the waste, and very shortly, it becomes very toxic, and making us wear it. I've been here 5.5 hours. These things are good for about 30 minutes. You guys have been wearing yours too. You know, I'm gonna tell you guys, these things will have more of a negative effect than a positive effect. And I have been at the Joplin City Council twice dealing with this issue. I've been at the Springfield City Council dealing with this issue. I've been at Neosho City Council dealing with this issue. I've been at the Nixa City Council dealing with this issue. And you gentlemen, I don't want to say that you're old, but you're a little older than the Nixa City Council. And I believe this is a little more of a conservative area than the Springfield City Council. And you have a tremendous opportunity. A tremendous opportunity. Neosho, when I got to address the Neosho Council, I know all those people. I've lived in Neosho since 1984. I know every one of them. I was the first one to ask them to actually go 180 degrees of what they were thinking. And then there were several people come behind me and hammered it home. And because of the passion of the people there, and the passion and the steadfastness of the people here that are still wanting to speak, they're lined up here just waiting to talk to you guys, to get your attention. Just like the gentleman before me. We're all adults. We don't need a daddy state to tell us we need to wear these. I got ordained in the ministry in 2018. And 2 weeks later, the Lord woke me up in the middle of the night and said, you need to run for Billy Long's office. We're all operating outside of our comfort zone. The opportunity you have with Springfield shutting down, and I can already tell you, Nixa is going to be voting next Monday. They're going to shut down too. They're going to put the mask on everybody. You're going to have a tremendous opportunity for business and growth. And I mean, guys, I'm telling you, if you put the mask on, if you make the mask a mandate, you might as well just shut this town down, because I've seen this town in December. I've seen this town in January. I mean, you put the mask on, just close it down. You're doing the same thing. I don't want to beat on you too much.
Well,
the one weekend.
We've been taking 5 hours of butt whipping. We can take a little more.
Okay, well, the first weekend, last weekend, that Neosho got to operate with no restrictions. Neosho Council decided whatever the governor says, we'll do. Okay, put it back on the governor. And Governor Parsons has already said he will not mandate a statewide mask mandate. So, and if it come down from the governor, I'm not going to be happy about it one bit, because, it's a personal liberty issue with me. God give us this wonderful set of a sinus and lungs and things we can breathe. He wants to see our face. He wants to see our face as we worship him. And you're covering it up. And when you cover it up, you can't see anything. You can't hear. The first weekend, our Neosho Walmart store had over 1,000 more customers than normal last Saturday. Then Lowe's in our little town had over 700 more customers. Now, Walmart is doing a corporate shutdown or a corporate mask requirement. They're going to deal with that. They're going to have some economic repercussions from that. Any of these stores that are doing that, Hey, people will find another way. They will find another way. There's another, that's what commerce allows. Shop local, yes, absolutely shop local. So we can't sanitize the universe. Microbes are absolutely everywhere. The battle for winning the COVID war is within our own immune system. God gave us the ability to always fight viruses and bacteria since the beginning of time. Absolutely take care of the vulnerable, but recognize that you can't run away from COVID. Those in the healthcare industry call it herd immunity. I don't believe my fellow citizens are animals. I call it crowd immunity. We're about there. If you do some math right quick, the only thing I was really any good at in my life was math. If you do some math real quick, there are about 58,000 people in Taney County and 144 or 146 total cases. Means that there's 2 in 1,000. And out of those 144 cases, I'm going to tell you right now that probably 60% of them are asymptomatic. The World Health Organization, Friday before last, came out with a video and said asymptomatic people do not transmit the virus. They completely walked back everything that they had been saying up to that time. So if you, and I also want to throw this out, I didn't get this part first. Every council meeting, the medical professionals have all done the same song and dance. And it's always been so emotional and so, it's that they really pull on the emotional strings. And that's part of Saul Alinsky's tactics. I don't know if you know what Saul Alinsky is, but we're following that direction. We need to stop. We need to turn around and go back the other way because we have 2 documents that we can rely on. We can rely on the Holy Bible and we can rely on our Constitution, the greatest documents ever written. Guys, I'm not here to do political grandstanding because I promise you, I got a lot of other things I could do. But I'm telling you, I'm asking you, I'm begging, I'm pleading you. Vote no on this and actually go the other direction. Open this town up. Give your citizens a chance. Give your tax base a chance. There might not be another CARES Act. There might not be another umbrella for some money. And this whole situation is about the money. Because health department officials, for every positive case, somehow, some way, there's some money coming down. I think it's $9,000 or $10,000 for every positive case of COVID. For every death, there's $39,000. Where's that money come from? Who's it going to? I don't know. But it's about the money, and it's about an agenda. When you're talking 2 out of 1,000 that get sick, 2 out of 1,000. Don't blow your city up. Don't blow your economy up. Don't blow all these good people up. With that being said, I'm going to get off here. Guys, God bless. Thank care. I know you don't like
down, please. As you get ready to go, would you mind?
Yes, sir. I'll take care. I was going to say, don't do anything rash or unreasonable, and this ought to be good for a couple more. So, thank you, guys. Thank you.
Okay, everybody hear me? All right, I've never spoke, so this may be a little rough.
Just identify yourself and your address.
Bo Yeager. I live on South Drive in Branson, Missouri. I'm here today because I believe that it should be a choice as far as wearing masks and stuff. And as far as wiping down and sanitizing and stuff, I mean, everybody that's been up here, everybody's noticed that if you're speaking on things, you should have wiped down this entire desk by the time somebody else should have come around. So if we're going to talk about safety and sanitizing, I mean, we've kind of failed it on this one. As far as that goes, you're talking about Clorox wipes are 99%. Well, they're not 100% effective, but as far as our case to deaths, you're looking at 1 or 2% of cases to deaths. Like if 99% effective rate on that is good and is sent everywhere, how is it not comparable? I know that's a little bit off basis. Let's see here. Okay. My biggest question I have is as far as mask concerned, I wish as far as this whole meeting went that we would have been able to ask the people presenting the arguments initially, ask our questions, but we weren't able to, and then they left as soon as they were done. I would have liked to have asked them some certain questions on why they believe they are, because they're supposedly the doctors in this area fighting for their cause. He one of the first ones that said that masks are 100% effective. Well, if they're 100% effective, go in a little detail. Are they effective if one person's wearing it? Do both people have to wear it? And for the argument that both people have to be wearing it, that tells me that one side of the mask doesn't work. So for looking at this mask, and you're telling me that I can get it from you, contracting that it can come in, which kind of contradicts how masks work if you're in the construction field. Can you just not turn the mask inside out? Then it shouldn't come in contact with you. I mean, that's kind of a little bit of common sense. The mask should be stopping whether it's one way or the other. It's made of the same material inside and out. So I'm a little confused on how it's beneficial if both are wearing it or just one's wearing it. So with that being said, I think it's necessary for vulnerable people. We've seen through states, and obviously the numbers are accrued a little bit, but you can see that the most vulnerable people, they should take precautions. I don't feel that people that are high risk should be going out. You have the safety of your own home. You do the things necessary for your own safety, but that is a choice, not forcibly that we're forcing you to stay home, we're forcing you to wear a mask, we're forcing you this and that. So I believe that with all that being said, it should be a choice, and that masks are only as good as the person wearing it, and we all care about each other. Everybody else before me has all stated the same thing. So another point in mind, we have a man here that asked the questions, who's all got the COVID? Well, he had it, and he's still standing here today. So I'm not downplaying how the severity of it, but he is still standing here today. And it may be tough, but we can't scare everybody from, what are we scared from, getting it, or are we scared from dying from it? There's a little bit different, and maybe it was the way I was raised. I believe in you should have a certain amount of germs on your body. That's kind of what keeps your immune system strong. It's just like when you're young, you tell your kids go out and get dirty, it's good for you, it helps and gets you strong and things like that. So that's the basis of where I grew up, and now you're telling people to clean yourselves 100%, and people that I've noticed or that I've come in contact that are more accustomed to using sanitizer and all this stuff generally are the ones that get sick more often than not, or more severe. So now you're telling people to wear a mask to contain it to themselves, but then it's wearing down your own immune system. So we need to work on our own self-help, but we should not be mandatory telling people that, and like previously stated, we have the whole herd immunity. If you're in good health and stuff, me personally, for the sake of everybody else, hopefully that the virus, as it goes along, gets weaker and weaker. That's what sometimes scientists say. Some scientists say the opposite. But you can say that it may get weaker as it prolongs and goes through people. Well, I'm in good standing health. I believe that I should have the choice to maybe get it. And even if I do get it, I'll live with the circumstances and believe that my good health, good immune system will fight it off and create a weaker COVID-19 down the road. So I still believe that it's a matter of choice. I hate to compare the two, but if you want to force a society and community that you need to wear masks for the sake of other people's lives, it should go into the same argument about abortions. If you're saying we need to care for other lives, when is a child become an actual person? Is it when he has a heartbeat, when it has limbs, when it has hair? When is that line for anybody? And if you're saying that you can have a late-term abortion, you're not caring for something that it's a child already. It already has all the same features of a person. So you're committing murder by killing somebody, but that's considered a personal choice versus now we're talking about mass and it's not a choice anymore. So I believe that with that being said, that we need to leave it into the hands of personal choice, and the people at risk can make their own personal choices. And like I said, does the mask really help if it's just one mask, or there's been no scientific proof in that it takes two masks? And here's my last thing that I want to state. I know it's a bad reference point, but others before me have said probably worse. So as effective as what a mask is one good enough, or do you need two to take care of the problem? It's the same thing as if you're wearing a condom. Do you wear one condom, or do you put a second one on because you're not sure the first one's effective? I mean, you don't need second type of protection if the first one's supposed to do the job. And that's all I have. Thank you.
Okay. Hello. I love that moment before someone speaks and everybody's trying to figure out where they stand and if they agree with them. I want to start by saying that the science surrounding the efficacy of cloth masks is simply not as established or concrete as we're led to believe. There's a scientific contention for sure, and there's certainly not a universal consensus on this issue. Most of the recent studies that support the mask theory are mechanistic or theoretical models, or simply extrapolations from recent data being released in regard to COVID transmission across the world. Data that is almost certainly flawed as it has been since the beginning of this pandemic. All of the credible studies that purport to show the usefulness of masks come with several caveats: that there are no gaps in the mask, that the mask is regularly cleaned and sanitized, and that other measures, such as social distancing and hand washing, are adhered to. Without these extra measures being enforced, I would say that these studies are rendered nearly useless. It has been documented and reported that face masks, in order to be useful, must be worn properly and cleaned regularly. And if they aren't, or if you touch them or adjust them or remove them and put them back on, they could cause more issues than they solve. Nowhere in this mandate do I see enforcement on the proper wearing of masks, only that a mask is worn. This leads to another issue: the false sense of security that arises from those wearing a mask as if they are now somewhat protected. If you don't think that the city should open back up without masks, then you certainly shouldn't think that the city should open back up with them. Homemade masks are not magic wands that wave away the threat of transmission. They certainly don't top the list in ways to limit the spread of infectious disease. So these mandates only serve to undermine actual effective means of slowing transmission, like social distancing or avoiding large groups, if that is indeed the goal. However, I'm not so sure what the goal actually is anymore. It used to be slowing the spread, flattening the curve, relieving pressure from the health system. Is Branson's health system overwhelmed? Was the curve not flattened at all despite our efforts? Did we not expect a rise in cases after reopening? What exactly is the end game here? What are we working towards? Slowing the spread is the same as postponing the harm. The only real solution is herd immunity, as has been with all previous diseases of this nature. We are not New York, and yet the measures we are now considering run parallel to those used at the epicenters of the pandemic. By enacting stay-at-home orders and quarantines for healthy individuals, and now the masking of healthy individuals, are we not just robbing ourselves of the beneficial effects of low-dosage exposure? We are setting ourselves up for large jumps in cases, then being shocked when we see them. Why? It's the most bizarre implementation of a containment policy that I can imagine. Individuals such as myself who are against the adoption of a mask mandate often use the liberties and freedom argument. It sounds dramatic and silly to some, but it's a worthwhile point of contention. I am responsible for my health and well-being. I am not responsible for maximizing the health of others. Others seldom maximize their own health and well-being, so to me it is ludicrous to ask people to inconvenience themselves to sacrifice their own freedoms and well-being for the hypothetical safety of others, over the suspicion that such individuals might have some communicable disease. I actually watch people outside in public pull down their masks to smoke a cigarette. If that doesn't illustrate my point, I don't know what will. To all the proponents of a mask mandate, I would ask you this: when the next flu season arrives, as it always does, will you be asking governments to force the wearing of masks then? Will you yourself always wear a mask, even after this specific pandemic has passed? If not, why? After all, there is always the potential risk that you are a carrier of some malignant contagion, just waiting to pass it on to an unsuspecting neighbor. Surely, for their safety, you will continue to shield your face so that the thousands who die of the flu every year might have that fraction of a percentage chance at life that the masks are supposedly offering. I fundamentally disagree with the assessment of the efficacy of masks and the legislation surrounding them, the science behind them and the motivations for requiring them, the urge to ask governments to enforce your fears and paranoia on your neighbors. Nearly 38,000 people died in 2018 to motor vehicle accidents. You take that risk on your shoulders every time you get behind the wheel of your car, not just for yourself, but for the injury and damage you could cause to others. Letting fear guide our legislative policies is a mistake. Masking that fear with a vague scientific backing and appeals to authority and calling it compassion is arrogant and wrong. If I believed masks to be dangerous to individuals in our society, which I do to some degree, I would still never feel the urge to ask my state to enforce my beliefs and fears on my community. That would also be wrong. Saying it's just a minor inconvenience wouldn't change that. Thank you for your time.
Hey, thank you for letting me come here. My name is Gregory Denig. I'm from Branson, Missouri, live on Northview Drive in Emery Creek. I let the cat out of the bag early by speaking up, but I did have COVID-19, and obviously I'm not here to debate with you guys. I'm in a losing battle here, okay? I am 100% for masks. Am I for mandating it and making it a law? That's a lot on your guys' plate, and I'm sorry, and I'm praying for you. But for you guys that say don't wear a mask, that you have a medical condition, you're the reason why I wear a mask. You know, it's my generation right now that's dropping the ball. We're going to parties, we're living it up, we're making money, we're dropping the ball. So it's for you that I say to wear a mask, okay? So my journey started March 9th on a trip to Las Vegas. It was spring break. I was really worried about going, but I still had to go because it was for work, and it was Vegas. So March 13th, I came home, and that's when my symptoms hit me, and I was immediately in my basement for 3 months. I'm 29 years old. I am a smoker. I admit it. But it hit me harder than anything that's ever hit me in my life, and that's the only thing that I'm here to tell you guys, that it is real. It hurts. It's hurt me in so many ways that I can never even tell you guys. That 3 months that I had to sit on the back porch in the basement talking my 2-year-old son through a window upstairs because I couldn't be around him. That's all it's about. So when we talk about, yeah, there's only 11 people in ICU, and again, this message isn't really for you guys because I can't help you guys with your vote, but I can help you guys that don't think it's real. Okay, and I'm not debating with you guys at all. Yeah, so I don't think that nobody here has said that's fake. So let me correct myself there. Nobody here has said that was fake. I'm just here for the people that don't believe that the virus is real and that it can't happen to them. It did happen to me, and that's why I'm here. I'm just here so you guys understand my generation specifically. That's why I'm wearing a mask. It's nothing to do with politics. It's just based off of my factual experience and not based off of opinions. So that's all I got for you. I'll be praying for you all. Thank you guys for your time.
Can you hear me well enough?
We can hear you now.
Okay. My name's Jean Chanda. I live at 428 Kays Lane. I want to thank you guys so much for having this meeting. A lot of people here have voiced their opinions about this, and it's a very contentious issue. It's been a problem that's been ongoing. You've done well in addressing this issue, but you've not really been leaders on it, and I can definitely see why based on many of these commenters. There's so much disinformation and misinformation about COVID-19. 28 states have mandated face masks temporarily, only temporarily, not for the foreseeable future. Cities like St. Louis, Springfield, Columbia have passed mandatory temporary mask ordinances. This isn't some huge conspiracy. This is states and cities caring about their own citizens when in some places like here, the overwhelming majority is against mandating masks and keeping everyone safe. It isn't that I wear a mask because catching COVID scares me. The sheer number of anti-maskers here scares me. So many of you truly believe in these fallacies that you're so eloquently speaking about, or sometimes spouting about things you're not really sure about. Several of you speak to valid issues of poverty and running out of masks, okay, or unintended consequences like not being able to afford masks. Some of you speak of not being able to wear one or saying masks will force businesses to close because customers refuse to wear them. Some of you detract by talking about the source of the virus or how it's tested. These issues either are not relevant to this conversation about what's actually in the proposal, or they are demonstrably false. Look, times are tough for everyone right now. The virus has caused untold economic as well as physical suffering. Apparently, 28 states aren't worried more about losing anti-maskers' business rather than protecting the public at large. Running out of masks is a valid issue, but hospitals won't need masks for as long of a duration if we stop the spread of the virus now by wearing a mask and making it mandatory. Nor will the public need to wear a mask for as long if everyone across the country wears a mask now. Nor will businesses have to shut down again from the virus getting worse if everyone wears a mask now. If you can't wear a mask for health reasons, you can wear a face guard. I buy local. I see employees at Country Mart wearing them a lot. If you need money to afford a mask or a face guard, then let's pool our money together and help those who can't afford to buy them or face guards. Or let's help find someone who will sew masks for the others. I know some people say that that's not as effective as these other masks, especially N95s, but at least there's something. Look, the science, some people here are saying it's debatable, but I think everyone wearing masks will stop the spread of COVID-19. I believe the science says that. I believe in science. I'm ashamed of those here who don't. We're dealing with a virus in which nobody knows all of the unintended consequences. None of you do. No one does. Not even the experts do. Erring on the side of caution by wearing a mask in a public for a temporary amount of time is the least we can do. And if it becomes permanent, I'll be the first in the street to protest against it. Okay, I'm a huge activist. And if anybody tries to make this an ongoing thing forever, I will be the first to be against it. Hold on. This mask does prevent the spread of the virus. Okay, I already said that. There are some exceptions to mask in this proposal that seem fair to me. If you've read the proposal, then you know that people don't have to wear masks outside as long as they're more than 6 feet apart. You don't have to wear a mask if you're working like in a hot kitchen as long as you're 6 feet apart. Okay, there are actual exceptions, reasonable exceptions in this proposal. So it's not as mandatory as some of you are making it out to be. I don't think many of you know what's in this proposal, and that's why I explained some of that. Before I leave, I'll leave you with this. And I know somebody said that the CDC director, Robert Redfield, you know, they don't really believe what the CDC has to say, but they're there for our protection. And I'd rather have them there than not have them. He said that the virus, we could drive it into the ground if we all wear a mask or a face guard for the next 6 weeks. That's 6 weeks. That's only 6 weeks. That's not for longer than 6 weeks. If we all do it, 28 states have done it. The rest of the states should get on board and do so too for only 6 weeks. And then we can get rid of the virus. It's not going to be forever. I promise. That's far better than shutting down again, which is our other alternative if this virus gets worse and we have so much business flocking to Branson. I know we need the business right now, but that also means people coming with the virus to make it worse if we don't have mandatory masks. Because I see people not wearing masks in the local Country Mart that I go to. I don't go to Walmart. I see people not wearing masks in the places where I work. We're not wearing them properly. I see guests in restaurants not wearing masks. And I understand you have to take it off to eat, but you can wear it coming in and out of the doors. There are a lot of people who are not wearing masks properly right now. And that's why this needs to be mandated. Temporarily. That's all I have to say. Thank you.
We've gotten a little lax on our masks, so if you've got one and you don't have a reason not to have it on, please put it on.
What a day.
You have a reason to have yours off. So.
What a day, what a day,
Good
what
to
a
see
day.
you cleaning up something, Nate.
I'm gonna clean it all up. Mayor, you got a case of beer back there anywhere? All right. I have some prepared remarks, but I wrote some things down while I was sitting here because I don't know. First of all, as a citizen, I would like to express my utter disdain and embarrassment for the blatant disrespect for our local healthcare officials. That was totally appalling. So for booing and hissing our local healthcare professionals, you should be ashamed of yourselves. Second, this is not me, the people. This is we, the people, okay? I mean, we went off the rails on a crazy train. Ozzy Osbourne couldn't have said it any better himself. And I guess nobody's going to Walmart anymore either, so. Anyway, I've done some polling lately, quite a bit actually, and you guys might be surprised, but it's an overwhelming majority around here, people for masks. Overwhelming, you know. So we'll just call them the silent majority, okay? All right, so I sat over there all day and didn't say a word, so anyway, I really hate doing this too because I've been receiving some threats lately, but here goes. My name is Nathan Horseman. I live at 2550 State Highway 248, Branson. Good afternoon, Mr. Mayor. Good evening now. Councilmen, citizens of Branson, I come before you today in full support of a mask ordinance for the city of Branson. It has been 24 days since I entered these chambers for the first time on the 23rd of June. At that time, Taney County had recorded 33 cases of COVID-19 and 2 unfortunate deaths. We currently sit at 146 cases. The number went up as we were sitting here today. And 3 deaths, according to the State of Missouri dashboard. That is 109 new cases of COVID-19 in just a little over 3 weeks. One can only imagine how many of those 109 citizens would have not contracted this virus had we enacted a mask ordinance then. But unless we go to the Celebrity Car Museum and borrow a souped-up DeLorean, we unfortunately cannot go back in time. The time for a mask ordinance is now. So let's start with some actual facts. Fact, masks are highly recommended by the CDC, the WHO, and our own Taney County Health Department. Fact, masks are also recommended by both major healthcare providers in the area. Fact, wearing a mask will not cause you to breathe dangerous levels of carbon monoxide. Fact, this is not the flu. This is much worse than the flu. Fact, the only thing we have to slow the spread of COVID-19 right now is human behavior. Fact, 3.9% of Americans who have contracted this disease have died. Dead. They're not coming back, they're dead. Fact, 15 to 20% of those are hospitalized or need aggressive care. Fact, there is no evidence that herd immunity is effective. Fact, a mask mandate instituted does not, by law, violate your constitutional right. Throughout this whole process, I have learned a lot. It's amazing what a career restaurant server can do with countless hours, a cell phone, a laptop, and a genuine care for his fellow neighbors. I am humbled with all of the help, advice, knowledge, and insight that I have received on this unfortunate journey through this unprecedented time in all of our lives. Within the past week, while doing research for this moment, I have spoken to people I never in a million years would have ever thought I would be speaking to. I have spoken with city and county officials from 10 different communities throughout the states of Missouri, Arkansas, and Oklahoma who already have mask ordinances in place, and they all told me basically the same thing, which is what they mandated masks for the greater good and overall health of the people of their communities. They all agreed that masks are not the overall answer to the problem, but in legitimate scientific studies, they are the best and least intrusive weapon to help slow the spread of this highly contagious virus right now. And so far, it is making a difference. I also contacted the offices of Stephen Edwards, CEO of Cox Health, William Mahoney, president of Cox Branson, and Craig McCoy, president of Mercy Hospital, and humbly and kindly requested they all send letters of support on behalf of myself and the citizens of this community to this council in favor of a masking ordinance for the city of Branson. I was also assured they would do so. It is my hope that you receive those letters. After I saw him speak at the Springfield City Council meeting on Monday, I also reached out requesting support from Dr. Robin Trotman. Anybody doesn't know who he is, he's the leading infectious disease specialist of Cox Health, who I might add recently contributed to the latest CDC study regarding Great Clips Hair Salon, where 2 mask stylists who were infected with COVID-19 came in direct contact with 139 clients, none of whom tested positive for coronavirus. That study alone proves masking works. Again, it was published by the Centers for Disease Control, and I would imagine right now it is being shared worldwide. Just yesterday, I contacted 2 members of this community who either own or operate some pretty prominent tourist destinations around here. One who gave me not only their support for a mask ordinance, but some very valuable insight and comments, as well as kindly asked me to not drop their name, which I will respectfully oblige. some of their thoughts, and I quote, "The science of mask wearing speaks for itself. Mask wearing doesn't mean there will be no cases, but mask wearing is proven to prevent those who do contract the virus from spreading it to massive amounts of others who are also wearing masks." If you don't mind, I'm going to take a sip of water here. They then added this very heartfelt comment, which I wholeheartedly agree with. "I remember a time when Americans would do anything to protect the lives of other Americans. We know that this virus is spread through respiratory droplets, and masks minimize that risk. Why would we not want to wear a mask to save a fellow American from pain, suffering, and possibly death?" The other was a very nice lady who gave me invaluable information and permission to drop her name, Mrs. Mary Kellogg, owner of the Titanic Museums, which both require masks for all employees and guests, not only here in Branson, but in Pigeon Forge, Tennessee as well. Mrs. Kellogg was very adamant in her stance. Her philosophy: 1, wear a mask. 2, follow the CDC guidelines. 3, her number one priority is protect her employees. Her guests have the freedom to choose whether or not they want to board her ships, but if they choose to do so, they must wear a mask. She laid out for me their company policy when confronted with a guest who wants to enter her attractions unmasked, which is quite simply and calmly, "I understand. This is our company policy at this time. If there's still pushback, I understand. This is our company policy at this time." She informed me she has faced very little pushback and gave me another fact: business is booming anyway, and they have encountered more people in favor of their policy than against it. The bottom line for her is the health and safety of her employees as well as her guests. Mr. Mayor, Mr. LeBlanc, please be patient with me here. I spent a lot of research talking to a lot of people about to do this, so I'm going to read it anyway. I have read and heard so many people state that wearing a mask is a violation of their constitutional rights. This is also not true. I know this because I contacted a constitutional lawyer to find out. I will try to convey his opinion without butchering it. If we're talking about the U.S. Constitution and whether or not a mask mandate violates any sort of constitutional right, it does not. The 10th Amendment, which gives all powers not enumered by the Constitution to the states, the powers not delegated to the United States by the Constitution, nor prohibited by it to the states, are reserved to the states respectively or to the people. Provides for the states to have police powers. It is the whole basis of our criminal justice and law enforcement system. Among police powers is the power to enact laws and regulations for the good of the public order and public health. With public health, this came to a head in the early 1900s with Jacobson versus Massachusetts, a case that was heard by the U.S. Supreme Court. In Jacobson, there was an outbreak of smallpox in Cambridge. The city passed an ordinance requiring everybody to get vaccinated or revaccinated against smallpox. Jacobson refused and was fined $5. That's about $150 today. He argued that forced vaccination or jailing, fining him for not being vaccinated violated his constitutional rights, arguing that the requirement was unreasonable, arbitrary, and oppressive. The court ruled in favor of Massachusetts, basically saying that in every well-ordered society charged with the duty of conserving the safety of its members, the rights of the individual in respect of his liberty may at times, under the pressure of great dangers, be subjected to such restraint, to be enforced by reasonable regulations as the safety of the general public may demand, and that real liberty for all could not exist under the operation of a principle which recognizes the right of each individual person to use his own, whether in respect of his person or property, regardless of the injury that may be done to others. The court held that mandatory vaccination policy was not unreasonable, arbitrary, or oppressive, as long as it didn't go beyond what was necessary to protect the public health. So yes, there is no constitutional violation under the United States Constitution. As for Missouri statutory law, Missouri allows for city, county, and state health departments to enact mandates for the purposes of protecting the public health. These mandates can be quarantining people, closing business, ordering occupancy limits, etc. The state delegates that authority downwards, so the state DHSS can issue its own orders, but the city and county governments can issue stricter orders if necessary. Jacobson has been repeatedly upheld by the U.S. Supreme Court. So I presented factual information from health officials, other city governments from 3 different states, doctors, scientists, and a constitutional lawyer. Now please allow me to voice my own opinion. I said this last time. I know masks suck. I know they are uncomfortable. I know they are inconvenient. I do not like wearing them myself, but they have been proven to slow the spread, which is what we are trying to do here today. We are trying to come up with the best way to slow the spread of this virus in our community. Lately, when I have been out, I see more and more people wearing them than ever before, which tells me as time goes by, people are starting to take this more seriously. Major companies are starting to get on board as well, most recently Walmart, along with Costco, Apple, Verizon, Starbucks, Menards, AT&T, Walgreens, CVS, Aldi, Best Buy, and the list goes on. Here in our community, Silver Dollar City was the first to lead the charge, and I haven't heard much of anything negative coming from out there. Just like anything else, people will get used to it. Robert Redfield, director of the CDC, recently said, if all of us would put on a face mask covering for the next 4 to 6 weeks, we could drive this epidemic into the ground. He also said wearing a mask is not a political issue, it is a public health issue. I'm glad to see the president wear a mask this week and the vice president. We need them to set the example. The bottom line is masks work. So in closing, I have one comment for the naysayers, anti-maskers, conspiracy theorists, and armchair infectious disease experts, and those of you that believe it violates your constitutional rights if you're mandated to wear one in public. You have spoken out against career scientists, healthcare professionals, even the own professionals in your own community who are out there risking their own lives, working tirelessly every day to save your neighbors who have contracted this virus. Listen to these people and heed their warnings, because I guarantee you, if any of you contract this virus, you will be begging those same people to change to save your lives. Wear the damn mask. Thank you to the board. Thank you to the board for giving me this time to speak. Last time I was here, I quoted a comedian. This time I'm going to leave you with a quote from Army Captain Steve Rogers, who is renowned worldwide as Captain America. This is the fight of our lives. We're going to win, whatever it takes.
If you wouldn't mind to sanitize for us.
Yes,
appreciate
sir.
it. Thank you very much.
You are so welcome.
Can we do another 5 minutes or?
Can, as you all know, this has been going on a little bit of time, and we need to take a 5-minute break. I apologize to you all that have been waiting so long to speak, but we need to take a 5-minute break.
No, we just wanted to be here till 11, didn't we?
and I've asked the officers in the hall, and I'm asking you all in here, if anyone else wants to speak, they need to get in line, let us know they want to speak. We need to be aware. You don't have to get in line if you just let us know. But let's get the last person. Let's find out who it is. We're looking for the last speaker. Since we've been here since 2. Are you the last one?
1, 2, 3, 4, 5.
You got a yellow shirt and a mask
7.
on. I think I can remember you.
Well, we can hold them to 5 minutes, it'd be nice. Whew.
All right, thank you. Yes, sir, thank you.
Good evening, gentlemen. Greg Pope. I actually live in Highlandville, Missouri, but my business is in Branson. I was one of the few businesses able to not be financially crippled by this pandemic. I make whiskey for a living. It was a simple transition for me to go from whiskey to ethanol-based hand sanitizer. In fact, the city of Branson has purchased several hundreds of gallons of my hand sanitizer, and you're welcome. One of the things I've heard earlier this evening, and it's data that I've seen in the past, these masks, it's accepted that there's a 0.3 micron hole. That's incredibly small. It's roughly 1/10 the diameter of a human hair. Very, very small. But the COVID-19 virus, it's commonly accepted that is a 0.0125 micron. That's like a chain link fence inhibiting a mosquito from flying through it, to put it into perspective for you. They're just not effective. In my past life, I've worked as an emergency medical technician. I've worked in surgical suites. I can assuredly tell you that this mask was never designed to prevent a bacteria or a virus. What it was engineered for, and what it does reasonably well, is maintain a sterile field's sterility. When you're in a surgical suite and you're communicating with each other, you have the potential to put out some spittle, right? We'll call it just moisture in breath. That goes right through the mask. It really does. What masks do is if somebody that's in that room has to sneeze or something, let's say it's the surgeon, they set their instruments down, they take a few steps back, they sneeze. Someone else will come remove that mask, wash their face, apply a dry mask so that they don't contaminate the sterile field of their gloves, and all of the good surgeons will replace their gloves regardless. Most of them will even put a new gown on because they had a cough or a sneeze. It's someone's job to just wipe sweat off of their forehead. That's their whole job, right? These aren't designed to stop a virus. They're just not. One of the points that I have yet to hear this evening, and I've heard some wonderful facts from people, is everybody's talking about the increase in caseload. Spectacular. You know what? Cases are going up. It's irrefutable. As with all things, you look more, you find more. Believe it or not, there's a medical terminology, WNL, that's put on a lot of medical records within normal limits. It actually stands for we never looked, right? I mean, it's factual. You know, you're getting your medical record, oh, within normal limits. Well, no, they never looked. You know, what we're not seeing is the survivability rate. The latest study that I read, and I'll grant it, it's more than a week old, said that there's a 99.63% survival rate. At that survival rate, who cares, right? I probably have already had the COVID virus. I believe that I contracted it between Thanksgiving and Christmas. When I had a cancer surgery, I woke up from surgery at noon and I was back to work at 3 o'clock because I don't miss work. I missed 3 weeks for a respiratory illness. My doctor could not diagnose it. He was giving me steroids. He was giving me antibiotics. He was giving me everything under the sun, but nothing touched it. And it was strictly respiratory with some digestive discomfort that I chalked up to being more attuned to being plastered with antibiotics and steroids. I haven't taken a test yet to see if I'm positive or not, because I know from my time working in the medical industry that those tests are inherently wrong. Like someone pointed out earlier today, if you've had a flu vaccine, I have, it will test positive. Do you know that there are literally trillions of coronaviruses? Right? The corona is just a spike off of a cell. There are trillions of them. The SARS coronavirus 2 just happened. The reason it's called novel, that just means new, you know. It doesn't mean that it's any more or any worse than any of the others. It just means new. But there are trillions of coronaviruses. So how the hell am I supposed to believe that a test that takes a 0.003 to trigger that is not one of the other trillions of viruses that are corona-based, because that's what they're seeking, is that protein off of the corona cell. It would be asinine to think that that's an accurate test. But with all things, the more you test, the more you find. The more you look, the more you find. I transitioned out of the medical industry into construction, ultimately into being an inspector. Guess what? The more you look, the more you find, right? That's how it works. But the survivability rate is not what anybody's really talked about. It's incredibly high. It is actually less than influenza. Many different studies. In fact, even Rachel Maddow from the Clinton News Network had to finally come on and say that hydroxychloroquine does indeed reduce the terminal aspect of this disease. And she was the loudest person beating that drum. You know, how dare anybody ever recommend an off-label prescription? Well, I got news for you. In the real-life medical industry, and I know one of the doctors that was here today, and we've sat down over a glass of whiskey in the past, and his statements today were not his personal statements, they were his corporate statements. And I can tell you that assuredly. And I would say it face to face if he were here. And I would call him a bold-faced liar if he were here. He's following the corporate ladder. He's a doctor. He makes hundreds of thousands of dollars a year. He needs to follow that corporate ladder. That's his job. He went to school for 12 years, right? Not just 8, but he's a boarded specialist. So an additional 4 years of specific training. He's got a hell of a lot of money riding on it. But the fact is, the survivability of this is still incredibly high. It's less effective than the influenza. More people died in the United States of America from tuberculosis than have died from COVID-19 since the January 1, 2020. Where's the pandemic on that? Oh, it's a 400-year-old bug. We don't have to worry about that, you know. I know you all know what you're doing. I trust in your intelligence, and I believe that even though there's been conversation on both sides of the spectrum, the reality is the vast majority of your constituents are opposed to this, and everybody had an opportunity to come. Thank you for giving me this moment. Have a great day.
Need one of those barrels of whiskey after this thing's over.
Brother, I will take care of you.
That's really good beer.
Can you hear me all right?
You can, Don.
I'll try not to touch anything. I don't want to catch anything. I may have to get a note from the mayor tonight. My cell phone died some time ago, and I'm going to have an explanation as to why I didn't tell my wife I wasn't coming home. My name's Don Ingram. I live in Hollister. I have a business in Branson and have had a business in this area since 1978. Up front, I'll tell you, I'm in favor of this mask ordinance. I don't particularly like it. I think it's something that we're going to have to bite the bullet on. I'm not going to argue the science. I've not drilled down as deep as a lot of these people have, but a lot of these people that drill down are not epidemiologists either. I would prefer to go with what the CDC is telling me rather than somebody out here in left field, and not trying to be demeaning to anyone, but that's just kind of the way I see it. That's the first argument, is I guess the medical argument or the scientific argument. The second category that things seem to fall into was this freedom thing. Now, I'm a big believer in our Constitution, particularly our Bill of Rights. I think those are very important, but I also think there are limits on freedom in this country. And sometimes we have to give up a little bit of freedom to protect all of us, and I think this is one of those instances. I think the hyperbole with regard to comparing it to wearing the star by the Jews prior to World War II is just way out of left field. I understand about freedom. My grandfather and his brother were in World War I. I had 5 uncles, my dad in World War II, my father-in-law's in World War II. And so it's not just veterans that are against this. I'm a veteran. I was 19 years old and got sent to Vietnam, you know. So it's not every veteran in this room that's opposed to this ordinance, so I don't buy into the freedom thing. The other thing is, with regard to the economic argument, it's going to hurt everybody for a while, in my opinion. It's already hurt us. It's going to hurt us a whole lot more if Branson becomes what I'd call the COVID hotspot, because we're not willing to take the steps that it's going to take, not only to protect our own people, but also to protect our guests. So for that reason, I'd request that you guys vote in favor of this ordinance. Thank you for your time.
Thank you, Don.
Good evening, Mr. Mayor, Council, and folks of Branson and the surrounding areas. My name is Christine Deaton, and I live here in Branson now. We've been coming back and forth for the last 9 years, but we live here permanently now. And I would like to say that, first of all, it's almost like there's nobody really on the fence. You're either for masks or you're against it. And so here is my I'm a very logical thinker. I've always been, sometimes to a fault. And so my husband is an ER nurse in the emergency room. And I just want you folks to know that they are directly affected by what comes in to the emergency room. Our house has, without,
please, no discussion.
I don't know that there's been an exception to the rule for weeks and weeks and weeks and weeks, that he is not on a 21-day quarantine because of some exposure in the emergency room. My house is constantly in some kind of quarantine. So what I'm saying is this. Years ago, when the government said, you know, let's say no shoes, no shirts, no service, we had to conform. When they said no more smoking in facilities, in public facilities, we had to conform. Sometimes, whether it's a personal belief or not, we have to conform. Now, I don't think wearing a mask is a forever thing. I hate these things, but guess what? We have to wear them in our home because my husband is constantly exposed to the virus. In our home, my grandchildren, I have 2 grandchildren, my daughter, my son-in-law, they live with us right now. And we wear masks in our home. Not only are we trying to prevent the spread amongst ourselves, but we're trying to prevent the spread from anybody else, from my 80-year-old mother, who doesn't live with us, but I see her several times a week. She's one of the people that if she gets COVID, she's gone. If it takes wearing this for a while, if it means that there's a 10%, 20, 30, whatever it is, chance that this stupid little piece of something is a preventative for spreading the disease that we really don't know everything about, okay, then why aren't we doing it? If the government says to us, do 3 things, stay 6 feet apart, I'm good with that, because I don't want, I mean, you know, I don't want that distance. I don't want you to give it to me, and I don't want to give it to you. Whatever it is. I don't care if I have the sniffles. If it says, wash your hands for 20 seconds, for God's sake, wash your hands for 20 seconds. I do it multiple times a day. Multiple. If I go to the store, which I'm one of these people that since COVID happened, I'm home. 90% of the time, I'm home because I'm over 60, I have asthma, I have autoimmune disease, I have a lot of things going on, and I don't want to catch it. And if it says, wear a mask, then just do it. Until we know more about this, until we know that maybe this is the only preventative we have right now, maybe this is the only thing that does stop or slow down the virus. We don't have a cure yet. Nobody has a cure yet. But I just don't think that this is so much to ask of you and me to do right now to help the spread of this horrific thing. I personally have lost people in my family with friends from COVID. My father-in-law, who's in a nursing home in Arizona, just contracted COVID, and most of the people in the nursing home and the workers have COVID. So this little debate, look what we're debating. Look at this. This is not a debate. This is if it's a 1% chance of stopping this virus or slowing it down, for God's sakes, wear a mask. Thank you.
Thank you, Mr. Mayor and Aldermen, for this opportunity. I'm the husband that she was speaking of, bringing the potential contamination home all the time. I'm the reason that my family stays quarantined, and my job is the reason that I've moved into another part of my home and don't sleep in my own room. What Christine said is very true and made a lot of sense. This is a temporary change. We're not talking about permanent restrictions of your livelihood. It is a permanent change to do a simple thing that we believe, we don't know 100%, but we believe will slow the virus. We believe will protect the people around us. As I'm sure everybody has heard, my mask protects you, your mask protects me. I'm not wearing the mask here today because I'm afraid of getting something from you. I wear it because I don't want you to catch anything that I might have come in contact with. And for those of you who choose not to wear a mask and who choose to go into these places that either don't require you to wear a mask or encourage you not to wear a mask, I think it's a shame that you don't have the common courtesy for me, for my wife who's at risk, for my grandchildren who are at risk, for your neighbors who may be at risk. Shame on you. Those of you who think this is a falsehood, a made-up thing, a political ploy, I guarantee you, you can go into hospitals, ICUs, and morgues across this country and find all the evidence you want to the contrary. I will say thank you to those businesses who have had the forethought and caring for their customers, for their guests, to require the masks to be worn. They're protecting you by that requirement. If the city says wear a mask, they're choosing to do so to protect you. I don't know what the fight would be over that. For those of you who choose again to go in these places, not wearing a mask and not required to wear a mask, I'll say thank you to you too. In my job, your job security for me. Thank you very much.
Thank you.
My name is Richie Zaitz. I have had an address in 1029 Cliff here for many years.
I'm sorry, Richard, we can't quite hear. Can you either pull the mic up or?
Okay.
Yeah.
My name is Richie Zaitz. I don't like the shaming process that I keep hearing, you know, this shame on you, shame on you. We've already established that the micron level of the mask doesn't work. My major was neurophysiology. I'm telling you, this is all nonsense. You're actually putting yourself more at risk by breathing in contaminants into your body on a continual basis. You're not getting an oxygen flow. People have been passing out from lack of oxygen. Many cases, many situations. I have personal friends, and they said that their family members did not have COVID, but they were, assigned that, ailment by somebody at the hospital. So really, we're not getting accurate data here. I feel that for your own sake, this is not the answer. This is not the answer. We have to have freedom. We have to have freedom. My grandfather came here to get away from Stalin. He had a farm. He was youngest, and they were starving the people that owned the farms. So I have a very strong feeling about liberty and freedom. And I believe that you men are going to make the right decision and allow us to make a personal decision regarding this, just like other events that occur in people's lives. You have to maintain rights in order to have a maintenance of freedom. We need this freedom. And for you to establish any type of policies that would take away our rights is, in truth, it is insanity. It is contrary to everything that was established for this country. People going out protesting with no mask, and it's just I watched the documentation. I saw the documentation. It's vague. It's not complete. And I know that you have the best interest not only of the businesses, which is secondary to human life, but this isn't the solution. This isn't going to work. You had a gentleman tell you that. Then you have people tell you contrary things. Then you go back again to its, benefits. It's not beneficial. Okay, we've established that. The micron level tells us it's not beneficial. You can still get whatever it is. It's a common cold. And it's been drawn out of proportion. There are people that have had respiratory problems that were negative. There were people that have sent in, called in and had positive come back, and they never even sent in samples. This is a true fact. Everybody knows this. So there's seems to be some skewing, some rearrangement of numbers and facts going on. We have to take that into consideration when we're making decisions. I really adjure you to shut this down as far as taking away our freedoms. I would ask you to maintain our freedoms as citizens here. You saw the majority of the people are opposed. I say, I go out, in public, all these people are in favor. When I'm out, I see the majority of people without masks. Okay, and I'm out every single day, and they're not afraid, they're not worried. The numbers are very low. We're seeing, what we're really getting is not truth, but propaganda. And I'm not going to buy into it. I believe in my individual freedoms. I believe you believe in that. And I believe you're going to make the right decision to let us maintain our rights and not wear an obstruction on our face, which I never wear. And I came here, I'm very much into health, and I was having a hard time with this thing, trying to figure out where I was supposed to be breathing and this. It's not because I'm trying to be rebellious. I'm literally trying to stay healthy. And I recommend that you, gentlemen, get those masks off as quickly as you can after you leave the chambers. And if you're walking around the streets with it, then you're just breaking down your immunity system. We've had plenty of very viable experts here make these statements over and over again about the fact that these are not effective. If they're not effective, then why are you proposing that we use them? God bless you guys. I hope you make the right decision, maintain our rights. That's all I ask. Thank you.
Thank you. Sir, if you wouldn't mind, need to make sure that it's good. That's all right.
Where'd you find the wipes? Where'd you find the wipes?
I have no idea.
Me neither. My name's Eric Harlem. I've been trying all day to get here, but just a little bit about me. I had an emergency where a fire truck hit a door. So life safety takes precedent over everything else, and I went and fixed their garage door. I do garage doors. I've been doing doors in the Branson area since 1995. Most of you have probably been in your house.
You want to move a little closer to the mic, so yeah.
I've been doing doors in Branson since 1995. Been probably in most of your houses. I'm not going to sit here and debate scientific facts, scientific theory. This doctor said this doctor said that. You know, this whole thing has failed from the beginning from our federal legislature, and it's just trickled down to all of us. You know, and it's up to us at this point to, you know, if you want to wear a mask, fine. If you don't want to wear a mask, fine. You know, to what end? It's just 90 days now. 90 days from now, what else is going to happen? What else is going to come up? The AIDS epidemic. You know, you still couldn't get people to wear condoms. You know, they just don't care. It's human nature. You want to sit here and talk about science of a virus, but it's human nature. And to be honest with you, there's 3 or 4 people in here that are really, really proficient on human nature, and they're sitting here wearing badges. You know, they know what it's like to be out here. You're going to have people that want to lick windows. It's not going to matter. You can mandate this all you want. It's not going to change anything. We are all at some point going to get this virus if it's that bad. I mean, we had sand coming from Africa from 5,000 miles away 3 weeks ago. I mean, does anybody remember that? It was, I mean, it was foggy or, you know, sandy. I don't know. I mean, but it came from Africa 5,000 miles away. You know, if your garage door breaks at your house, I guarantee you that you're still going to, you know, call me or another garage door professional and say, hey, I need my garage door fixed. And I might say, well, I don't wear a mask because when I get in your garage and I shut that garage door, it's 130 degrees at your ceiling. I'm not in the best shape. I mean, oval's a shape, but it's not the best shape to be in. But, you know, we each have our own responsibilities to ourselves, our neighbors, our friends. Yes, there are people that are more susceptible to this. I have friends that have been sick from this. I have not had any close to me that have died, but I do know of some that have. But I also know of people that didn't die from COVID, but it was reported that it was COVID. You know, we have elected officials for a certain reason. We used to have horses and buggies, you know, and you'd have to go back and talk to all your people, and then you'd, you know, go back like, you know, our legislature. A simple website where every registered voter can log into, view every piece of legislation and securely vote yes or no. And that's the vote that goes to, like, Congress. It says you can't buy me, you have to buy all of us. Same, and it could trickle down to every school here, no offense. I mean, you guys are just here representing the people, correct? So if you had every one of your constituents that were able to securely log onto a website and it was mirrored so they could see everything that they voted on, you would have a true vote of the people at that point, and you're just a carrier of that voice. It's simple. It's there. We have the internet. It's quick. It's easy. I built the website myself because I am running for U.S. House of Representatives in 7th District. But I'm not asking for money. I'm not asking for anything. I'm just asking, take a look at human nature. It's not going to matter. We have people, you know, killing cops for no reason. We have people that are killing each other over colors. You know, like I said, you couldn't get people to wear condoms for AIDS or, you know, anything. How do you think this is going to change anything? Set the precedent. We've already destroyed our economy. It's gone. I mean, and there's a lot of people that aren't coming back from it. And your suicide rates are going to be higher. I guarantee you at the end of the year, these officers, their calls are going to be higher, yet people are calling to, you know, defund the police, which is the most ignorant thing I've ever heard in my life. When you defund the police, that's taking our freedoms away as well. I mean, period. These are the guys that I worry about. If they want me to wear a mask, I will wear a mask for them. You know, our first responders, elderly, I do have elderly customers, and I will wear a mask. But I don't see the point in it. I mean, I've had people, spit in my face with the worst possible, well, every possible disease you could think of, I think. I never got sick from it. I may have, but I worked at Mercy for a long time, and I didn't get sick while I worked there because I was around stuff all the time. Not saying COVID's any different, but it's just remove the science, remove the politics. Think about it. When you go to Walmart, what do you see? You see human nature at its finest. You can't even get people to pull their pants up. How are you going to get them to wear a mask? And then you're going to fine them? To what end? Okay, well, the officer's going to write a ticket. Well, now this person that has asthma, a little bit overweight, I can't wear a mask because on the way, I guarantee if I had a pulse ox, it would have been in the mid-80s. That's a good temperature, but it's not a good pulse ox. Don't do it. You cannot change human nature this way. There's a way to do it. This is not it. You cannot mandate somebody. I mean, the fine for not wearing a seatbelt is $10. That could cost you your life, and I see it cost lives every day. People texting on their phones. Every car I pass, if I had cameras, when I passed every car, you would see your children, you'd see your sisters, you'd see your wives, your fathers, your husbands, sitting there texting on the phone. I mean, nonstop. You can't stop human nature. You can't stop ignorance. And whether it's ignorance of not wearing a mask or the ignorance of wearing a mask, we've spent billions of dollars on anti-bullying. Look where that's gotten us. I've been in the Branson area for a long time. This is my home. I love it here. And I'm absolutely done with it. I'm done with this whole COVID-19 stuff. I don't care about the politics. I don't care about the scientific facts, scientific theory. Doesn't matter. It's human nature, and you're not going to change it. When you add $100 million per year to the world, you're going to have more deaths. It's math. I mean, it's the old math. It's not the new math, but it's math. And, I hope you guys just take that into heart. I mean, there's pluses and minuses, but to mandate it, no. If you're at risk, you can be at risk. Wear your own mask. Don't force it upon somebody else. Just like religion, just like anything else, it's a freedom that we hold dear. And I'm sorry, I saw all this coming and I was prepared for it. My business is okay. And unfortunately, I couldn't get anybody else to listen. But my name's Eric Harleman, and y'all have been very patient today. Have a great day. It's for the officers. Y'all be safe. Thank you.
I know the drill, right?
Yeah, thank you. You're a quick learner.
Yeah. One of these little babies, clean it out real good. Testing. Ooh, works good, right? Okay, so I wasn't going to come up here, but because a lot of the things that I feel honored to be here with these people that are so in tune with what's going on, even at the federal level and everything, and the CDC and the HW and all that. But I thought I would come and bring a little bit of maybe, step out from the forest a little bit. So we're talking about this mask deal over here, whether to mask or not to mask, right? So, President Trump, he came out and he said, now, I know most people here like President Trump, right? Because of the fact he's bringing the economy back, he's bringing our liberty back, he did away with the Trans-Pacific Partnership where they're trying to merge us with Mexico and everything, and the Paris Accord, and got us all out of all that globalist stuff, right? That's why CNN and that's why all these guys, that's why you see such a division in the country, because the globalists, the one world government guys, the guys that's making the one world government do not want to lose, okay? So President Trump gets up there and he says, we're fighting a invisible enemy here. And he's not only talking about, a little floating virus, which is probably not even one of them in this room right now, but he's talking about the deep state, okay? The reason why I'm talking, because I've been studying the deep state before some of these guys were still in diapers, okay? And because you know why? I wanted to know how the Antichrist was all of a sudden going to build this one world government. Oh, I'm just going to stand up here and say, I'm Jose Martinez from Israel and part Egypt and all that stuff. And, I'm the Antichrist, and all of a sudden you're all going to listen to me. No. This has been going on for years and years and years. And what they do, they build order out of chaos. They bring the chaos, And when they bring order, they take a little bit more of your rights away, just a little bit more of your rights away, and get everybody scared. So fear is a big thing that they use, okay? So for example, I could sit here and go back 20, 30 years and just segment it for you, but we don't have time for that. I'm not going to do it. I'm just going to tell you a few facts, okay? And if you want me to document them for you, if you want to hold off the vote, I'll bring the facts in. You can look at them. You can check the sources. Talk about fact checkers. I'm not talking about fake polls or just something saying I'm facts. I'm saying something that is facts, okay? So for one thing, the CDC actually gave money to, this is a bioweapon, okay? And that should make us all scared anyway. Yeah, let's all put masks on. It's a bioweapon, right? We're all going to be dead, right? No, because it's not that bad, but it is a chimera virus, okay? And it was made in conjunction. And Francis Boyle, I'm just going to give you a few facts, a few people you can search if you want to. Francis Boyle, who was under President Reagan, he's the one that made the laws against making all this kind of chimera virus stuff. But you know what? The black ops in our country and in China and other countries, also Russia, they've been having these level 4 labs, and they've been making these viruses for biological warfare. And when Cheney, if you remember it, I don't know if you're all paying attention, but China found out they had one that was race-specific for China. Oh, what was the fallout over that, all right? So all of a sudden, now China is working on it in the Wuhan, level 4 lab from Wuhan, right? In conjunction with the United States, all right? So this is just this part of their many-pronged attack to bring the world into a one-world government. Yes, the Antichrist will come. Yes, Jesus is coming. I'm talking about truth right here, okay? And welcome to the end times, all right? Now, the thing is, what decision are we going to make here? Are we going to go along with what the deep state? So I've been studying the deep state before there even was a word for it. Oh, you're a conspiracy theorist and all this stuff. No, because this is what they've been doing the whole time. They bring order out of chaos, all the Rothschild dynasty and everything. And I know I'm taking a chance that maybe you're going to marginalize me, but you know what? Somewhere down the line, each and every one of you is going to remember what I said and say, oh, that's what that guy was talking about. Then maybe you'll be able to prepare yourself, But what we do in these times, when the deep state is coming around, the Black Lives Matter thing is a George Soros-funded deal. He's wanted in Hungary, in his own country. He's wanted in countries all over the world. Bill Gates is wanted in different countries for killing Africans with his vaccines. It's got different kind of biological warfare in there. And yeah, they actually brag about it and things. Now, I can get you documentation on all this stuff, okay? I have no problem saying this. I'm a minister. Most of the time, I get people saved. I get them full of Jesus. I get them looking to the light of the world, right? But now I got to speak up because of this. Because people are being duped, okay, to go along with this deep state agenda. Now, part of this deal, getting these masks on here, is to get you to bow your knee a little bit. Oh, yeah, I'm afraid. I got to do this. And the next thing, and my brother, the attorney over here, says, oh, yeah, there's precedent for everybody getting the vaccine. Well, I'll tell you what, if you take Bill Gates' vaccine, you're going to be big problems. And you can do research on all the kind of garbage that's in that. That's already out. Okay? So we're talking about real stuff that you can document. Francis Boyle, he's like the ultimate virologist in the world. So these viruses leave little tracks on what lab they were made in and all that stuff. They got it all dialed down, right? So the Black Lives Matter thing, the same thing. They're doing all this because Trump is having such a great effect against the globalists. This is where the real war is. Now, Soros has destabilized countries before with the same kind of, it wasn't called Black Lives Matter, it was called something else like the red hats with the green shirts or something in different countries all over the world. And they pay guys like these Black Lives Matter guys to come out, but also now in our education system, a certain amount of people think they want to be socialists, they want to get rid of, white privilege and all this stuff or whatever that is. They take them along. They're willingly duped. But these people are actually paid by George Soros to destabilize countries, okay? So that's where all this stuff is coming from. They don't like the fact that, if Trump was just going to go with no problem whatsoever, he's going to be reelected most likely anyways. But they'd have to put up with 4 more years of them knocking ahead in the agenda, exposing the pedophiles, okay? Ever since he got in, why was there thousands of pedophiles being arrested all of a sudden under Obama? Oh, that never happened, right? You know why? Because right away the power structure is shifting, and there's guys in the CIA and the FBI that are retired they're not even in the government anymore, but they're working in conjunction to win this war for our country, okay? So that we don't have to be a one world government, take the vaccine, take the mark, and everybody does it, and everything. Now, I know that's true. It says in the Bible that's going to happen. We know that's going to happen, okay? But the thing is, there's going to be sheep states and goat states. There's going to be sheep countries and goat countries. There's going to be places where people can actually go as a place of refuge. I say, if the CDC says to do it, don't do it. They're lying to you, okay? The WHO also is taken over. There's high levels in the FBI and the CIA, and that's why Brennan and all these guys are coming out, and they're fighting back and forth in the news all the time because they're trying to win some kind of battle where ultimately they're all not going to be convicted and locked up in the Crossbar Hotel. Hillary Clinton, when she was caught off mic, when she was campaigning against Trump, she says, boy, if he gets elected, we'll all be hanging from the gallows. And she's right. She is right, okay? I don't care if you're Democratic, Republican, doesn't matter what we are. We're people, right? We want to stay alive. We want to have freedom, right? We don't want to be taken over by the globalist agenda, right? This is a little microcosm thing we're making an idea on right now. Oh yeah, I'm going to wear a mask or not. No, this is a small part of this whole globalist agenda coming on the United States. They're making their move now like a big wave, okay? A wave, okay? I say reject the whole bunch of them, stand up, put your big pants on, be a patriot, and say, no, we're going to govern ourselves, and we're not going to take what Washington, D.C. has to say from these alphabet soup agencies that have been taken over. The EPA is the same way. You can't even mine coal anymore. You can't do anything else. They're sucking they make these regulations so we can't make money anymore. Under the auspices of this green. That's another prong of their attack. Is the carbon gases, right? Yeah, they want everybody to stop working. Well, we should have never shut down the economy. That's a news flash, right? You know why? Because first of all, okay, let's say China did release that virus. We know it was a chimera virus, right? Let's say they did. Well, now they hit us with the virus and everybody's sick, or a lot of people are sick, and now we don't even have any money to fund anything else. We're weakening the whole country. How do you like that? We should have never shut down the economy. You can't, just when you're at war with something, you cannot shut down the economy. That was whatever that decision was, it was not good. It was made at the top level. I know you guys are meaning good and you want to go along with everything. You don't want to be sued for somebody getting the virus or something. Well, when's the last time somebody sued someone? When I don't get sick anyway. I got Jesus, okay, and I walk in the faith with it. I never get sick. But you know what? Kenneth Hagin was the same way. But you know what? All this fear over this stuff and everything like that, the deaths are going down, but the things are going up. They're saying, yeah, because it's false test. Oh, it's false test, okay? They're hyping the fear, and the next thing they're going to do, mark my words, they're going to come around and say, man, I want to vaccinate you. And they want to vaccinate you two guys, too. And you know what? When that stuff gets in your bloodstream, we'll see what happens, right? So, hey, I'll tell you what, we're at war here. This is an invisible enemy. Trump knows exactly what it is, and he gives out little clues and everything without actually calling them out sometimes and everything. That's actually what it means. We're fighting an invisible enemy, the Antichrist one world government, okay, coming against the United States, trying to bring it down. We're the last bastion of freedom. That's why they want socialism. That's why they want to divide us, black against white. I love white people. I love these people right here. Okay, I don't love sin. If somebody's in sin, we don't love sin. But what do? We love the person. We love the person. We have a heart on fire as a Christian for everybody here on the face of the earth, right? And we're supposed to have equal laws. Now, is there a bad cop sometime? Well, sure, there's bad everything, There's bad preachers, too. They're sucking widows dry for their money, so. But, I mean, we got to fight against this deep state. We got to stick together, okay, not only as Branson. And that's why the governor didn't mandate the mask, because he knows what Trump, he talks to the governors, okay? And Trump knows that, and he's sidelining the CDC now, and he's also sidelining the WHO and other deals where these guys are trying to hype it up and get everybody, yeah, we really got to be afraid, man. We got to have all this mask. We got to have all this division. Now we got to worry about if a black guy's going to shoot us or something, I mean, this is a multi-pronged attack from the deep state. That's all I can say, And you guys, man, every one of us, we have to make up our mind. Are we going to go along with God? Or are we going to go along with all this deep state, coming in and taking control of us? I'll tell you what, I didn't know there was a precedent for that vaccine. But, precedents are meant to be broken. And so the thing is that you're going to take away you're going to shoot them up with one of Bill Gates' vaccines? I don't think so. That's, and this is just like the precursor to all that. Yeah, bow your knee, put on the mask, do all that, Hey, I love people, and I don't want nobody to die. I pray for people, they get healed all the time, okay? I come against that virus, I pray against it and everything, and some people say, oh yeah, that's hocus pocus or something. No, it really works. But aside from that, how many people are actually dying? You heard this already, but I mean, they're inflating the numbers. How many people are dying of that? Just like the regular flu pretty much, maybe a little bit worse. So what are we going to do? We're going to shut down our economy a little bit more and weaken ourselves a little bit more so we can't go out and buy the healthy foods or buy whatever we need or make the next investment for the growth of prosperity in the United States itself. I mean, we're the apple of the eye of the world.
Sir?
So hey, I just asked you that
I think he made his point.
You make a vote against the deep state. Okay, that's all I can say. And I think on top of it, if you make people wear masks, you're probably this is just a practical thing. You're probably going to bring yourself some lawsuits that you don't want too, because of the health effects. And we know that it affects people's health negatively. Everybody knows that already, So
thank you.
People are going to be suing the city, so.
Thank you. Is this person next? Well, are you the last person, sir?
Well, I was.
Oh, did you slip in between?
I stepped in afterwards, yes, because I got off of work just now. I'll be brief. I don't want to take up your time, so thank you, first of all.
I gotta get my mask.
Sure. Thank you guys for lending me an ear. I will. I saw the protocol.
You got to give us your name.
My name is Alan Peña. I live in Hollister, 277 Walnut Street. Okay,
I'm sorry, sir. Would you come close to the mic so we can?
My name is Alan Peña, and I live in 277 Walnut Street in Hollister.
Hollister, okay.
Correct. Now, first of all, thank you guys for allowing me to speak. I'll be brief. First of all, I am not a medical expert. I do, however, have very good observation. I'm pretty sure it's not superhuman, but it's average. And what I have noticed is that a lot of people that are pro-masks, they do the exact same thing I do. They take off their masks so they can speak better. Okay, another thing, I'm a veteran. When I was in the military, I had multiple jobs, but one of them was being a NBC, a nuclear, biological, chemical warfare soldier. And one of the things that we go over is the proper use of masks so that we don't get any biological nuclear contaminants into our system if we come into that environment. Those masks cover your face fully, your eyes, your nostrils, your mouth. These masks do not. You still have your eyes open, so no one here that's pro-mask has their eyes covered with goggles. That to me, that tells me you're only getting partial protection. Another thing I want to point out is this ordinance that you guys are trying to pass or are considering passing. The way it's written, it's already seems like it's more of a pass than a no-go. But I want to point out a few issues I have with it.
Sir, we've had several speakers tonight. I know you just came in. Did you have a chance to hear what any of them said?
Yes, I did.
Okay.
Yes, I did.
We're asking people not to repeat things over and over again.
I understand. Okay. The exceptions to the children of 13 years of age or younger, that exception, are they immune to it? What's going on there? Just some questions that I'd like to point out. When we're dining, we take off the masks. It's not like we're all of a sudden immune when we're dining, okay? Other medical conditions, are they immune all of a sudden because they're not wearing a mask? they can still transmit the COVID, but like other people have said, this survivability rate is pretty high. For those people that are pro-mask or, they're worried about their health, fine, wear a mask. But I'd say, that's on an individual basis. Last thing I want to say is, say, for instance, I want to protest by not wearing a mask. Now I get fined. Now you're impeding on my First Amendment right to free speech. Thank you.
I'll wipe this down out of courtesy. I wasn't going to speak today, but since I spent 7.5 hours here listening to everybody, I figured I better say something.
He's the last guy.
My name's Steve. I live at 193 Avondale here in Branson. Been here 3 years. Come from Joplin area, so I'm not going to tell you guys what to do. You've heard everybody in here today. All the experts, all the so-called experts, all the real experts. You've heard all the facts, all the so-called facts. But let me ask you this. Does anybody know what a Six Sigma black belt is? You do. I'm a certified Six Sigma black belt. That's a statistical analysis. And I went in and tried to do a statistical analysis based upon the information coming in from everywhere. And guess, you guys want an answer what I found? Nothing, because you can't do a statistical analysis on all the garbage coming in. Some of it's real, some of it's not. And the only problem I got with all of this is people shaming each other, families going at it. It's really ripped this country apart. And you guys got a decision to make. That's entirely up to you guys. I mean, you're elected. You kind of know where everybody's at. I've heard people say a lot of things about Branson. And let me tell you this, I go to Walmart a lot. Everybody in Walmart pretty much wearing a mask now. I go to shows a lot because I get cheap shows because I live here. And nobody's wearing a mask. And I ask these old guys, I said, why aren't you wearing a mask? Are you kidding me? I survived Korea. No, I survived Nam. You think I'm worried about this? And I'm like, really? You're not going to wear a mask? Nope. He said, I won't come here if I got to wear a mask. So that is real. So is people not coming here because we're not wearing masks. That's real too. So you guys got a decision to make. I'm not going to ride the fence. I'm just going to say it's impossible to make an intelligent decision on this without the statistical analysis of the proper data, and it doesn't exist right now. It's moving too much. It's constantly moving. And they'll say, well, that's because it's supposed to constantly move. No, it's not. You can plug in all the variables. We got 340 million people in this country. 120,000 died. Anybody can do the simple math on that. Well, how many contracted it? We'll never know that because they're not going to test 340 million people. So do anybody die? Hell no. But let me ask you this. Where do we stop? My wife died of cancer last year after a 2-year battle. When she's going through chemo and radiation, and millions of people are doing it. I wasn't in here marching for a mask. Saying, man, my wife could get a cold, a simple, common cold, and die because her immunity system is shot. No, I took care of my wife and I kept her home. Or, actually, my wife just went out and she didn't even wear a mask, but that's how she was. But she was a nurse. She wasn't afraid. I mean, that's just what she did. So I think it's a personal choice. I don't want to infringe upon anybody else's space, but then again, I'm not, if I'm going to a nursing home, which I wouldn't do, but I have in the past when she was a nurse, I'd wear a mask. Well, sure I would. If I was going to grade school, I wouldn't wear one. Kids are not susceptible to it because it's such a bad virus. Kids are not susceptible to it. So I'm trying to do all the logic here. Under 13, if close family members outside, it's okay to be close, but everybody else 6 foot. So let me ask a question on this. So family members can't do it, give it to each other, only strangers. I guess that's what that's saying, because it's saying family members can get together. Even though my daughters don't live with me, they're family, so when they come visit me in Branson, it's okay for us to be close together. That logic doesn't make any, it doesn't hold water. Because if there's 6 foot, there's 6 foot. If you're gonna be together, my daughter could give it to me just as easily as a stranger living in Joplin. You never know. So you guys gotta take all this consideration, but I just don't want it to be done out of emotion and fear. Because what I see in here is so many people against the mask, so many people, few people for it, some shaming going on, which goes on all over this town. It's ridiculous, people shaming each other, and it's just pure division. You hear all the theories, you hear this and that. Everybody's got their own personal beliefs. But until we get a real idea of what's going on with this, and to be honest, I'm not afraid of the virus. I'm 60 years old. Smoked 40 years like a chimney. I'm not afraid of it. I grew up in a junkyard in Gary, God, for God's sake, I'm not afraid of anything. But I'm not afraid of it. I'm not in Branson very much anymore. I'm on the road and quite a bit for different reasons, but I don't go to Joplin anymore, and I'm not going to go to Springfield. That's just the way it is. I'm not going to do business with those people. I can't wear it. I've been wearing one 7.5 hours. I got a hell of a headache, and my neck hurts. I mean, I'm just not going to do it. I care about my fellow man, but it's not my responsibility to keep them healthy. It's my responsibility to keep me healthy, and I'll do whatever I need to do that. That's it. Thank you, guys.
Is there any way I can say something? I sat here for 7.5 hours. I did not hear that. I had to be standing to be a speaker.
I'm sorry, that was the last gentleman right there that spoke.
I'm a business owner in town. I sat here for 7.5 hours and got here early. That's my fault for going outside, but I would appreciate if you let me just.
Did you miss the request to?
Yeah, I did. I walked outside.
Okay, then I don't have any problem with it.
Okay, thank you, sir. I hate public speaking, but I felt that this was important for me to come out because this affects all of us. My name is Michael Jung. I own Lost Boys Barber Company right down the street from here. It's 709 Veterans Boulevard. I really appreciate you guys waiting here for 7.5 hours and actually listening to everybody, because when I first came, I figured you guys were gonna make this like a 2-minute thing, and I respect that because there's a lot of viewpoints on both sides. Some people that were way out there and some people that were, had statistics. I'm not gonna go into either of that. I respect, even though I talked to that gentleman outside, even though I don't agree with him on the mask thing, I respect him for getting up because I honestly thought that I was gonna be the person in this group that had the wavering viewpoint. So, yeah, I respect you and everybody that, yeah. So, in my business, I have not told my employees that they have to wear masks or they don't have to wear masks, and we've tried to be as sterile as we can, which we always are. We're a barbershop. We're sanitizing our stuff, between clients. When people come into the shop, they ask, do we have to wear a mask? And when we say that's a personal choice, I would say 95% of people, even that walk in with masks, are like, oh, thank God. I only brought this because I thought I needed to. I even had a medical guy come in the other day that was wearing a mask and was like, oh, awesome, I don't have to wear this. And he takes it off. So my thing is, you guys have a really tough decision on your hand, and I also thought whenever I came in here, you guys had already made up your mind. You weren't gonna listen, and so I'm like, why am I losing money by taking time off work? And I was pissed because you guys did this at 2 o'clock. Now I understand why, because we're sitting here at 9 o'clock, and I'm the last person. But anyways, I feel like it should be my right to choose whether I want to wear a mask or not wear a mask. And if you're scared coming into my barbershop of getting COVID, then why are you coming into my barbershop? You know that I'm gonna be touching you. And if you're wearing a mask, which I've heard, the arguments on both sides, and I respect that, but if you really don't think that your mask is working and it's only stopping, from me to you or you to me, then don't even go out into the public. It's not an emergency. And a lot of people got up in arms about oh, well, I'm mad because they said as a barber, I'm not an essential business. I'm not an essential business. I feel like all of us are essential, but technically, no one's gonna die if they don't get a haircut. But at the end of the day, when people can't go get a haircut, I have to feed my family. I have 2 kids, a wife, a house. I employ 4 people. They have wives and children. And I don't know, I don't wanna ramble like a lot of people have, but you guys have a huge decision to make. I don't envy you guys. I don't envy what you're choosing, but I really do think that being that we're a tourist town and that this is unpopular to some of the people that spoke, but this is a predominantly conservative town, and the people that are coming here because this is Branson, it's family friendly, we believe we're in the Bible Belt. And by you guys taking a stand tonight and saying that we're not going to mandate that people wear masks, I think you are going to see a massive insurgence of just tons of people are going to come here that think all this is BS. And I'm not saying that it is BS. I know that the virus is real, but at the end of the day, I think that you have a chance to make up for there's a lot of other words I want to use, but a buttload of money that this city has lost on tax revenue, and people in my shop that are like, oh, well, I don't care if tourists come here because it doesn't affect my job. Bullshit, it does affect your job. Everybody in here is connected. And when people don't go to Dixie Stampede, those servers don't come in to get their hair cut because they don't have the money or they're laid off, and it's like, or they tip me better when they are working and they make more tips. Like, we are all in this together, and I think we're all adults here, and I do not think, and I think most of you know, and never thought whenever you got into the position that you're in that you would be making a decision that, in my personal opinion, infringes on my right to choose whether I want to put this stupid piece of cloth over my face or not. And this is and I almost didn't come in here because of this. I'll stop, because I know you guys, everyone's been here for 7.5 hours, but the only other time I've worn a mask was to go to St. Louis with my son, who's about to have his second heart surgery in 2 weeks. That is the only other time I put a mask on. And if you don't think I give a shit about my son's health, who's immune compromised, I'm sorry, but you can meet me outside in the parking lot and say that to my face. That's all I have to say. Thank you.
I'm not sure I understood that, but okay.
You're not sure you understood what I just said?
About meeting out in the parking lot. What were you talking about?
If you think that I don't care about my son's health by not wearing a mask, that's my choice, then you can meet me outside in the parking lot.
Were you talking to me, or were you talking?
No, not you. I'm just saying, like, in general, like, people in here. Like, I'm saying I care. No, I sincerely respect you guys. Yeah. No.
Thanks for the clarification.
No. Yeah, no.
You were looking right at me.
Sorry if I was misinterpreted. But I really do thank all of you guys that came out, and for you guys for sitting. Yeah. Just for the message, I need to take the
All righty. We finished with the public speaking. Any aldermen wish to speak to this issue?
I'll jump in. I want everybody to know, let me get rid of this. Whew. I came into this meeting with opinions about how I was going to vote tonight. I do want to say that I did form an opinion, but I also came in with an open mind to listen and gain more information before I made a final determination. I really want to thank everybody in the community that has reached out, taken their time, and shared their input with us. I've personally received 171 communications, combination of my alderman phone, my personal phone, email, text. I did stop checking after noon today, so if anybody sent it, text in. What I intended to do, however the meeting went long, was out of all the messages I received, I summarized some that had common messages that I was going to read, but we probably heard a lot of them today. A couple of note is, I know there's a question with the masking and how it'll affect Branson's business. I believe this person wrote to all the aldermen. It said a shop owner at SDC wrote that SDC has become a ghost town since masks were mandated. SDC is lucky to get 3,000 visitors in a day, and she was asking, will that same result happen in Branson? I know that, I'm going to put all that aside. The serious questions I have is there is a lot of conflicting information out there. Branson we made the decision early on to go to essential businesses and close everybody down. No other communities in Taney County followed suit. And I can tell you that Hollister's fiscal year starts April 1st. Hollister's sales tax year to date is up 14%. And I'm a little concerned of why the city of Branson is facing this choice when, if it's really as serious and it's really as troubling as our Taney County Health Department is telling us, why wouldn't we be doing this county-wide? Right? I mean, I'm dumbfounded that the seriousness that we're faced with this bill tonight affects Branson. And if you look at population and statistics, Taney County is what, 56,000 or so. Branson's 12 or so. So Branson is 20% of the population in Taney County. I would think that instead of singling out Branson once again, well, I don't know why our medical professionals aren't convincing the county, to take this action. I promised Tina Cooper I would read her email, and instead of reading her email, I'm just going to read her questions. She was asking, is it true that wearing a mask can affect the immune system? Is it true that a mask should not be worn by people with respiratory problems? How are we to determine who must and must not wear a mask due to health conditions? Is it true that people can pass out from wearing a mask? Maybe it's too tight or they get too hot. If a person isn't properly wearing a mask with their nose and mouth uncovered, isn't it just as ineffective? I see this frequently around town. Who is responsible for making sure these people properly wear their masks? What is a proper way to keep a mask clean? What if people don't wash their masks and wear it time and time again? Doesn't that defeat the purpose? And I think we heard a lot about that tonight. If our guests are required to wear a mask, will they have to keep them on for the entire performance? When does it become an infringement upon one's rights? I'm asking this with the utmost sincerity. Is it true that people that have tested and received a false, or people have been tested and received a false positive? I've been told those positives were not retracted and still remain in the COVID count. I apologize, Tina, but the hour is getting late, so I'm going to have to leave this. I was asked by a couple theaters that in our proposed bill, it talks about the exception of people wearing masks when they're at a restaurant, eating, or drinking. Had a couple theaters owners ask me that if somebody's at their performance and they have popcorn and a Coke, would they be allowed to take their mask off while they're eating popcorn and Coke? And I think that's a fair question. I'm going to, just before I walked out the door to come here, I received an email from Bob Nichols. And what he sent me, I just thought it couldn't be true. And I went to the CDC website, and I actually printed this off from the CDC website, and I think this is really important information. So I checked with Lisa. The protocol is I'm to pass this out and give you a copy. Is that?
She'll pass it out. She'll pass that for you, Larry.
Okay, thank you.
Thank you, ma'am.
What's being passed out, I want to reference, and I apologize, I don't remember the lady's name, who gave us this sheet and was talking about the deaths in Missouri. And what she was trying to show was the death rate. I know nobody can see this, but the death rate in Missouri is on a pretty steep decline. What I just passed out, and again, I know it's late, but I think this is really important. What it shows is by week, nationwide, the number of deaths in our country. By week starting on February 1st. I know it's late, but bear with me. I'm not going to read off the week. I'm just going to read off the numbers and see if you're as surprised as I am. And I think it will maybe influence our vote tonight. February 8th, there was 1. Next week, 0. Next week, 5. February 29th, 6. Next week, 34. 52. March 21st, 563, 3133, 9913. April 11th, 16,029, 16,928, 15,261, May 2nd, 12,997, May 9th, 10,983, May 16th, 8972, May 23rd, 6984, May 30th, 5921, June 6th, 4738, June 13th, 3863, 3258, 2501, July 4th, 1440, and July 11th, the week of July 11th, 413 deaths nationwide. I don't know about you, but when I watch the news, and I do think there's a lot of media hype, and I think that's how they sell newspapers, right? But I'm watching the news, and these numbers nationwide in Florida and all just huge, setting records every single day, right? Huge, unbelievable numbers. Are you kidding me? According to the CDC, in the week of July 11th, there was 413 people died in the week. The week of July 4th, there was 1,440 people died in the week. If I was you, I would question what I just read, right? Because that is nowhere. Boy, can you imagine putting this on the news? People would change the channel. They'd lose interest in the story, right? The story would go away.
That's why they quit reporting deaths on cases.
So I know the cases are going up, and there's a lot of different opinions of why. I will say that in Taney County, a couple weeks ago, the National Guard came in, and we had 931 tests over a 2-day period. I've had many people ask me, boy, Larry, our numbers are up to 126, they're up to 136, just wait till the National Guard numbers get in. Well, the National Guard numbers are in those numbers. And if we tested 931 over a 2-day period of time, I think we're gonna have increases, right? So I'm not trying to downplay this. I know COVID's serious. I know the number of cases, at least what's being reported to us, is growing like crazy. July 11th, 413 deaths in the country. Whew.
Mr. Milton, are you still
No,
going?
I'm still going. So I've took some notes on our ordinance. This was mentioned earlier by somebody, but in one of our, oh, it's not a whereas, but it's pretty close to whereas. This is in our ordinance. Taney County has seen an 846% increase from 13 positive COVID cases on June 6th to 123 positive COVID cases as of 2 p.m. on July 12th. I know this is a very emotional issue that we're talking about. The opinions I'm going to share are based on facts. So what I'm going to share are fact-based. I know the mayor questions my facts, but that's okay. I try to operate in reason, logic, common sense. So I want to be, especially in an ordinance, I want to be careful about just quoting percentages. An 46% increase. I mean, that's pretty alarming. But when we talk about just percentages and we want to not provide maybe the whole picture, I can also tell you that the numbers say recently we had a 50% increase in deaths in Taney County. sounds alarming. 50% increase. When the truth is we went from 2 to 3, right? So I'm a little offended with some of this language we have. I think it's stoking more of the fear. There are counties and other states that are experiencing a 20, 25, and 30% positive COVID cases. I believe I had some figures, but I believe Florida was around 27% of those that tested positive. When we take our numbers here in Taney County, out of 1,350 cases, when we had 123, I know this is probably a week old, we're running about 2.8%. So I know we've heard from some medical professionals that Taney County, isn't doing so good. At least that's what I heard. Putting in perspective, I think, in my opinion, we may be premature pulling a trigger on a bill that mandates masks when we look at the national death statistics and where Taney County sits. I know a question that I did get answered from William Mahoney was, when I asked him how many COVID cases are at Cox, they have 0. But he did say that he shared that they transfer those up to Springfield. I'm still talking, Mayor. Sure, I get a low battery. In our ordinance, talk about 79.380. In fact, if there's a chance, can we put the ordinance back up on the board, please? This has come up, if you'd go to when we reference section 79.380. Anyway, it's mentioned a couple times in here, and I'll read it. The authority of this ordinance is laid out in section 79.380, which permits the Board of Aldermen to make regulations, pass ordinances for the prevention of the introduction of contagious diseases in the city and for the abatement of the same, and may make quarantine laws and enforce the same within 5 miles of the city. That's come up before. I believe I've asked Chris, I think we all know we can't enforce this within 5 miles. I don't think Hollister's gonna go for that. So I'm just questioning why we couldn't remove that.
Can you scroll back up real quick? Let me explain this again. Scroll back up. Go down a little bit. Stop right there. He's referencing line 51 through 54. That, as we explained at the outset, is a whereas clause. It's just a statement of the law. The actual ordinance that is being proposed to the board for their consideration does not include anything about enforcing this within 5 miles of the city. This is just simply a restatement of the law showing the authority that the board can act under, as we discussed 7 hours and 12 minutes ago.
The 3 hour, 2.
Okay, let's say it's not on line 51, Chris. Let's say it's addressed somewhere else.
It's not.
Okay. That paragraph I don't think says, where'd you read the 5 miles? Oh.
It's on line 53.
Okay, this reads, the authority for this ordinance is laid out in section 79.380, which permits the Board of Aldermen to make regulations. Is that what that one says? And pass the ordinance, is that what that one says? No. No.
I don't understand the question.
I know, because I just don't have that exact thing here, but when we go through this again, we'll find it again, because this is not a whereas. It's also addressed somewhere else.
It's also pointed out in the staff report, which is not a part of the ordinance.
This isn't in the staff report. It's right above where it says this ordinance has the following components: requires individuals to wear face coverings while in indoor and outdoor public spaces unless they're engaged in certain activities. We'll run into it when we go through the bill or the ordinance.
All right, let us help you, Alderman Milton. I'm going to go ahead and pull up the staff report because that's what you're thinking of. If I can make this mouse work. Okay. This is the staff report, first document where staff recommends.
Oh, I stand corrected. It is in the staff report.
And it's right there. Again, all that I'm restating there is the law that gives you the authority to do this, just like we talked about Jacobson and the police power that's vested in the city. Nothing more. The ordinance, if we were to enable this portion, allowing to enforce it within 5 miles of the city, that would be within the ordinance. It would specifically say that.
So we have the authority to do that?
Legally, you do. The ordinance is not written so that you do that.
Not in the ordinance.
Not in the ordinance.
Okay.
And Ms. Westfall points out just a real simple way to think about this, and it's a great way to think about this to kind of help you out. I'm going to shift back over, or I'm going to let the person here at launch control shift back over to the ordinance. Easiest way to think about this, the ordinance begins at line 56. Okay, if you scroll up, everything, that's the now therefore clause. Everything above that is just memorializing background. That's what the whereas clause is why are we doing this? What's some facts to support why we're doing this? That way, if there's ever a question as to interpretation of the ordinance, or in the future, if you all do decide to go forward with this or a version thereof, I've heard about 4 amendments that you all, I think, are maybe potentially considering. Then when in the future, we have to look back and go, why did we do this? We have some context to it.
Okay.
All right. Really simple way to think about it.
When we talk about exceptions about swimming pool, I was asked from Grand Country, does their water park fit within that description?
Yes.
Almost done, Mayor. Okay, and I think when we get into the penalty phase, I'll have some more questions on the enforcement of those. So bottom line is, this is an emotional issue. I don't know, when I do a risk assessment, I can't find it in my end analysis that the benefits of passing this bill outweighs the trade-offs of the cost of this bill. So I'll be voting no tonight. Thank you, Mayor.
I'll try to approach this from a different angle here. Referencing the email from Tina to Alderman Milton, I think she had every question I had on here too. So where that puts us, instead of trying to jump around to email after email and try to piecemeal this, right now, there was a large contingent that wasn't here tonight. Partially the reason is I have over 200, maybe 240 correspondences here. The large percentage of them for people who come here that are not here right now, discussing that. So we have a lot of voices here that were heard about certain things, but there wasn't a lot of input from our actual businesses. and our attractions and our shows. So, I mean, we almost need to have to go down section by section and start addressing attractions, restaurants, lodging, retail. It's such a broad stroke right now, there's no detail in it. So as it sits here right now, I couldn't vote yes on this as it sits, because we haven't even started to dig into this, addressing every sector of what happens in this town. And then there's subsections that go about workforce and childcare and seated school and how all these things affect one after another. It all cascades down. So right now, I mean, I'm down for it if everybody else is, but this may take a while to go line by line and get input. But a lot of the input I'm looking for, I didn't get tonight from basically stakeholders and business owners. So that's my comment.
Alderman, it is true that we received an awful lot of emails. A lot of the emails that I forwarded on to you all were from people that did not copy you originally. And so a lot of those emails came from people in the community. Just to also share just a little more information, the testing issue, if you all remember, there were 400 tests that were done back in latter part of March, first part of April, and 355 people actually showed up. They reserved to come, they showed up, and none of them tested positive because the sample was, if you feel like it, you can come and get tested. I think the reason we had some in this last time is some people had symptoms, and so they didn't have to have the doctor's order to be able to go. So the data is misleading. We had the earlier one and nobody tested positive. So to say that tests are going to cause more results, it has a question to it. I think it's important that we discuss this, and if we need to go line by line through the ordinance, let's do it.
We have it ready to start talking about, Mayor.
Yeah.
Mr. Mayor, before we do, can I go ahead and offer just a couple observations based on previous comments by Alderman Milton?
Sure.
By Alderman Simmons, and also by the lady with regards to weddings, and then I think there was a comment about funerals. I have written down those notes as potential things easy things to look at, if you will. The first thing, just kind of throw out there for you before we start going through this line by line, is Alderman Simmons made a comment that this message, not very friendly, maybe add a please in there, okay? We also heard a gentleman here, probably 20 people prior, talking about he was having challenges printing this on 8.5 by 11 paper, okay? I will tell you this does fit on 8.5 by 11 paper if you use the proper typesetting and the proper margins. With that being said, again, the ordinance says a sign no smaller than 8.5 inches. So first potential change here to think about to address what Alderman Simmons brought up is maybe adding the word please in here, okay? The other point on this piece to point out is there's also a prong here where the city can provide signage. And what I mean by providing signage is we put signage up on the website that maybe is more friendly. Springfield, and I don't like to point to Springfield because, again, they don't have all the answers, and I'm not suggesting that they do. But their health department went through very great lengths to build signage that businesses could use. There's nothing that says we can't do this the same. This ordinance provides that opportunity. So that's the first change that I have documented. Again, maybe that's one that was on Alderman Say's list. Second change that I have documented, this all was something that Alderman Milton brought up, was the fact that I think there's quite a few people in this room that have heartburn that we're giving the ability to the emergency management director and the city administrator under the proclamation made by the mayor to extend this out longer than 30 days. This is an easy thing to drop, okay? We heard about board can call a special meeting, mayor can call a special meeting. we can just let this thing die on the vine on that 30-day window, make that amendment, and then drop this section. Okay, so that's the second thing I heard. Third thing that I heard, and I think there were two ladies that came out of the gate, 5 or 6 deep, and they were talking about kind of the wedding industry. And then I had a conversation with somebody about photography. And then that started me thinking about funerals, okay? Those are all very serious life events that maybe we should address. So with regards to that, I have a couple ideas. If the board wants to, we can add a couple additional carve-outs here. The first being that any person during a wedding ceremony or while photographs of the wedding ceremony and reception are taken. So again, so that that person's special day and that wedding party's special day is not spoiled by a face mask in a photograph. Second potential carve-out we can put here would be any family member of a deceased person during a funeral, intermittent, or memorial. So again, taking the face mask out of that sad day. So again, those are the 4 things that I have put notes on. I'm looking to Lisa. If those are things that the board thinks are important, we could move, one of the board members could make a motion to move those in. We can make an amendment, vote on that, and then start working through this and the list of items that Alderman Say has. So I'm just going to stop there.
Gentlemen, what's your prerogative?
Just for clarification, Chris, when you talked about funerals, you were thinking of exempting family members only? Is that what you said?
Any family member of a deceased person during a funeral. That's how I have it written, but again, you're the board.
Yeah.
I'm just trying to come up with language to help facilitate this if this is something the board wants to consider.
I just had 2 pages worth of stuff and I'm numb after 7 hours and 25 minutes. I've heard the same thing in 162 emails and telephone numbers, calls from people. I'm sorry, I need to pull this a little closer. So excuse me if I sound a little punch drunk. I'm freaking tired. Ed and I, we started at 9 o'clock this morning and went to 12. We broke, tried to eat, and came back and did this. I didn't sit real nice for a lot of the butt chewings that I got that accused us of wanting to do something we don't want to do. Okay? Just be real honest with you. I'm not for this ordinance as it's written. Why? I don't think it's enforceable. Now, am I for mask? I'm wearing it. I've got a daughter with lupus. I found out yesterday morning I've got a nephew who works at a military base in Louisiana where I'm from that has it and went right through the mask. I have a niece and a sister-in-law that own 2 shops here in Branson called Peter Engler Designs. She's got COVID-19. Guess where it went through? I'm not convinced that these things work, guys. But will I wear it? Yeah, because I've got a daughter with lupus. And like this one gentleman said, I'll meet somebody out in the parking lot that think they're coming in my house with my daughter having lupus. I mean, we're going to scrap. It ain't going to happen. It's just not going to happen. And I don't mean to upset anybody's apple cart. I believe you ought to wear them. I don't think that it causes headaches or it causes dysentery or anything else that I've heard that's out there. I mean, it is just absurd, the things that I've heard. Called Ed and said, look, Ed, I've had enough of listening to this stuff, some of the wackiest stuff I've ever heard in my life, over wearing a mask. But do I think the city needs to mandate it? I don't think so, unless there are some other terms and conditions that are out there to make this more palatable. Because I strongly suggest that they're worn. You know, be safe, wear a mask. I don't want to see people go inside these buildings in here and start getting in fights with people like it's happening all across the United States. I think it will affect negatively our tourism. I don't want it to, but I think it will. So with some reworking here and some thought in this process, can I support it? Yeah, as it's written, not necessarily. And why? Because I don't think you can make people conform. I think there's a gentleman a little earlier that can't even pull their britches up in Walmart. I mean, Lord have mercy. I've watched them go in coughing and hacking into places. I think it was Target. This guy was, and he wasn't wearing a mask. I was going, what on earth are you doing this for? I refused to even enter at that time. Why? I got a daughter with lupus. Have a little sympathy for the devil here. It's going to take me a minute to gather my thoughts on that. Jeff and I talked about some stuff this afternoon, and I had asked him to take sort of the lead on this. I think we need to be a cheerleader for safety. I can't remember what doctor it was I talked to, but there's 3 things that you need to move forward with in this. And I do think a mask is interwoven to this process. Mandating it, I'm not for it. Social distancing and hygiene. And let me tell you something, we got problems with people not doing their hygiene exactly just right. And if all those things, if something falls through that, I don't care how many of these things you wear, if you don't practice social distancing and hygiene, I don't think it will. All 3 of them together must be done. And it's very difficult to me to think that that's required and then send our officers out there on a wild goose chase every time Tom, Dick, and Harry says, hey, I saw Brian out there and he didn't have a mask on. I think you need to arrest him. If somebody called, they don't need to be out there making a nanny state out of this thing. That's what I'm really concerned about. I'm just being honest. I'm a realist and break it down to its bottom line. So how can we do this where somebody's not out there whining that Brian's not wearing a mask or Larry's not wearing something or he's not social distancing? I just think it's natural for it to happen. I'm a realist. I'm a common sense person. That's all I'll say about it. Anybody, if we can work through this thing and get myself satisfied that we can do something that does not create strife within this community. I don't think that when they put this together, they intended on causing any strife in this community. Why? It's not a political issue. It's a public safety, common sense, and personal responsibility issue. How do we do that, Brian? You know? I don't think it's life, liberty, pursuit of happiness. It's common sense. It's not political. It is personal responsibility. It is public safety. It is saving our kids, our grandkids, our friends, our disabled, whatever else. Is that enough?
The other Alderman.
What part of this discussion are we in?
Both.
We're in a part, I think we're recognizing that all of us are pretty tired.
Yes.
And going on. I think what I heard is that the way it's written right now, and I hate to try to do something on the fly, particularly when we're tired.
Yeah.
And so I guess what I'm really probably wondering is if the aldermen wish to do this again.
On fresher brains, I can't imagine that.
Do we want to come back with a revised so it's not on the fly? Do we want to seek to have a special meeting sometime in the future?
Well, let me say, I'm going to.
Yes.
First of all, thank everybody for coming out tonight. I had several emails from Ward 3, and a lot of it actually was a little more towards in favor of it. But I think we need to straighten this up more. The other thing I'll say too is I don't know if the health department can give us this data, but I know we have several people that come here, like in my business, I find out that when that person gets back to their home outside Taney County, wherever it might be, they test positive. So that's not in our numbers in Taney County, but I just want you to realize too, we have lots of visitors that are coming here that bring it with them, and then it's left in our community. So if there's any way that we can figure out more of that number too, I think it will help with part of this.
Good point.
Thank you.
I would like to just make one comment. I really, in reading this ordinance, I really thought almost all of the teeth were taken out of it. It's about as watered down as you can get. And the reason is that If you see someone not wearing a mask and you ask them to put a mask on and they say, I've got a medical reason not to wear it, that's all we do. We don't press them for that. We don't, the ordinance says you have to have that, but we don't ask them for it. So therefore, they really don't. It's not obnoxious from that standpoint. The enforcement is what I've been concerned about all along. However, it seems like that the chief has got a plan for that. It's not one to go out and start writing tickets to tourists. It's common a warning, and probably what you would end up picking up would be people that were either belligerent about it or people that were just repeated offenders, or a whole group or something that was offenders. It would be unusual cases where you would actually write tickets for this, because writing tickets is not the idea. Compliance is the idea. I personally think that this is a fairly small price to pay, and it was said a couple of times for those, and nobody has more trouble wearing a mask than I do. I don't breathe well. I've got all kinds of health problems, and the glasses fog up. But it's worth it to me to wear one when I'm out. Now, it's not worth it to my wife. I have criticism constantly, daily. I tried to buy what is this mask, Jamie? Vera Bradley, because I thought she might buy a Vera Bradley mask. She might wear that, but I was wrong. I was incorrect. So I understand why people are not wanting to do it. But again, to me, it's a pretty simple thing that we can do that will help to some degree. Will it be 10%, 80%, 90%? I don't know how much it helps, and I don't think anybody else does either. But it makes common sense that it would help. Now, I'm certainly not against moving this to another time if we're going to recraft the bill, and then we'll either pass it or we won't. I mean, that's fresh your mind.
What Bob said, could it then be allowed to be personal choice?
Your Honor.
Yes, I'm sorry. I'm sorry. You're speaking from the audience and not at the microphone. Yeah. No. I'm sorry, Brian.
3 times.
Mr. Mayor, can I make an observation here?
Sure.
It sounds like there's pretty much a consensus amongst the board on which way to move today, and I don't mean to speak for anybody, but here's the situation, and I think Alderman Simmons, I spent a lot of time, as he suggested, trying to water this down, okay? Any changes we make to this today is only going to increase its complexity, and it's going to make enforcement a challenge to our chief and our police department, okay? Let's talk about some facts that were not put into play today. Taney County Health Department passed a resolution, encourages the use of face coverings countywide, okay? That's currently in place right now, okay? They've been working on messaging. They've been working on all sorts of things related to the thing on the front of my face. So I think we're just going to be at this point, because this is so watered down, spinning our wheels on what is here. My suggestion, again, not trying to speak for the board, but just trying to give you a path, is vote on this today as is, without any amendments. And then if we need to, we come back and visit this a different day and let the health department do what the health department's doing. Again, because it sounds like that's kind of what I'm hearing here. And I'm not trying to get out of doing any work, but I don't see any way to further water this down other than dropping fines lower. And at that point, it becomes a resolution. It really does. And that's the point that I'm trying to get to. If we water this down any further, it becomes a resolution, it becomes a recommendation, and there's always already one countywide. So I was going to say that, leave it at that.
You've heard that. Does any alderman wish to call for the vote?
I'll call for the vote.
Is there a second?
We have the vote, we have motion second.
Oh, it's already on the,
I'm sorry?
yeah.
Then can I speak again?
Yeah.
Okay, if it's already on there. And the only thing I see wrong with that is the problem is that we have encouraged masks as strongly as you can, and the health department has done it. Maybe they're going to have more luck, but we haven't had any luck. If you're out about town in the last 3 weeks, there are probably a lot less people wearing masks today than there were 3 weeks ago. It's going the wrong direction. So we're really not helping the problem if we dump it here. I would rather we would set another time for it to come back, but it's on the floor, so.
I'd like to come back with a
Ed? Yes, Jeff C.?
My issues are more about clarification. And, you know, and there's other things that I want to change too, or I'd like to see changed. But mine is more about clarifying them, like I said, trying to break it down to apply to certain sectors of businesses in this town. And, you know, trying to make it work as best we can, where everybody leaves out of here relatively happy. But mine are more clarifications and really wanting to strip it down and really try to change it.
And Alderman, on that point, there's another fact that we did not discuss here today. I just want to throw this out here. Part of when we implement something like this, if the board decides to go forward with a version of this or some flavor of this, is there's a media push behind it. Ms. Pettit's somewhere in the building still listening attentively. Previous board has seen this where we push out an FAQ, we put up specific hypotheticals. We start that education process immediately after a passage of something like this. We did that with essential and non-essential businesses. We did that when we started going down the occupancy load path. So again, those specific scenarios, city's ready, willing, and able to educate the public on those. But again, this is watered down in such a way so that it can encompass all of those. So, again, I'm just going to leave it at that. But again, another fact that we need to consider when we're considering what path to go, whether it's to postpone this, whether it's to vote on it, move to postpone, whether it's to vote on it, or whether it's to do something else.
Okay, I think I understand the two options. If we have a motion to postpone, we have to give to a certain date. Is that correct?
That's correct, but just keep in mind, if you have a motion to postpone, it's going to postpone it in the format that and the language that it is in currently.
Without any of the
with no amendments or anything. We have no amendments or anything done, so it's going to postpone it. It will come back in the format that was presented at the beginning of this meeting, in the same language.
But like Chris said, if we water this down anymore, I mean, a mandate is only a mandate if it's enforceable, right? And there's penalties. Other than that, it's a recommendation. So I'd be in favor of putting this up for a vote. And right now we have a recommendation.
Trying to follow procedure properly. If we have the vote on the floor, then all I would do now is call for the vote.
Mm-hmm. Yeah, we have a motion on first reading. It's on the floor as presented at 2 o'clock this afternoon. It was presented, and you have a motion and a second, and it's ready for a vote. As it was presented with no changes.
Then I would like to make an amendment to this of the 4 items that Chris read to us earlier. Regardless of what happens with it, I'd like to get the amendment on that.
So we
Okay,
have
there's a motion to include the amendment.
Yeah.
Is there a second?
I'll second that.
Okay,
So that we're going to vote on the motion to...
Hold on just a second, Mayor.
Okay.
Let us catch up here, sorry.
Let's catch up here, and I want to read this into the oral record so we're clear on what the amendments are.
Yes.
And Ms. Westfall, any additional things I need to do to make sure
No,
that we
I
get this?
think you had it. We had it. I think we caught them already.
Okay, so let me walk through
Go to
this.
top.
I'm going to start at the top if I can figure out launch control here. All right, so the First Amendment, back up, hold on. Make sure I got it all. Okay, yeah. The First Amendment is we are going to change the period on number 12 to a semicolon, drop the and that was right there on number 11, strike it. That's line 125, and we're going to add in item 13, which encompasses any person during a wedding ceremony or while photographs of the wedding and reception are taken, semicolon, and number 14, any family member of a deceased person during a funeral, interment, or memorial. That's the first amendment as a part of this package. The second amendment is on line 148 on page 3 of the ordinance, which adds the word please between well and go home, as outlined in red there. The next amendment is going to be, we're going to add a period after entirety on line 180 and drop the language unless extended by the emergency management director and the city administrator. And then we're going to drop the entire section 4 from line 183 to 185. So the way the ordinance is currently written as to this regard is it will only be effective for 30 days. Do we want to, so that's what those are the amendments right now. So if there is an intent here or a desire to postpone this, do we want to address the dates in section 3? We'll just leave it as is, and then so we got those 4 amendments as outlined in this workup.
Is there a specific date any alderman wish to?
So before we go on, I'm sorry, but if these are okay as outlined, or if there's discussion on it before, but if you want to put a motion on the floor to get these in as amended, that's the amendment. And we'll get that done. If that's how the board wants to proceed, then it will, as soon as that's done, if that would be approved, then it would sit in that format immediately as approved with the amendment as outlined.
I'm pretty sure we don't want to pass it like it was originally on there, so the most we would consider would be what we're amending here.
Right.
For clarity, Chris, are you saying the date needs to be changed also if we're going to do it?
No, I mean, we can come back later. Right now, the ordinance comes into effect, full force and effect on July 20th. Let's say hypothetically, you all decide to postpone this. When this comes back before the board, we'll have to make a further amendment or request a further amendment. Just talk about the timing, whether it's 30 days, 6 weeks, when does it start, when does it end, yada, yada, yada. So again, all that we're memorializing today are the amendments as we discussed.
The motion's been made and a second's been given for the amendments.
Is that right? Are you, as presented, you're okay with that? Alderman Simmons and Alderman Milton?
Yes. Any discussion on part of the board? I'd ask you to vote on the amendment. Yes, 5. 5 present, 5 votes. And there's the actual votes. Simmons, Skanes, C., Whitus, and Milton all voted yes. All right, now we're ready to go to the original ordinance motion.
So we have the motion still on the floor for the original first reading as amended now. So those amendments are included. You have a motion and second. You would be ready for a vote on the entire ordinance, including the amendments that were just made.
All right, I think Aldermen are clear.
Or you make a motion to do something else if you want to amend more, or
Because if you go to a vote right now, you're going to kill this.
if you,
Okay, or you're going to approve it. I heard some consensus out there that there's a potential we may want to postpone this.
That's what I wanted to
So if we want to postpone this, then a board member will need to make a motion in a second. Postpone this, as Ms. Westphal always says, to a date certain, and then we can bring this back up before the board and consider potential other modifications. So again,
but,
excuse me, those are your 2 paths, and then
and as soon as you make a motion to postpone, all other motions or other options stop at that point, and no additional discussion on the current form of this ordinance. It would only be on the postponement. So should you want to have any other discussion on what you might want to see in the future or anything,
it's done. That's
other
all.
way it's done if you, as soon as the motion to postpone occurs. And I don't know if you need more information.
No, it's clear.
So
Thank you, Lisa.
I think for clarity, if we vote to postpone as we have amended, and we set a date specific in the future, or by a certain date, correct?
It'll be a date certain, okay? And then we can always potentially call a board meeting ahead of time, okay? The key point I think that Ms. Westfall was trying to tell you is that if that motion's made and seconded, the only conversation that's to occur is on whether to postpone or not. We don't want to get into the weeds about the content of the ordinance, any changes that Alderman Say has ideas on, or Alderman Whitus, or Alderman Milton. It's just,
shut up.
Or anything that you want to see come back in the future, you would have to wait till the future.
Date and time of the
If you're-
meeting, and that's
Yeah,
it.
before we do that, I would like to make a motion to vote on this as amended.
Second?
Alderman C, second.
Okay, so
We have a motion on the floor right now.
let's call, I think you want to call for the vote, because I have the motion on the floor already, a motion and a second. So are you you're asking a motion to call for the vote
Yes.
as it exists right now?
Yes.
Does a call to postpone supersede?
I hadn't had a motion to postpone yet, but yes, it would.
I'd like to make a motion to postpone it.
I've
Can
already
we
had,
vote on this?
I already have a motion
He has a motion and a second, right?
Want to make a second?
they called for the vote.
I mean, I already had it, right?
Yeah, it's done.
If we can.
There's-
They're saying we can.
There's a motion from Alderman Skanes and a second from Alderman Simmons to postpone.
No.
No.
No. If I recall, there was a motion to call for the vote by Alderman Milton. Alderman Say seconded that. I see a nod of the head. That's on the floor now.
Okay, then I ask if then there can be another motion to supersede that motion.
No, not at this point, because you can motion, you have a motion on the floor.
No.
Okay?
You have to check that one. You're postponing on top of a motion.
Yeah.
On top of a motion.
Can we take 2 minutes? This
Because
is,
you have two motions on the floor, actually, right now.
We've got about 9 more minutes before we have our 8 hours in.
Yeah. Full day.
we had our 8 hours in about 8 hours ago.
That's the same as if they stop it right here, they postpone it, it comes back, exactly the way it is now.
Mr. Mayor,
It's over here.
I'm sorry, sir.
Just asking.
Yeah.
You guys are as confused as me, so.
yeah, I just can't, I got to go back here. I can't see with. Here we go. 79. That's what I'm looking for.
My intention is not to kill this thing, if you put it off and have further discussion.
Yeah.
That's the intent.
Well, that's your intent. That's not others.
They call for the vote. Secondary motions, here we go.
So we have a motion and a second
Let me just do it this way.
on Larry's deal.
Yeah, on the original vote, yeah.
Jeff, you still want to hold with your second? Okay.
Here we go.
Tired hurts.
What, hazard pay?
Motion's missing or?
As we sit here, the headline is Georgia governor sues Atlanta city's mask mandate.
Yeah.
So the big question, Lisa,
And then
is whether
the
a
Oklahoma-
call for the vote is a main motion. Because postponed indefinitely.
That's the governor.
What's that?
The governor of Georgia.
No, it doesn't.
Stated he wouldn't enforce one.
Motion to vote.
That he would not.
I think the same thing, but I can't find it definitively. Hold on. There we go.
Oh, and no, nobody is getting paid under the table to do this. We're paid $10. Let's get that straight.
Above the table.
Above the table, okay.
I don't.
Yeah.
$10. Going once, going twice.
Intense there, that's the problem.
Well, the mayor gets a bunch more, don't you, Mayor?
I'm looking at Ordinary here.
$1.95 plus tax.
I get an expense account.
We're going for ribs then.
That's right.
That's not under that expense.
Oh, okay.
It's not? Ribs aren't included in an
They're
expense?
specifically excluded.
Excludes ribs?
It's been more than 2 minutes, Chris. You're on the clock. Lana May, is that you back there? Hey. Couldn't see behind those foster grants.
Is this not like an amendment to the original motion that you would?
It's not. The issue that that's rubbing us right now is the terminology that was used by Alderman Milton is not terminology that we typically see in Robert's rules. So that's causing the confusion right now. There's usually a main, you got the main motion and then you've got subsidiary motions. So the question is, does that constitute a main motion that can get overwritten by a subsidiary motion, which is to motion to postpone? So.
And the wording of motion for a table would be, has to be taken up later on in the meeting. So that's the only option.
No.
So, Mr. Mayor, it may be helpful if we could just have a 5-minute recess.
Oh, you got it.
And I know it is like 1 o'clock in the morning, but I think that'll help us get an accurate answer
Okay,
for you.
5-minute recess, please.
going to try to restate what just happened and then restate where we go from there. Okay, we had a main motion made by Alderman Milton, what we would call a main motion. That was basically to call for the vote. Alderman Say seconded that main motion, okay? Then behind that, we had Alderman Skanes make a motion to postpone to. We never got, did we pick a date at that point?
No.
Didn't get that motion on the floor.
Okay, so what you can do, that would be a subsidiary motion that would override the main motion, so it can be made and it can be voted on. So again, if Alderman Skanes wants to make that motion, somebody.
I'd make that motion to postpone this discussion and the vote till next Tuesday at 6 o'clock.
Okay.
In these chambers.
Second?
Okay, so we have
There's been a
Alderman,
motion and a second. We vote on the postpone it?
I think Alderman Say seconded.
Oh, okay.
So now we have a subsidiary motion that overrides the main motion. Now that goes to the floor for discussion again, and like the framework we just laid out, we discuss whether to do that or not the actual substance of the ordinance.
Any discussion in regard to the motion to postpone?
Thank you.
Hearing none? Oh, there's one.
Hold on.
Yeah.
I won't be here.
Oh, that's right. You're going to be traveling, aren't you?
I'm out of town next week.
Yeah.
Is he out of town on Monday?
Yeah, he's gone.
If we make it till 8:30 tomorrow night, that's when I leave.
You going to put it out a little farther?
And what, ma'am, question?
He just asked if we could put it out further. Give it a week.
You want to push the date out farther?
Well, I was going to ask, what's your thoughts of postponing? What are we trying to accomplish?
Go back and reanalyze this thing, A to Z, line 1, all the way to line number last. And spend a lot of time rereading it.
Jamie, when will you be back? Will you be back a week from Tuesday?
Yeah, I get back the 26th. So.
Okay, you could go to the next date.
But that's our
Is that
regular.
a regular?
That's our regular meeting.
That's regular.
Okay.
Clear the schedule, clear the agenda.
Can I make amend that motion?
No, but, no.
Well, I want to.
You're on a postponement to the 21st.
Can
Tuesday,
he
the
give
21st.
it by a certain date, postpone it?
He's Tuesday, the 7/21, July 21st. So that's your motion to
That's
postpone.
when Jamie can't be here.
Yeah, Jamie will not be here for that.
We won't have a full board.
So should we take it, what's wrong with taking
Well,
it
we would have a quorum.
Take it where?
the 28th, which is the regular board meeting?
Will you be back for the 28th, Jamie?
Yeah, because that was the regular board meeting.
Mayor, we'd have a quorum prior to Jamie coming back.
No, we can't. Alderman McConnell hasn't made any of the meetings.
Bob, Bill, myself, and Jeff is 4.
Yeah. Well, I just hate because he's been involved in the whole process.
So can I just say, we have a motion on the floor to postpone to July 21st, and I have a second, so do you want to go ahead and vote on that?
You can't amend that date.
Well, you could make another motion later to amend that date. I mean, it would be, if you don't want that date.
Vote it down and then make another date. That's what you're saying. Okay.
Thank you.
God, defeat my own motion. Jamie, I need to ask you when you're available, bud. I'm sorry.
Thought you had my calendar.
I'm sorry.
Okay, right now we're voting on the postponement date. And the wording, Madam Clerk, would you please give us that again?
We have a motion on the floor to postpone this to Tuesday, July 21st. I don't have a time on that, but we'll just leave it at that right now.
Motion.
I have a motion and a second.
Right.
Okay.
Any additional discussion? Please vote. No 3, yes 2. Larry Melton voted yes, Jamie Whitus no, Jeff Say yes, Bill Skanes no, Bob Simmons no, 3-2. We do not meet on that date.
I make a secondary motion to take it to that next Tuesday, which is the 28th. 8th?
Now, that's our Board of Aldermen meeting, right?
Yeah, I know.
Motion been made to postpone till the 28th, the 2nd?
Before we get there, would you want to clarify that at time, please? While we're on this.
You want to do it at 2 o'clock in the afternoon?
Do we,
It'd be better if we did.
I'll set it 2 o'clock, 3 o'clock?
You can postpone it if you want at the regular time at 6 too. I just want to make sure everybody's on the same page and agreed on what time and date. So
I just don't think we should have this discussion during a regular Alderman meeting.
You want to do it a few hours before? Let's say 2 o'clock, 2 o'clock on the.
because you run into your next meeting, you will have to have your other meeting posted at 6 and we'll have to start because they'll be posted.
I understand. Giving us a week, it shouldn't take us another 10 hours.
Madam Clerk, could you read the motion?
What time did you say a time?
2 o'clock.
2, I think. We have a motion to postpone to July 28th, 2020 at 2 p.m. That's 2 weeks, Tuesday.
Second? Second?
Second.
Any additional discussion? All in favor, signify by saying aye.
Got to push the button.
Please vote. Yes, 5. It's been postponed to that date. Any other items to be brought? Okay.
Can I just say, just so it's for the record, that I have postponed this on the motion to call for a vote. Just, that's where it was left immediately, then we had a postponement. So it will come back under a motion to call for a vote, because I have a vote and a second on that. I just want to make clear, so that's what you'll come back to on Tuesday, because that's where it froze in time.
Then we can have discussion in regard to that motion, right?
Yeah. We hope so. We'll figure that out.
And in the meantime, we will put together an FAQ for you all.
Please.
Regarding the action.
All right. Is anyone willing to offer a motion for adjournment?
So moved.
Second.
And there's a second. Please vote. Five aldermen present, 5 vote yes. Meeting adjourned. Already? Thank you all for coming tonight. Thank you for your input.
Brian, don't roll out yet.